Hello, welcome, and thank you for joining us for the Stanford HAI, we say hi sometimes, Spring Conference. Title of our conference today is Intelligence Augmentation, AI Empowering People to Solve Global Challenges. I'm one of your hosts. My name is Russ Altman. I'm a Stanford High Associate Director and also a physician and bioengineer. And joining me today is my co-host and close colleague, James Landay, also an HAI Associate Director at Stanford and a computer scientist. In today's conference, you're going to hear from experts in the fields of education, healthcare, and art on how their work is shifting due to artificial intelligence. James?
Thanks, Russ. A lot of people, when they hear about workplace AI, they think about technology that's going to replace jobs. And that's a fair concern, and it's also an important topic being studied here at Stanford. But what we're hoping for today's conference will show you is that AI can also augment many of the rote parts of our work to improve both our capabilities and our lives. AI can help us become better designers, better learners, better artists, and better healthcare providers, and even better at taking care of our own health. This is where the theme for today's conference comes from. Before we get into more detail about today's conversation, please let me introduce to you Fei-Fei Li, who is our HAI co-director, the co-founder, and my good friend. Fei-Fei would like to offer a few words of welcome.
Thank you, James and Russ, and a warm welcome to those of you joining us today from all over the world. It's really hard to believe that just about a week ago, we celebrated our second birthday of Stanford HAI, and we were reminded earlier that in a week, we'll be also marking the anniversary of our first HAI online conference last year, when we had to immediately pivot when the pandemic hits and hold our COVID and AI conference. So what an incredible time we're living in. Just a few words of HAI for those of you who are joining us as new friends. Stanford HAI was founded 2 years ago, and our intellectual foundation for this institute rests on three major pillars that guide the thinking of the future of artificial intelligence. One is to advocate and believe that the future of AI technology needs to be a lot more robust, flexible, and human-inspired in order to answer all the incredible questions and potentials of this technology. Second is that we believe AI is fundamentally as much a social and humanistic discipline as it's technical, and we need to understand and the social impact and the humanistic impact of this technology so that we can better forecast and guide it together as a society. And the third, which brings to the topic of today, is all of us here at HAI, especially the founding team of researchers, believe that the word, especially the verb associated with this technology should be augment humans, augment and enhance humanity instead of instead of replace. This reflects a belief and conviction that we collectively have here about what this technology is fundamentally about, as James and Russ said, and you'll hear more from our incredible speakers. There is just boundless possibilities for this technology to make our lives more productive, more better the well-being of humans, take humans out of harm's way, and make the society better if we believe in the augmentative capability of this technology. This includes my own research with a lot of my dear colleagues here in recent years of looking at how AI and smart sensors and ambient intelligence can help our doctors and patients in healthcare delivery system. So I really hope that what you will get from this conference is just a tipping point and to inspire you about this incredibly exciting direction of this technology. You will learn from today, the educators, artists, healthcare practitioners who are really making serious inroads into the AI-assisted future. So now with that, let me introduce you also to my very close friend, dear partner, and colleague of HAI's other co-director, Professor John Etchemendy. He'll have a special announcement to make.
Thanks, Feifei. So for those of you who are new to HAI, we have, besides many events on a weekly basis, we hold two major conferences. This is one of them, and the other one we hold in the fall. I'm pleased to announce today that our fall conference is going to be hopefully in person in October, and the conference is going to be called Governing AI: 4 Radical Proposals for a Better Society. What we're going to do is try to explore in detail 4 bold ideas for governing and regulating AI, covering questions like data ownership, fake news, big tech regulation, other proposals of this sort. And we'll be sharing more about this in the coming weeks and days, including possibly the possibility of your providing some input to us on what those 4 ideas should be. So that's our announcement, and I look forward to today, and I look forward to next October as well. James, you want to take it over?
Thanks for that preview, John. Now let's spend a couple of minutes on some housekeeping. Today we have 3 sessions for you. Each session will include a keynote speaker and several short presentations by leading scholars. You will also hear from Stanford students who will give 1-minute presentations on their newest research. We hope to expose people to some of the great student work going on here at Stanford, and we'll finish each session with a panel discussion. At any time, you can ask questions of our speakers on the event website. During the panel discussions, Russ or I will try to incorporate as many questions from the audience as possible. But questions we don't get to might still get answered on the site by the speakers and some of the student speakers who will be on there. Note also that this conference is being recorded. So if you miss some of it or want to revisit it later or share with your colleagues, you'll find it on our website, hai.stanford.edu, or our YouTube channel. And be sure to share your thoughts on social media during the conference or later. Our hashtag on Twitter for this event is #AugmentHAI.
Great. So let's begin. In addition to being an AI researcher, I'm a doctor. And as a doctor, I'm so excited about the opportunities for healthcare providers, nurses, doctors, and others to make use of intelligent assistance, from spotting hard to see tumors on x-rays to wearables that might alert us to swings in the patient's activities of daily life and their capabilities. Caregiving is another key area we expect AI to have a big impact. To discuss some of these opportunities, let me introduce our first keynote speaker today, Deborah Estrin. Deborah is an associate dean and professor of computer science at Cornell Tech. Her work focuses on technologies for caregiving, immersive health, small data, participatory sensing, and public interest technology. Deborah, if you can share your screen, the floor is yours. And also turn on your video.
Apologies. Of all things I was having trouble with, it was my mouse. So let's hope that doesn't continue.
Another kind of assistive technology.
Absolutely. Okay, and do the share screen. Share.
We can now see it.
Wonderful. Okay, so thank you for the opportunity to kick off this session with the topic of tech for caregiving. I did have the pleasure of attending your first in-person event 2 years ago. So home-based healthcare has become a mainstay during the COVID pandemic, but of course the need for at-home care long predates it due to our aging population and the burden of chronic conditions such as diabetes, cancer, heart disease, and dementia. And all of these conditions are exacerbated by inequitable social determinants of health. Starting in the now ancient days of flip phones and Palm Pilots, I joined the mobile health community to explore this sort of outside the clinic healthcare innovations. And at the start, even then, I was motivated to address tech for aging since my parents were then in their 80s. However, even though they both had PhDs in electrical engineering, introducing new technology for their independent use as patients largely failed. And I wandered off to focus on the use of mobile technology for more digitally native populations. In contrast, my real doctor sister used the common tools of the time, telephone, email, and even fax, to engage my parents' caregivers. First, my father as my mother's primary caregiver, and eventually a professional home health aide. So now, 15 years later, I'm inspired by the possibility of leveraging and nurturing advances in computer vision and machine learning and devices to pursue a vision of immersive care, in which mixed reality brings clinical superpowers to human caregivers. Note for me and for many in the field, and as Feifei introduced, the preferred vision is of bringing superpowers to human caregivers by augmenting them rather than replacing them. And so to intentionally develop technologies that support aging in place, but not aging alone, and that upskill rather than de-skill care work. So first, let me start with a few key points about the caregiving landscape. First, statistics on aging of the US population are daunting. Pre-COVID, the Bureau of Labor Statistics predicted that the older adult population would grow from 15 to 23% by 2060 due to life expectancy and declining birth rate. Second, home care really matters. People with cardiovascular disease, from heart failure to stroke, metabolic conditions, from obesity to diabetes, and cancer survivors often need assistance adhering to their medical regimen, whether it's medications or exercises, vital sign monitoring, post-surgical recovery. And the lack of attention to issues early on contributes to what are otherwise avoidable health declines in medical bills. And third, the work of caregiving is itself difficult and complex. Caregivers put in long hours caring for family members or clients with serious illnesses, engaging in a wide range of work from the routine and repetitive to the unusual and urgent. Yet at the same time, care work is undervalued, undercompensated, and underinvested, particularly when it comes to training and tools. And as a gerontologist researcher, Hiroko Dodge once pointed out to me, differentiation increases with age. So patient care paths vary significantly across individuals. And consequently, neither informal nor professional caregivers can be given adequate training a priori to deal with the full range of situations that they will face. And so for this reason, caregivers need access to on-demand, real-time assessment and guidance from clinical experts. So today's guidance from remote clinical experts is referred to as virtual care or telemedicine. And thanks to the previous decades of investments in broadband internet, video conferencing applications, and computing generally, clinicians are able to attend to a core set of patient needs online. And we saw a surge in the use of virtual care during the pandemic once reimbursement kicked in. Today's virtual care technology stack is basically what we're using for this conference now, interactive video. Although more sophisticated products, such as just a sample are up there on the right, are emerging that integrate patient-side biometric devices. And of course, there's a lot of ML under the hood of the high definition interactive video that we almost take for granted today. In the remainder of my talk, I want to look farther out on the AI-powered tech horizon and ask, how could we bring augmented intelligence to caregivers by leveraging precision guidance through mixed reality? So consider this aspirational illustration of an immersive care system of the future. On the left is a caregiver assisting a stroke patient recovering at home. The caregiver has reached out to a clinical expert on the right to determine if the patient's sudden lack of progress in their mobility exercises is a cause for concern, and if they should adjust the physical therapy regimen somehow, or if the patient needs an in-person exam. The remote expert on the upper right is there to help assess and give feedback. And then the lower right, an AI agent would observe in order to provide guidance on future repetitions of the task. To do so, we envision the clinician using a virtuality system to view details as if they were in the room with the patient, and to instruct the caregiver on adjustments to perspective or pose. The clinician's guidance would be communicated to the caregiver through the caregiver's augmented reality head-mounted display, providing detailed visual information overlaid onto their view of the patient's torso and limbs. And in subsequent repetitions of the exercises, the AI agent would be available to provide personalized and even adaptive instructions to the caregiver. Well beyond the physical therapy example I just gave, this would allow a remote expert to provide guidance on a range of emergent home care needs, from assessments of lower limb swelling or labored breathing, to changing dressings on an incision site, or operating some at-home medical equipment such as supplemental oxygen or an IV. While we can't yet deploy such a system to assist with the wide range of tasks faced by caregivers in real home settings, we can invest research over the coming years to qualitatively enhance the capabilities of remote care beyond this two-dimensional observation and interaction that is allowed by today's virtual care stack. Oh, my mouse. Okay. So what will it take to realize that vision? With my colleagues at Cornell, we're exploring key research challenges posed by immersive augmented reality in the home care setting, where the algorithms and devices must work in the wild of diverse home settings and diverse caregiver training, and for the physical world tasks that are less forgiving than entertainment and training, where mixed reality is already flourishing. So that said, this is an area where we think we can get traction by focusing on the structured nature of many of these care tasks. We bucket the research challenges as follows, and as you see, it's definitely a team sport in that it's going to take collaboration across a number of subspecialties within and beyond traditional AI. So the first bucket contains core areas of computer vision, graphics, machine learning, to support the mixed reality capabilities needed for clinical guidance, in particular to enable rapid on-the-fly and accurate task-driven measurements of patient shape, motion, and appearance. And challenges include in the wild 3D reconstruction and registration, detailed shape and appearance understanding, and projection challenges for both projector and optical see-through devices. And to realize the AI agent guided care will require additional advances in agent perception. So while initial prototypes can be trained on data from lab-based role-play simulations, deployed systems are going to require domain adaptation for diverse home environments, learning from limited data, and eventually active learning and open set recognition to broaden the task learning. The second bucket of research challenges in blue address the broader questions of interactivity needed to make AI agent guidance work for caregiving. First, to bridge from clinician to AI agent guided care, we need to create the capability for clinicians to author and prescribe agent guidance and to assure that the resulting agent caregiver interaction is usable under variable conditions and robust to common communication breakdowns. Longer term, these systems will need learning policies for personalized and adaptive guidance that can bridge from general clinical prescription to detailed guided action. This raises challenges of personalization, dynamics, and the need to learn from demonstration and cross-task transfer learning. And all of these research challenges need data to inform model generation. And we're looking to integrate techniques from interaction design and even medical clinical skills training by creating environments for extensive data capture from human role-play simulation and Wizard of Oz-based prototype explorations. And in the third bucket, we need integrated security and privacy techniques to create systems that respect the intimacy and integrity of the home context. Security threat models themselves shift as we transition professionalized care work from the controlled setting of a doctor's office to homes, and we introduce new insiders and dimensions of interpersonal dynamics. And from a privacy perspective, we must address how to balance the utility and harms of monitoring and surveillance in the home setting. So while this values topic is in its usual last but not least position, in this case, it's because I want to dedicate the entire next slide to it. So it's pretty clear that we'll be able to achieve some level of functional and even usable immersive care technology over the next 5 or so years. Yet to realize this potential, these tech innovations must be compatible with medical care by conforming to the Hippocratic Oath of do no harm. And to be compatible with care in our homes and daily lives, we must incorporate patients' and caregivers' perspectives and needs as much as the clinicians. So first, immersive care for patients does offer to improve their ability to age in place with the support of well-equipped caregivers. But the systems could also end up compromising a patient's dignity and autonomy. Even beyond setting up appropriate data flows, we face questions of who gets to decide what for a patient based on these data trails. Is it a dream or a nightmare that the autonomy settings on your parents' intelligent car or their eligibility for independent living could be informed by these rich data sources? Atul Gawande writes in his seminal book, Being Mortal, that the battle of being mortal is the battle to maintain the integrity of one's life, to avoid becoming so diminished or dissipated or subjugated that who you are becomes disconnected from who you were or who you want to be. So I'm not throwing this out there as a fear tactic, but rather as an inherent tension that technologists should address by designing systems that can be used to increase autonomy for older adults by enabling them to age at home while still maximizing respect for human judgment and boundaries. There's also important work here for policymakers to establish guardrails for products and services. So second are the values of caregivers. They are vulnerable to the stressors of poor working conditions, abuse, blame, and also to isolation. Isolation by itself contributes to the lack of mentorship and career advances for professional aides and to mental health risks for all caregivers. And we have the opportunity to invest in and elevate the work of those giving care at home, to design immersive care systems that expand the range of care and caregiver learning to elevate both quality of work and care. And more broadly at the societal level, we have reason to invest in values such as preserving the home as a private setting, investing in human companionship, keeping that last meter of care human, and upskilling care work. And these clearly are not easily harvested low-hanging fruit, but that makes them all the more compelling for academic researchers to take on. So let me close with the last point, which is about values at the ecosystem level, and in particular, the gap between public interest demand and tech sector supply. Caregiving is just one example that is insufficiently addressed by today's innovation ecosystem. Not surprisingly, it comes down to incentives. In the US healthcare system, misaligned incentives interfere with improvements and innovations in public and individual health. In many contexts, these misaligned incentives have caused prevention generally to be reduced to a positive externality. And in the tech ecosystem, there is insufficient attention to problems and solutions that fail the scale test from a business or data perspective, with their respective incentive metrics of profit and publication. Now, we all value profits and publications, but when those are the only shapers of emerging technologies, we leave important societal needs on the table. In response, the public interest tech community is pursuing technical advances that promote societal welfare and address systematically unfulfilled needs. And this lens is critical to prioritize design considerations of autonomy, dignity, quality of life, and respect for caregiving. So just to summarize and close, caregiving in the home is important and poses interesting technical challenges for augmented intelligence researchers. Interesting because they're difficult, but likely tractable because of the structured nature of many important care tasks. Advances in immersive care technologies could catalyze a transformation in caregiving to support aging with integrity. And if done right, the transformations could enhance the lives of both aging adults and the people who care for them. And doing it right requires integrating values into our designs and our tech ecosystem and making room for alternative drivers and shapers of emerging technology. And I just want to close with a thank you to my colleagues, students, and certainly my family who taught me about caregiving. Thank you.
Thank you so much for that fascinating, potent talk, Deborah. I want to remind everybody that we have a panel discussion, so put your questions on the Slido, and we're watching them, and we're trying to select some for the panel. But at this point, I'd like to go and invite our Stanford students to present their focused talks about their own innovations in AI and health, and to present their research in these 1-minute lightning round talks. So take it away, students.
Hi, my name is Kevin, and today I'll be talking about RNA GPS. You can think of RNA as being the RAM inside of a cell. It expresses genetic information in a format that can then be consumed by other cellular components. As you might imagine, the localization, or where these RNA transcripts go within each cell, is incredibly important to its functionality. RNA GPS is a machine learning model that we have developed to predict this localization behavior based on the sequence of the transcript itself. We can then use RNA GPS to study biological systems in silico. For example, we were able to look at the SARS-CoV-2 virus, the virus that causes COVID-19, and predict that its transcripts have an affinity for the host's mitochondria. This hypothesis has then led to multiple experiments that have since confirmed the existence of this biological interaction.
Hi everyone, my name is Maya and I am a computer science PhD student. In this project, we evaluate a child's social phenotype from home videos in an effort to aid with diagnosis of autism spectrum disorder, or ASD. Our team created a mobile health application called Guess What and collected over 11 hours of video footage depicting children engaged in gameplay in a natural home environment. We utilize automated data annotations to analyze two social indicators: gaze fixation patterns and visual scanning motifs. Our work identifies one statistically significant region of gaze fixation and one significant visual scanning pattern that differed between neurotypical children and children with ASD during gameplay. In addition, a deep learning model trained on coarsely labeled social engagement features demonstrates mild predictive power in identifying the presence of ASD. Ultimately, our results demonstrate the utility of game-based mobile health platforms in providing insights into disease diagnostics. Thank you.
Hi everyone, I'm Kevin Thomas and I'm an MD PhD student in the Neuromuscular Biomechanics Lab at Stanford. We work to develop solutions for diseases that affect human mobility. One example is knee osteoarthritis, which is a painful condition that affects millions across the globe. We've developed a deep learning model to assess the severity of patients' knee osteoarthritis from their x-rays. To make this model more accessible, we've developed and deployed it as a web app that I'll show you now. By dragging and dropping an image from your computer into your browser in the web app, within seconds, you get a 0 to 4 score for how severe the patient's knee osteoarthritis is, as well as an estimate of the model's confidence in that conclusion. As new models are analyzed, they appear in your browser too. By distributing our model in this easy-to-use format, we've enabled the Hospital for Special Surgery in New York to validate our model on their own clinical images without the need to do any programming. We're excited to expand this soon in order to automatically assess MRIs as well.
Hi, everybody. My name is Alan Lavertu. I'm a fifth-year BMI PhD student here at Stanford. I'll be talking about COVID fast facts today. The problem we were trying to address here is that local health departments still receive a large part of their disease reports via fax machine. But due to COVID, the volume of faxes they received changed drastically and kind of overwhelmed the existing system. So the solution we developed as part of this project was an AI-based system for automated case annotation and triaging that would essentially go through those received faxes, identify relevant reports, and prioritize them for caseworker follow-up. This system has been actively deployed for several months at the local county health office with very positive feedback, and we've definitely been helping on the ground. And so if you want to learn more about the project, you can go to helix.stanford.edu/fastfacts. We have a medRxiv post as well as a Wired article that's written up about the project. We're currently looking into potential commercial applications for this, as well as putting up a company to see if we can help further. So thank you.
Very good, and thank you to the students. Again, if you have questions, you'll be able to find their research papers and other links on our website, and we'll share the link in Slido. Next up, I'd like to introduce Dr. Eric Horvitz, a technical fellow and chief scientific officer at Microsoft. Eric's research has addressed challenges of machine learning, reasoning, and decision-making, and how to integrate these technologies into the user interfaces and applications of the future. He has truly been one of the leaders in combining the human element to AI for many years. He is also a steering board committee member of our AI Index, a comprehensive, regularly recurring report on the global state of AI. Eric, welcome. Please share your screen and take it away.
Thank you, Russ. So it's really great to join you all today on the topic of augmenting human intelligence with AI. You know, a major focus on using machine learning today in healthcare centers on inferring diagnoses and outcomes. Accurate diagnoses and predictions have been mainstays in AI in medicine for decades. As an example of such a system that we built named Readmissions Manager and fielded several years ago for Microsoft. It's been used at hospitals in the United States and Europe. Readmissions Manager does local machine learning from data collected about patients over time, and it builds models that are then used to predict that a patient being discharged will bounce back to the hospital within 30 days. And at discharge time, a probability of bounce back is displayed for each patient being discharged, along with an explanation of the key findings.
Eric, can you hear me?
Yes.
We're not seeing your slides.
You're not seeing my slides.
So if they're wonderful, especially, we would love to see them.
Let me try again here. Make sure they're shared properly. We don't need slides. We can just talk without slides here. Share screen. Hang on one sec.
And happy anniversary to everybody, about 1 year of Zoom glitches.
Do you see the slides right now?
We can see it in not quite presentation mode, but I definitely see the PowerPoint with the Readmissions Manager slide.
All right. There we go. All right, I think we're back online here again. So if you can all see the Readmissions Manager, the idea was probabilities are displayed to physicians at discharge time of bounce back within 30 days, along with an explanation of key findings. And physicians can consider the probability as helping them to make decisions about allocating special support to patients who are at high risk of readmission. Now, some of the feedback we received was that doctors didn't necessarily know how to transform a probability into a decision about which patient should get an expensive bundle of interventions. So the questions about going from data to predictions to actions highlights an important opportunity for helping physicians with decisions. The rubber really meets the road with decisions, and there's great opportunity to build AI systems that consider a data to predictions to actions pipeline in medicine, as well as other areas. Now, to go from predictions to decisions, we actually coupled machine learning with automated decision analysis to create a method that encodes the cost, benefits, and core values and goals. The approach provides rich analyses and visualizations. It considers the under uncertainty actions about the value of an intervention, as well as ideal thresholds on a probability of bounce back for entering patients into a special program that would be aimed at reducing the risk of readmission. The system does a deeper analysis that considers the costs and efficacies of alternate actions and considers these cost benefits in together with the power of the machine learning model to generate visualizations to help physicians understand and gain insights. Now, I'd like to move to an even richer, more powerful coupling of AI systems and human decision makers. And this is designing systems that understand human cognition more deeply and that work to complement human thinking. The idea here is to understand the details of biases and blind spots that have been identified over 100 years of research in cognitive psychology that's yielded characteristic limitations on human intellect. I'm showing on the y-axis here in this graphic human intellect, and at the frontier here, limitations and nooks and crannies in human abilities. Now, a direction in medicine that resonates with this graphic is identifying different kinds of errors and oversights. And the dream is to use human intellect to extend the abilities of humans. So here's an example. Several years back, that we built a predictive model from a database of 15 years of patient visits to the emergency department at a large Washington, D.C. hospital. To build the data set, we sought to identify cases where a patient came to the emergency department and was discharged shortly thereafter, but then surprisingly returned within 48 hours with a primary diagnosis as an inpatient that was nowhere on the initial chart when the patient was discharged. So these returns to the ED within 2 days would be considered surprises, surprises that can hide in the cognitive shadows of expert reasoning. So at discharge time, you can imagine running this model, a clinician would be very interested in hearing the model say, this case, before you let this patient go, might actually surprise you. Do you want to see what I'm thinking? It's the kind of advice that doctors would be quite interested to review versus redundant inference. Now staying on the topic of errors, a recent study from Johns Hopkins estimated that over 250,000 deaths annually in the US are caused by human errors, making these deaths the third leading cause of death right after heart disease and cancer. Unfortunately, now COVID-19 is the third leading cause of death right, really pacing with cancer. The high rate of death based in medical errors frames a key role for AI systems, that of a safety net, analogous to the safety net pictured here for capturing accidental falls by workers during the construction of the Golden Gate Bridge. So the error is human, and we have to expect errors, but AI can help us as a safety net. Now, the prevalence of fatal medical errors of hospitalized patients motivated a research effort that we undertook, led by advisee Dae Lee at the University of Washington, in work that addresses a tragic phrase that's used in medicine since the mid-90s. The phrase is failure to rescue. Failure to rescue refers to missed opportunities to save patients who die after encountering a treatable complication. So in the work with Dae, we collected a large database of patients from the University of Washington Hospital and applied what's called distant supervision methods to learn to predict when patients would likely soon need a life-saving maneuver, such as the failure of a key organ system happening in the near future. And we could do this hours in advance of such a failure, which could be the start of a cascade towards death, leading to potential situations where there's a failure to rescue. So such work is promising in setting AI safety nets to reduce failures in healthcare. Now, so far we looked at the design of systems aimed to assist people, but without diving deeply into the complementarity of human and AI capabilities. There are great opportunities to weave together machine and human intellect more deeply. So to frame the opportunity, a few years back, there was a challenge named the Chameleon Competition. And with this competition, the idea was building a machine learning-based system that could detect breast cancer metastases in histologic sections of lymph nodes. Now, the best machine learning system was a deep neural net. It did not do as well as the best human pathologists. The experts had a 3.5% error rate, capturing their false positives and false negatives. Now, surprisingly, a relatively simple combination of the AI and the human output about the cases led to a decrease of error to 0.5%, which is an 85% reduction in error. Now, that was a simple coupling, but it raised questions and pointed directions to doing something more deeply and more principled. People and machines work in different ways and make different kinds of errors, and we can bring the best of both to bear. And we've taken these methods further now and are exploring ways to use the AI methods themselves to ideally mesh AI and human intelligence in new kinds of symbioses. Results are quite compelling, and we reported them in January at this past HCI conference and the AAAI in February. So let me show you a little bit how this works. Traditional machine learning, you take a training set and a test set, and you work to optimize or to minimize a loss function in this case to build a neural net that can do diagnosis. And this is done without regards to human beings in the loop, just to do the best you can. Now, in one of the projects that we worked on with an intern, Brian Wilder, we gained access to the data used in the Chameleon competition. Now, beyond the raw data, we gained access to the data on the performance by pathologists on the same data set. And using this data, we worked to develop a set of principles and methods for integrating knowledge about the abilities of people into the machine learning optimization itself. Now, to build human-centered complementarity, we consider the accuracy of the model with and without human assistance. So we employed the principles from decision analysis for computing the expected value of an AI system that might get a hint from a human being to get the notion of the value of information of going to a person with the cost of going to a human expert, for example. Now, here's the magic we did. We actually create a differentiable analysis that's of the form done for optimizing modern machine learned models. And we do end-to-end training of the model as well as the query policy, should the system ask a human in this case, to build a joint system. Now, we've been impressed with the results. To give you a sense for the results, we found that 70% of human errors were in a region of the problem-solving space containing just 10% of those cases. And the standard ML approach, without considering human input, was failing in that same region 30% of the time. When we do the joint optimization with the ability to ask a human expert for a hint, the system becomes expert in that region where people are weak, going to 0% error rate in that region. But new errors pop up in other parts of the space, but in parts of the space that are easy for people to recognize and do well on. Really demonstrating this notion of complementarity and showing principles for getting there that weave human and machine intellect together. You can read more about these methods in our recent IJCAI paper, and also check out other streams of work on developing principal methods that support human-AI interaction, complementarity, and collaboration. And studies include recent work by our intern Gagan Bansal, just published in February at AAAI, on another form of teaming, where machine learning is aimed at regions where the system can make confident recommendations in a team setting where humans only trust certain levels of confidence. Another direction of work was on exploring mental models that people use when they're working with machine learning systems. And finally, in work by Ramya Ramakrishnan, another intern on our team, we explored principles of reinforcement learning that would understand when to pass the baton to humans versus to rely on machine reasoning. So to summarize, there's a great upside to achieving new kinds of human-AI collaboration, where AI systems are decision-oriented. They have insights about how to explicitly complement human cognition. I see these as the pathways to magical and surprising augmentation of human intellect that can empower people and organizations. It's truly an exciting direction, and much remains to be explored. Thanks.
Thank you so much, Eric. Next, I would like to introduce Dennis Wall, a Stanford professor of pediatrics, psychiatry, and biomedical data sciences. Dennis focuses on developing methods in biomedical informatics to disentangle complex medical conditions that originate in childhood, including autism. Dennis, if you will put on your slides and take it away.
Hold on one second. Try this again.
As I said before, this marks the 1-year anniversary of Zoom glitches.
All right, can you see my, thank you so much. It's a real pleasure to be here today. Can you
we don't see your slides. We see you, you look great, but there's no slides yet.
We do not have slides yet. Don't start my counter yet. I swear I can figure this out. I just hit the wrong button. Okay,
we do see the desktop, and we see the window. So if you made the window really big, it probably would be fine. Yes, that looks wonderful.
Awesome. Thank you so much. It's a super honor to be here. I'm really excited to be part of this panel. And today I want to talk to you about mobilizing how we can leverage AI actually to achieve healthy child development worldwide. And what I am focusing on in this talk is autism. Not just because autism is a really important pressing public health concern, but because it's representative of many other conditions in human health. Today, autism now impacts as many as 1 in 40 kids. It's been on the rise. It's been about 600% increase since 1990 to impact now 1 in 40 kids, which is a really serious concern. But what are the other issues that we're faced with here? Like many other healthcare conditions, we have sort of an access or supply-demand issue. Here are, in the United States, the diagnostic services or therapeutic services that are available to individuals who have risk or who need services for autism. And this is the estimated prevalence of autism across the United States. You can see right away that there's a geographic disconnect between the people and places where they need to get to. What's more, if we dig into the actual problem as it operates today in the current healthcare system, 1 in 5, 1 in 6 kids present with a developmental delay. That's representative of about 800,000 kids who all get pushed through the same bottleneck to get access to diagnostic evaluations by clinical specialists who are outnumbered by the number of kids who need to be seen. And these visits can last hours and cost thousands of dollars, non-scalable, subjective, and lots of other issues that potentially could be addressed with artificial intelligence that I'll get to in just a moment. And ultimately, at the end of this, they receive a diagnosis, which gates, in many cases, their access to reimbursement for therapeutic services, which themselves are rate limited by supply-demand problems. So you might have as many as 12 months before you can get access to a diagnostic evaluation, and up to 18 months to get access to services. That's 2.5 years of waiting before you're actually moving forward with developmental interventions that can make a significant impact on the children. Maybe as many as 750,000 children annually need these kind of care services. And the care that we deliver today is actually very effective. Although all those issues I said are still there, if we can identify children early and often, and within windows of brain development, we can make serious impacts to the point where a kid will progress from having a diagnosis of autism to no longer qualifying for such a diagnosis. In fact, despite the fact that autism's average age of diagnosis in the United States is about 4.5 or 5 years of age, doctors can literally hear which kids have autism as they walk from their office through the waiting room to the clinical evaluation room. They could identify the 3 kids on this slide of the 3 kids on this slide of 6 individuals who have autism and the 3 who do not. In other words, they essentially possess this empirical intuition, a blink test, if you will, for autism. And yet they're not acting on this intuition. And so what we've been trying to do is to develop a way to enable them quantitatively through systems of artificial intelligence to act on that intuition rapidly at the right time, to empower diagnostics to happen out of clinic in more mobile settings. How have we been able to do this? Initially, we were able to get access to all of the clinical records, electronic medical record data that are generated as a result of the standard of care that's delivered today. In fact, what we have are hundreds of features that are measured during this clinical care process. And we have thousands, tens of thousands of examples of children who have been processed through the standard of care. And we can leverage these electronic medical record databases using standard machine learning approaches to ask very simple questions like, can we reduce the complexity of the autism diagnosis without loss of accuracy with a minimal feature set, a significantly smaller number of features than what we currently use today? And the answer is absolutely yes. But that's just one part of it. In fact, we've been able to show this by looking at all these electronic medical record data, and we've built 8 models that encompass only 30 behavioral features that have extremely high accuracy with respect to the clinical outcomes that are generated during the standard care processes. But what's more important is that we've been working on, here's CJ, a child with autism who is presenting with standard conditions, restrict repetitive interest, social communication impairments, and other impairments like that. We've been able to ask the question, can we enable non-experts to watch short home video clips that are roughly 30 seconds to 90 seconds in length, maybe as many as 2 minutes at max, to be able to tag the features that are consistent with these machine learning models to generate vectors to enable us to run the models really rapidly in the cloud or in the crowd, so to speak. And this, the answer to this question is actually yes. We can empower non-experts to watch these videos and score the features that are consistent with these machine learning models to generate the vectors that enable us to process the machine learning predictions to a rate of roughly 95% sensitivity and 78% specificity in a matter of 4 minutes in comparison to, sorry, my video may have frozen. I'm trying to start it again. As compared to the many hours that are required to perform the standard diagnosis today. So this is exciting. This actually enables us to begin to think about a future in which we use mobile technology and non-experts and in the use of AI to augment rapid detection and diagnosis. It's not just a binary outcome of yes, no, autism is present, but a quantitative score that fits a distribution that tells us much more about the child's location within a continuum of behavioral phenotypes, but also enables us to track the child over time as they progress through therapeutic services. So very exciting. And importantly as well, because we can mobilize, we can begin to look at global opportunities. And we are doing this in Bangladesh, Philippines, Kenya, Tanzania, and hoping that, I'm sorry, I'm not sure if my video is frozen, my bandwidth may be constrained, that we can empower even community care professionals out in rural settings in low middle income countries to perform these same mobile diagnostics for autism in many other places besides the United States. So this helps us to think of a future where we have the power in our hands to mobilize the detection of autism and to use AI as an augmentation to what we currently do with the standard of care. But we also want to address the therapy bottleneck. And how are we going to do this? First, we need to take a look at the way the standard of care is used today for treatment of autism. Children with autism suffer from making eye contact, recognizing, understanding emotions. So essentially, they have a flat affect, and they also tend not to engage in social interactions. Well, we decided to take a look at augmented reality and to build computer vision models that would operate on this form factor in particular, which is quite ideal for the situation of treatment of autism because it's a peripheral monitor that sits off in the periphery of your right vision. And it's a lensless pair of glasses that doesn't get in the way of your social interaction scenario. So we can actually take advantage of the outward facing camera and the prism that's available on the Google Glasses to have children wearing the glasses actually understand their social world and to interpret what's going on within the faces with respect to social emotion and many other things. This is a computer vision model that tracks the world around the child in real time. And we can process the images that are coming through that outward facing camera rapidly and dynamically submit feedback to the child in this in the heads up display of the Google Glass units themselves to provide this real-time feedback that's quite powerful. Importantly, also, we can record the information as we go, creating potentially the opportunity for an action and data feedback loop through which we deliver therapeutic services in real time while gathering data on which we can build better models in the future. So this essentially naturalizes the care process to the homes of the individuals. And we've done this and tested this rigorously. What's also important, aside from the fact that children wear it, love it, and react well to it, is that we can test it in standard clinical trials, randomized clinical trials, and show that it not only is something that qualitatively works, but that actually quantitatively works and changes these children for the better with sustained gains on standard endpoints that would be utilized, for example, by the FDA. So indeed, Google may have an afterlife. And we've licensed some of these technologies to a company called Cognoa that will soon hopefully take these forward. Now, there are limitations to this wearable form factor. It's not necessarily designed for the child's face. It's not a one-size-fits-all solution. Also, the classifiers that we used, importantly, were focused on the training data that are available today, which are essentially only on adults. And so the performance on the models tend to fail on children. This is a common phenomenon where you might be familiar with the show Silicon Valley and the episode where Jin Yang builds a food classifier that is really only able to identify hot dogs and everything else to this classifier is not a hot dog. So this is a garbage in, garbage out kind of problem. It's the same problem that we face with being able to, well, it's a common problem in artificial intelligence across the board, and in particular in healthcare, and in particular in pediatric healthcare. There are not a lot of training examples to enable us to build performant models for facial recognition and emotion classification in children. In fact, all the off-the-shelf tools that are out there tend to fail with high rates on most of the emotions that we care about. So what we've done is created a new solution that will enable us to build better training data while actually delivering therapy at the time of need. It operates a lot like Heads Up, where you put the phone on your forehead. Hopefully you can still see me. And you display something on the screen that's a challenge to the child, and the child's job is to act out what's going on the screen. It looks something like this. You get a display. Child's job is to act. It's very much like charades, but we can do many other things besides charades to impact therapy along a number of different verticals, including increasing eye contact, social awareness, emotion recognition, and so on, while we're gathering data, for example, the egocentric frames that are coming through, the expressions, eye contact events, and much more. So it becomes this pluripotent system where we can display something like an emotion challenge, and we can sample without replacement so that we continuously challenge the child, so there's no memorization. And we can also challenge them with different sorts of scenes like occupations, sports, and other categories, including symbolic play like act like a vacuum cleaner. All of these things can be matched to standard of care therapy, which we've done, that we know work, but just don't scale. So here we have a system that will both work and scale on mobile. And in fact, we've been testing this just like we did with the glass system. And what we're seeing is a standard consistent improvement on outcome measures that are used commonly in the field. What's also important about this toolkit is that it's actually generating the data that we will need to build better computer vision libraries for the pediatric population going forward. So it's both gameplay data as well as these image data. For example, the moment in time where the surprise prompt corresponds to, let's say, weak labelers' prediction of the surprised face, we have a 2-point correspondence that indicates that that image is highly likely to be a surprised face. And we can deposit those predictions into libraries, and we can do so at scale and very rapidly as the children play the game. So here's an example of us doing this with hundreds of thousands of frames and processing them through and bucketing them into these different emotions and emotion categories that we can ultimately use for machine learning models going forward. So here's one example of doing that, where we can take a standard model that's out there in the literature, the Inception module, which I'm sure many of you are aware of, is very, very good at real-time object detection. Obviously, it's not good at automatic detection of this particular model.
1 minute.
Freezing the lower layers and training our, let's say, the last fully connected layer with this domain-specific autism training data to enable this Inception model to be very good at automatic detection of pediatric emotions that we need to study and measure in children with autism. We've done this. It turns out this is true. The red line represents the new fully connected neural network that we've trained using transfer learning on Google Inception, and it's in comparison to what the Glass model, the Google Glass model, is the dotted line, and then the off-the-shelf classifiers is the consumer models is what's the green line. So we are getting up and to the right with this, and we are starting to generate better and better training data. And this is also possible not just for emotion and for the pediatric population, but for many other training data sets, including gestures, joint attention, socially motivated facial engagement and eye contact, and a number of things that we're working on now. So thank you. And I'll just say, with AI, we can know and we can act, and we're doing that with autism, and hope this inspires you to think about how we do this with other healthcare conditions going forward. Thank you to my team and partners. And here's some websites you can check out that describes a lot of these projects.
Thank you very much, Dennis. Thanks for that exciting work. Really amazing. Our final presentation for this first session is Suchi Saria. Suchi is a professor of computer science and statistics and health policy at Johns Hopkins University. Her work examines how to use the deluge of data in healthcare to individualize patient care. Suchi, welcome. Please share your screen and take it away. You are on mute. You're on mute still.
There you go.
Good. There might be a little echo. If you want to start speaking, I'll confirm whether or not there's an echo.
How about now?
Perfect. Yes, there is an echo, and I'm seeing 2 instances of Suchi on our Zoom. One instance might need to be killed.
Is there an instance with the video that you can see of me, and the other instance has my screen? Does that work?
Yes, now we're good. Thank you very much. Go ahead.
All right, wonderful. Well, thank you for having me. I am, like Russ described me, professor at Hopkins, where I lead a number of efforts at the intersection of machine learning, AI, and healthcare. And I'm also the founder of Bayesian Health, which is a company that spun out of Hopkins, focused entirely on leveraging longitudinal clinical streams data to enable real-time care delivery augmentation using AI ML. So let's start by, I think care today is very reactive in terms of, you think about the number of complications that are entirely preventable, adverse events like readmissions that are preventable, and then all of the medical waste that comes attached to it. In addition to that, providers also are entirely overwhelmed by technology. If you think about, like, in every other sector, we've been able to get performance gains and productivity gains from the use of technology, but in healthcare, the impression of EMRs brings stress, burnout. Like, caseloads have increased, but we still have the same amount of time. In fact, shrinking time providers have to be able to provide care. They have great desire to use the data, but using it is very hard because it's a lot of clicks, it's not easily accessible. And often, if anything, it's become a source of a ton of false alarms and false alerts, leading to provider fatigue. But the reality is it doesn't have to be this way. I think what we now have is a wonderful infrastructure on which a large amount of clinical data exists that we could leverage to actually move from reactive to proactive care. But what does it mean to do that, and what will it take? So over the last 8 years, I've spent my team's work has been entirely focused in this area, starting from the machine learning models itself, but and in particular in the last 3 to 4 years, thinking about how do you actually deploy these models in a way that providers begin to trust them, can team with them. And through our work at Bayesian, we've now built and deployed solutions that are in use by thousands of providers, where with very, very high adoption, so upwards of 85% adoption, which is quite hard to get. So typically, when you have alarms and alerts on an EMR, you see something like 10 to 20% adoption. And here we've been able to get very, very high adoption. So I wanted to use the remainder 8 minutes to just talk a little bit about our experience and learnings from the past 7 years of work in this space. So the first is, we're all machine learning researchers, and we know at the end of the day, the first most important thing, non-negotiable, is like the high quality machine learning itself. And I'll talk a little bit about some fundamental pieces of machine learning, what makes high quality machine learning in medicine that is crucial. And then the second part is, basically the model itself is great, but that's just a starting point. And there's a huge amount of work that is necessary after that to really succeed and get adoption. So let's start with the ML itself. So in order to actually build models, you need the inputs that are going into the model itself in order to do real-time assessments, predictions, the targets that are being used to, what we call labels to learn from, and then the quality of the learners themselves. And turns out in medicine, all three make it very, very hard because the data are really messy. They're structured, unstructured data of thousands of different kinds of sensors as opposed to one kind of sensor. And the notion of a gold standard is elusive. So you have to really struggle hard to create the right kind of targets. But doing these are actually quite important, and you need to dedicate time and energy to doing it well. So here's one very simple experiment to kind of illustrate that point. So in this example, what we're showing you is on the x-axis sensitivity, on the y-axis is positive predictive value. And what we did is, in this example, is looking at sepsis. And when you essentially build a learner with effectively just simple inputs like labs and physiology, just structured data versus structured and unstructured data, in the high sensitivity region, you see almost 20 to 30% improvement in precision by just increasing how you're leveraging. So all else equal, just leveraging better data. Now, I mentioned inputs as one piece of it. Let's talk about the phenotypes. And high quality phenotypes is extremely hard to generate. Like, for example, very commonly, we're used to doing shortcuts like billing codes. But if you can do a good job, it makes a huge difference. And so here's an example where all else equal, if we were to flip the phenotype, same experiment, flip the phenotype and use a high quality phenotype instead of a low quality, which is more like billing coded data, which is what people traditionally use, you see a 40 to 70% improvement in precision. And now what if we combine it, both better inputs and better phenotypers, you actually see a 200 to 300% improvement in performance. Now, I just talked about data inputs and phenotyping itself. When we start thinking about the data itself, the degree of practice pattern variation, missingness, the fact that it's very easy to overfit and memorize, and what you really need is reasoning, like you can really, by leveraging better learners, further improve performance by 300 to 400% in our experience. So all that is combined to say the high quality ML is crucial, when high quality ML targeted to medicine, targeted to the kind of complex data we see in medicine is crucial. But that's not it. That alone isn't it. So let's talk a little bit about what happens after the model's been deployed. So the first piece here is like this notion with model monitoring, and Eric spoke a little bit about this, which is in medicine, unlike advertising, trustworthiness is crucial. You want providers to be able to trust what they're seeing. And historically in medicine, we've spent, historically in machine learning, we've spent a great deal of time thinking about how do we build models so that we train and evaluate them on single or one or two limited data sets. But once you start deploying them in practice, there are all sorts of reasons why environments shift, practice patterns shift. There's local reasons why things can be different. And as a result, the answer of like one and done doesn't exist. You actually need to think about monitoring infrastructure that is both leading to more robust models, but also detection of scenarios where you need to correct for shifts that occur and that can lead to biases. Okay, so beyond that monitoring infrastructure, what else have we found to be really important? I mean, providers, like I mentioned to you, are really, really busy. So if you just give them more data, a model with more outputs is just more data. And I think what's crucial to get adoption is not just more data, it needs to be actionable insights. So how do you present it in a way that it's super easy to use, it's very easy to understand, it's very clear why it's being presented, what the goal of it is, and what is someone going to do with it. And finally, like in every other revolution that has had to happen, and in medicine, the better use of data to really indulge in better decision-making is really another revolution we need. And part of that is like changing minds and winning hearts. And that means behavior change. And behavior change is all about, how do you activate buy-in, make use easy and create a habit? So how do you breathe these principles in throughout the process? So not just sort of in the model design itself, but also in the software, how it's communicated, how the results are communicated, such that it facilitates this behavior change model. I want to end on this final study that came out that's really beautiful, where effectively, it's a very clever study, came out of Toronto, where basically these researchers had expert radiologists look at chest x-rays and produce what they would have given as feedback or analysis of these chest x-rays. And the clever experiment was that these researchers basically took the output of what these experts said and disguised it as either coming from an AI solution or an expert radiologist, and presented it to a group of other clinicians to assess the quality. And interestingly, experts actually, like these new radiologists who were seeing the advice, when they were told that the advice is coming from an AI, they were independent of the quality of the advice, were much more willing to rate it poorly compared to when they thought it was coming from a human. So while we're building higher quality technology that is showing results that are now possible to embed within workflow, the behavior change piece is absolutely crucial, which essentially part of it is tackling bias against the use of these kinds of tools. With that, thank you.
Well, thank you very much for that wonderful talk, and especially that last slide, which should cause everyone to pause. I would like to now invite all of the panelists to rejoin with their video or whatever, and then including my co-host, James Landay, and we'd like to kick off this this Q&A session. James, would you like to kick us off?
These were really exciting talks. One reminded me back in the early 2000s in that Intel research, I led some really great researchers on some of the basic sensing hardware and AI needed for this vision of home care technology to come to fruition. And we thought this revolution was about to come to people's homes, in the next 5 to 10 years. As usual, we researchers think it's about to happen. It's almost 20 years later, and it still hasn't happened. It reminds me of, the tire tracks put out by NSF and Peter Lee and others. But we still haven't really seen this happen. I wonder if now is the time finally for some of these home health technologies to really take off in a big way. And especially with things like COVID, that will make folks more hesitant to go into nursing homes after what we've seen, or even the hospitals. I always think of, you go to the hospital, that's where you're gonna get sick, so stay out of there. So what do our panelists think about this? Are these technologies about to start making a big impact in our homes? Maybe we can start with Deborah, since she spoke about that first.
So thank you, James, for teeing that up. And yes, I actually made a note to myself. I need a slide showing all the incredible work that's gone on that looked at aging in various perspectives, and that does now. I answered some of the questions in the Q&A. So yes, I think, first of all, it's still going to be a while. If I wasn't clear, my talk was aspirational. Second, all the advances that other people speaking here have made with respect to machine learning and computer vision and mixed reality technologies and HoloLens and such, make it that we can start experimenting, at least in the lab, and collecting richer data and really starting to turn that flywheel. But I don't think it's just about technology. I think it's about how distracted do we get as technologists and researchers and funders by the things that have a clear ability to capture value and return on investment and addressable market, all of which are needed things, but maybe we would have been even farther along that vision if it was clearer, what the market value was going to be, and if it was clearer how to generate more productivity on the machine learning side, because we had more data to feed to it. So some of it is about, yes, now we can because of all these advances that have happened. But another part of it is we'll be having the same conversation if we don't do some rebalancing in terms of what our priorities are as researchers and innovators.
Great, thanks, Deborah. I'm curious, Eric, whether you have a comment on this, given you've been working with health and AI for much of your entire career. Like, when's it going to happen, or where is it already happening? Maybe that you see.
In terms of the home devices, or more generally?
I'd say home devices in particular, but also more generally, because maybe it happens first in more high tech hospitals and care facilities before it becomes a consumer product that we'll trust in our own home.
Yeah, no, thanks, James. I think that identifying actually sort of high value niches for monitoring and surveillance and control is a great place to start. My genomic analysis tells me that I can expect with some highest probability atrial fibrillation in my life. I said, whoa, because of some potassium channel marker. I'd like to basically really have a really highly reliable system that would do a great job with that. And I'd be willing to pay quite a bit of money, funds, to have that high reliability sensor that I could wear at all times. It's just an example of the kind of I think Wedge will see, specific applications to start with that really deliver value. Congestive heart failure with notions of fluid overload, that really work well, that let physicians at a distance, manage medications so that you keep the patient flying without crashing to the ground when it comes to the fluid loads. So the idea of choosing places and going from there, and then crystallizing out more general infrastructure and methodologies, I think is the way to go. So I'm actually very hopeful, and I'm hopeful it'll be a combination of cheap powerful, reliable sensors, inference, and really insightful thinking about where these kinds of end-to-end systems would deliver the most value.
I wanted to ask Dennis about this timing issue, because if I'm not mistaken, you mentioned a clinical trial. So that seems to be threatening relevance.
Yeah, I was just going to say, I think for child health, the time is now. It's near. It's very soon. We finally have this this alignment of security parameters and HIPAA compliance and quality as far as machine learning models are concerned, that we can seek and achieve regulatory approval and get these things classified as diagnostic or therapeutic devices and delivered in home settings. This is happening. It's happening now. It's happening not just for autism, but for ADHD, really, just to give you two examples. And I think we're going to see a lot more of that very, very soon, especially for child health, but I hope for many other sectors as well.
Now, I want to say, I don't think we have to have every panelist on every question, but I would love also to hear Suchi's thoughts about the kinetics of the rollout of the types of technologies that you're working on.
Yeah, absolutely. So actually want to comment on the timing piece first, because I think last year has been, in a way, like a terrible year and a very difficult year, but from the point of view of accelerating adoption of remote technologies, a blessing in a way that it sort of moved things along 10 years faster than people had anticipated, in part because previously two massive barriers were behavior oriented. First, that many physicians didn't want to adopt it because they didn't think they'd like it, they didn't want to use it, they didn't think it was necessary. So it was a mental barrier. And second, that on the patient side, it was very, the setup cost just felt prohibitive. And now, almost every health system has a unit focused on deploying remote patient monitoring technologies to be able to send with patients at home in order to be able to track and listen to what their patients are saying at home. And now it's turning into, from a patient's point of view, unthinkable that they would have to go in for every single appointment. Now, I think the point about we're doing a lot of RPM, remote patient monitoring, but what is that doing? Well, it's giving us a lot more data. So the part that is super exciting is the video interaction. So that's just like your inpatient interaction, but it's like video. But the part that is, all the data that we're measuring, we're still sort of building, we have now we should be building bridges with steel, but we're building bridges the way we used to build bridges when we had only iron. So effectively, we're collecting that data somewhere, but the use of data is pretty limited. And I think the next step up there is going to be better use of ML/AI in order to be able to accelerate the learnings we can get in terms of particular use cases, like Eric mentioned, congestive heart failure, for instance. In our own experience of deploying these kinds of solutions, what we found is, let's imagine you have the data, you've been able to deploy, providers are adopting them, it's helping identify patients at risk for complications, you've put in actionable workflows, people are using it. One of the very interesting barriers that I hadn't fully internalized before is this notion of probabilistic information. Probabilistic information is very hard for people to digest. Our education in probability is, we've seen it with the COVID pandemic, right? People have a hard time assessing grays. It's black and white answer. And I think, to me, one of the biggest things as a field we need to be thinking about is, how do we use probabilistic information and translate that into how we spend attention? Because today tests are classified as it's an accurate test or it's an inaccurate test. But in reality, it's like the Bayesian way, right? You're integrating a lot of information to get a sense of where the world is and the uncertainty interval. And from there, you can start to see how that should influence your actions. So it's not just, it's this or it's that. And I think, to me, where machine learning is going to have massive impact is when we can integrate data to start being able, because machine learning is not going to give you a black and white answer. It's not a biological test like troponin. The best it's going to do is, from integrating 1,000 signals, to give you a pretty good idea of it's likely here, but we don't know that. And for example, in something like sepsis, needle in a haystack problem, 2%, getting high PPV of 0.5 is out of 100 patients, you said 96 were ruled out, 4 are correct. It's still only half, 1 and 2 are correct. But people who don't, for probabilistic is hard because they're like, oh, well, if it's not always right, then it's bogus. But in reality, I think that how do we turn the probabilistic information into actionable next steps is sort of a very exciting frontier, I think.
Your point about the acceleration during COVID has also affected things like licensure. You know, I am licensed in California. I'm not supposed to practice medicine anywhere else. So forget about me as a physician. Now imagine the regulatory challenges for these AI systems. And I think people are starting to think about that strongly. I want to go to another question that I think impacts all 4 of the talks that we heard. Let's say that in many ways, all 4 of you are benefiting from the pre-AI world because your data sets are generally not involving data that was impacted by an AI algorithm. But as this does penetrate, per our previous conversation, we're going to start to have training data where the AI has influenced the decisions that the doctors made and therefore the outcomes on the patients. I just wanted to ask all of you the ways in which this world of training data, which we all know AI, at least right now, is extremely dependent on large amounts of data from practice in order to learn things. What's the future going to look like when AI is impacting its own future, so to speak?
Let me just say, Russ.
Yeah, Eric is smiling. Eric started smiling first, so go ahead.
I'm smiling because I'm thinking of a situation we're in where let's go back to that readmissions system that I mentioned. It trains and tests locally at every hospital. And we got a call from one of the leads at a hospital using the system, maybe a few months into the system being used. And the question was, wait a minute, when patients come back again and they've been actually recommendations from the system itself directed the patient to a certain kind of care to keep them out of the hospital, isn't that affecting what the system is thinking about when it comes to this patient's risk? And that kicked off, and the fact that it came from a user in the field, kicked off a bunch of research thinking about how do we tag patients with having been touched by the AI system and treat their data in special ways, for example, and the need to have the right kind of metadata and schemas to understand the influence of AI itself on the actual therapy sequences as well as the data sets being used.
I want to add
smiling. It came from a user.
Yep.
I want to add to Eric's point, which I think this is such a fascinating. I actually think the issue in medicine is not just the AI; it's also the user itself. Imagine if instead of you have other users who are changing behavior, and a lot of time in medicine, if you look at what you're learning from, your learning data, your phenotypers, as you might call it, often rely on physicians' behavior because either they made a diagnosis, they did some treatment, and as their behavior changes, the labels are changing. So in reality, I think this idea of excellent labels, excellent data, clean, clear metrics to learn from is just sort of entirely, I think, a concept that is elusive in medicine. So here we need to think about what are we learning from? These are often weak sources of inputs. And then what are our real validators? Well, AUC is a good stand-in metric. PPV sensitivity is a good stand-in metric, but it's in reality, actionability is important. And it's hard to directly optimize against, which will come from real-time monitoring. And then one last piece here is historically our machine learning solutions have entirely, historically, we've gotten so addicted to the idea of overfitting. And this is especially true with neural nets, where we basically have rich data, we can build really rich models and we can overfit. But what we want solutions are not things that memorize what's in the data. We want solutions that reason, are able to do counterfactual reasoning in terms of what would have happened had you. So in Eric's example, what would have happened if this person wasn't given this case manager? What would have happened if he hadn't given them medical education? Would they have gotten readmitted? And counterfactual reasoning so in our research, we've shown classifiers that do counterfactual reasoning are far more robust and invariant to shift in practice patterns, including recommendations made by AI, than systems that are not, but they're harder to build.
I have a question back at you, Russ. Do you think that that's a more important question than similar questions you could ask about changes in reimbursement or training history or demographics of the clinicians themselves, like all the things that go into in a non-random way influencing the decision-making of previous processes.
And I think pregnant in your question is the fact that we've been horrible at dealing with those perturbations on the system. And so a reasonable inference might be we will be horrible about managing the baseline shift that we see. So I think it's a valid point, and I don't actually know that these biases introduced by the AI won't be in the noise compared to other much stronger kind of social and economic pressures on the system.
But there is a nice move, at least, that will help, which is to do machine learning model inventory, to characterize the data carefully in terms of the sampling methods and where it came from, the time and date. Do your best to characterize potential influences, the reimbursement regime from CMS. Yeah, you could imagine this being very important in the future for understanding how to reuse models, for example.
So Dennis, just to finish this off, in your talk, you talked about how in the old-fashioned system, they had hundreds and hundreds of variables. You did a very sophisticated analysis and found the most valuable items. How are we going to make sure that that inventory of potential data items continues to improve and that you don't just fix in stone the 2020 WADE for diagnosing autism?
Yeah, it's a great question. I didn't get a chance to talk about it in the talk, but what we get are these persistent medical record observations of the children in the natural environment, and then we can revisit those over time with new features and new understandings. Right now, we're kind of canalized as an initiation, like sort of a jumping off point with these electronic medical record data, the features that we currently use under the standard of care. But in the future, there will be an opportunity to introduce many other types of features. And this is in part coming too from the gameplay and the guess what game that I talked about, being this action to data feedback loop through which we can, affect the child positively while capturing data that over time becomes enriched with features that we didn't really know about, right? And that enable us to be better at our jobs over time and more quantitative. And a quick point on this adaptive kind of AI and the opportunities there. For both systems, the GLASS and the Guess What, we've instantiated this sort of opportunity to retrain the base classifier locally using simple techniques from, essentially like few shot, low shot, meta learning techniques that enable the individual to tune the model to be, so it's 97% accurate on kind of the general population, but if the 3% includes your mom, that's a problem, right? And so we fixed the system so that you could attune the classifiers locally. And this opens up opportunities, for model enhancement over time and for sort of guarantees or insurance around the performance of the classifiers that you deploy in the real world, maintaining high accuracy in the face of diversity.
So switching gears to a question from our audience that I think is on a lot of people's minds and was in the set of values that Deborah highlighted at the end of her keynote. Dennis, what are the pressing privacy concerns around gathering and analyzing data about children with autism? Can your detection algorithms be used in Europe while still respecting privacy laws, i.e. the GDPR?
Yeah, it's an incredibly important question. Achieving trust is a key part of the mission that we have for this, and that's partly through the partnership that we can establish through the return on investment families feel they're getting by playing the game and the way the children react to the game. And so this increases this willingness to share, but there is still this enormous privacy concern about the fact that we're getting full facial image data under many circumstances, or at least requesting it of children who have developmental disabilities. It hits on all the HIPAA flags you can possibly imagine. And that's currently how we have to operate. And we're hoping we get a diversity of shares that enables us to be able to stop requiring that level of sharing. And that gets to this notion of being able to tune the base model locally and get it to operate with high performance on the individuals within your house, for example. And so it becomes like a locked, closed system that's private. What might then be shared only would be coefficients that are part of these tuning processes, as opposed to other identifiable information. And so there is an opportunity for us to lock the system down increasingly over time, where we're sharing minimal amounts of de-identified data that enable the performance of the classifiers to continue to be good, or that we can lock things down within a HIPAA compliant cloud infrastructure so that we can operate on things in a very private and secure way. It's a great.
Deborah, I'm wondering if you could also comment on that, given it was in your slide and you have great colleagues there like Helen Niesenbaum, who maybe are thinking about these issues, maybe you could say something.
So I think it's wonderful. I don't remember what phase you are, Dennis. You're doing clinical trial, right? I'd love us to be in a world where there's a whole bunch of things that might happen in a clinical trial, where people are consented or are doing it on that basis, whether, modern forms of in the wild trials or whatever, but that as things move into actual use, there's a different expectation and even requirement for what can be happening. Because while no one doubts your goodwill or any other innovator's goodwill of wanting it to be a certain way, I believe we need guardrails so that you don't have a choice and that investors can't push you to a different point in that, a less costly one or more, right? We need guardrails, and we want this sharing to happen because of the good you are bringing to the world, right? And we can have it both ways, possibly with some increased friction and some reduced profits and changing what is expected at the investor level. So if there's, anything that my colleague, Helen Nissenbaum has taught me, right? It's context. There's contextual integrity. You can't call some data private and then other data not private. And it's not just about how we design the tech. It's about how we design the funding ecosystem and the law and policy.
Another question. Sorry, go ahead.
Sorry, I was going to ask one quick follow-up to Deborah. To what extent is it also encouraging a culture of transparency? Because I feel like today, mostly because people don't want to talk about it, a lot of it is in legalese. It's whatever legal documentation is written under which it's hidden what is possible to do with the data. And that has created this notion of fear. So what if everything was a whole lot more transparent and like data use agreements were written much more transparently and shared more transparently?
Critical, but not sufficient in the sense that because when you're that parent of that child, you're going to want to just say yes. When you have an older parent aging at home and you're part of their agreement with the agency that's doing it, you're going to want to just say yes. And we should be protected from ingesting things that in fact aren't safe and are toxic. And we should be protected from deploying technology that is toxic. So yes, it should be more transparent, but we have a notion of consumer protection in this country, and it should extend to the technologies we build.
A question that's coming up from the audience a lot is the issue of justice in the rollout of AI. How do we make sure that this doesn't become initially something that is benefiting the well-heeled and that either only in a long time or never reaches the general patient, general population? For example, Eric mentioned that high value situations might be the ones that we initially see AI rolled out. And I know you didn't mean high monetary, you meant high impact, but how do we make sure that we don't conflate the profit opportunity with the justice demand?
Well, I think more generally, and this comes up when you start getting into decision analytic reasoning in systems, cost, benefit. Let's put the inclusiveness issue to the side just for a second, but I want to come back to that. But when you make your decisions clear and you flesh things out, you end up looking at values, staring down the heart of values and decisions, and they're transparent. So for example, an operating threshold on a curve coming out of a machine learning system gives you a trade between false negatives and false positives. Those are value decisions. How many patients do you want to over-treat versus how many do you miss? Who makes those decisions exactly? And at what level of the hospital or the government or civil society? So those are really interesting questions because you do end up with dollars versus patient health. And at some level, you certainly, back to inclusiveness, you want to be equitable about about how we treat. We know with COVID-19 that we had like multiples of death rates for African American and Hispanic patients for the population per capita, based on issues including inclusion, awareness, education, access to healthcare, understanding the situation they were in, and so on. So I think it's going to take lots of thinking broadly as society about how to handle this in terms of the benefits, rolling out benefits of AI systems and sensors and so on.
Deborah?
Just to restate the reference to public interest tech, and there is a increasing interest, right, started by the Ford Foundation and New America and many others, of increasing the range of business models and types of problems that tech comes around to solve, and what our priorities are as researchers and innovators. If we don't do that kind of adjustment, that won't happen.
I kind of want to take this from a different angle. I mean, so I asked, how do we protect people's private data and ensure that their data won't be abused? We've talked about HIPAA, GDPR, but those are the things that will maybe help you when laws get abused or not. But how do we change the culture and the values of the people and the companies that are building this technology? Because we've seen from the last 5 years of activity in other competing fields that we really can't trust Silicon Valley. How do we avoid falling into another surveillance capitalism trap, as happened during the Google and Facebook era, is what one of our listeners or watchers has asked. How do we change culture? How do we change values? I don't think just having some laws like that's going to do it.
I think one of the ways, this is Dennis, can you hear me? One of the ways to do this is to create a serious relationship with the stakeholders that you're trying to address. And that's a lot of what we try to do. We build the systems with them. We have human computer interaction design, user experience sessions with the stakeholders to make sure that they understand how it works, and they can get to give their input into the system as we build it, which I think is important, both for functionality but also trust, and changing awareness and enabling this level of transparency that changes the culture in many ways. So we're not operating in a vacuum, so to speak. We try to operate very closely with the stakeholders. Another thing, just to talk about just justice and delivery, we can do very simple things that people don't necessarily always think about, and that is to design the systems to work on older versions of Android and things like that we care a lot about, and we do very from a very functional level. And I know that's a simplistic way to put things, but it's actually important because it reminds people that we actually care about lower middle income individuals who won't have an iPhone.
And they may not have broadband. I mean, we have to be careful about what we assume about our populations.
I'm actually curious, Eric, since you're coming from Microsoft, and Microsoft has been in some ways a leader about how to use computer vision technology versus these other companies. Note that I didn't say Microsoft in that sentence. So is that just come from leadership at the top, i.e. the president of the company who's been very proactive in these issues? Or how do you get to that culture where people are being really on the leading edge of how to be careful about which of these AI technologies are used and how they're used?
Yeah, well, I don't want to do comparisons among companies and leadership right now, but I can say that, and I just gave an internal talk about our responsible AI governance and journey, and it does go right to the top of the company, and that's very important, I think, in terms of the culture and the priorities, the willingness to trade short-term profits off for doing the right thing, and so on. I hope to see this kind of behavior at other companies as well. But and we are seeing general growth in awareness across the large and smaller companies. I see this through the Partnership on AI discussions and so on. There's really an interest in understanding the frontier, understanding the admixture of these rising technologies, including flows of data, besides even beyond the analysis around issues of privacy, but also trustworthiness of the system, the values, the reliability, issues of civil liberties, civil rights. I think we're going to see mixtures of corporate responsibility coupled with regulatory activity among legislatures. There's another whole area here that I'm just coming off being a commissioner on the National Security Commission on AI. And there's a big concern that, let's start with the United States and maybe, like-minded nations, but we have a bunch of the world, sort of living in a surveillance state to start with. So we have lots of issues to work on both nationally and internationally.
Before I go to Deborah, I just want to interject that one of the metrics that you might use is whether the systems that are being built incorporate the justice issues as they're being built, or if actually the communities that are being impacted are involved in deciding which systems will actually be built in the first place.
Yeah.
There's a switch there, because there's one thing like, I'm going to do X and I'm going to consult, versus before I even decide what I'm going to do, I'm going to consult. Deborah?
Yes, and a very good point. So just, it's, I wouldn't, back to arguing like in the good old days, I wouldn't dismiss the role of law and the fear of law when it comes to funders, because in the end, it's about moral leadership and all those things are important, but it's about at the top, and it's also like about bottom line and the business model you build. You can't really afford to be that more of a leader, moral of a leadership, if taking some certain actions completely undermines your business model. But to your question about culture, I'm remembering the last in-person meeting I attended. Suchi was there. And then somebody who I had not met before, correct me if I get the name wrong, a Stanford law professor, Michelle Mello?
That's right, Michelle Mello.
Yeah, and she was talking about culture and how, when you go through medical school and even law school, you have these sort of some ingrained professional ethics. We won't comment on how that has turned out in the end, but in any case, that people building a lot of the tech don't even have the opportunity to get exposed to some of that. So I really just, that was something I hope to follow on and come and visit and talk to her more about, and that hasn't happened since, but I think that's a really good reference on some of these questions about culture.
Yeah, and one comment I'll make is that, at Microsoft, and I think at other companies as well, we have a growing set of practices around going from data to applications to maintenance, looking at the whole machine learning, we call it the life cycle, with requirements internally as to how we do things, and with lots of reflection, including a sensitive uses review. I have to say that we've done over about 225 sensitive uses reviews that lead to like gating of technologies, saying no, modifying technologies, working with customers very closely through a panel that thinks through the costs and benefits and downsides and issues with inclusion, fairness, quality of service, and so on. And I have to say that during the COVID-19 time, this past year, so many applications came through on the medical front that went through that review process. It was almost overwhelming to the sensitive uses panel. So lots of considerations and thinking. One other comment is at Microsoft, we set some standards and announced facial recognition principles. We also recognized that we didn't want to compete to the bottom because competitors weren't doing the same thing. And therefore we got involved in legislation, working with staffers in Congress, working with Washington State to help to write legislation that we thought was the right kind of regulation, so we could basically be on a level playing field with competition.
I wanted to move to back to Deborah's initial talk. You talked about the elderly and the challenges there. And, we always say, well, one of the challenges is that they are not always the most technically hip. And by the way, hip is not a very hip word, but the elderly are not the most technically hip. And this is likely to be always true, right? Because even we will be overwhelmed by the technologies that our students are creating when we get old. And so I'm wondering, and yet, so that leads to maybe the AI should be in the background and it really shouldn't be in the awareness of the patient. But on the other hand, Dennis's talk literally had the AI in their face, literally. And so I just wanted to know, how do you figure out how aware the patient should be, and to some extent the caregiver, about the fact that these newfangled technologies are being introduced in their care?
that, the notion of context, right, applies so much, right? So one of the reasons I just am now focused on this tech for caregiving is it's somewhere in between the making it ambient and making it available to the person delivering that care and in those structured tasks. Obviously, that's a small slice of of how tech might apply to aging and healthcare, but it's the particular slice I'm looking at, in part because it's trying to get to that point. So let's bring tech in a way that can support the excellence of caregiving and the range of things that caregivers can do with confidence by bringing in that kind of immersive technology and remote guidance, both from remote humans and from remote agents. So that is one point on that. Now, I also really like around what Dennis is doing. It's not necessarily doing it all the time. It's engaging in an opportunity that is the right time during which to do that observation. And so that's another really, I think, powerful way to slice it. Now, to be a good guest to my host, I'm not saying there should never be ambient, right? But there is a trade-off there about always on ambient as opposed to focused on particular times of action and activity. And it's like always on isn't actually free. Not only do you have to deal with all those data and find the needle out of the haystack, as opposed to saying to somebody like doctors do, the get up and go test. Ask somebody to get up and go and walk across the room as a notion of readiness in an older, frail individual. Those are great opportunities to ask that particular thing. So I think there's a whole trade-off space here that's really interesting. Ambient and less visible and all of that and entirely in the background isn't always the right thing in my book.
And it seems to imply that these are going to be multidisciplinary teams with behavioral scientists and psychologists who can teach us a lot.
And a comment quickly also on this point, one of the things that we've discovered is that with this particular population of individuals, let's say with medium to high levels of functioning with autism, they want to know more about the AI, and by letting them learn more about it, like putting it literally in their face, it creates more trust, more transparency, more awareness. So again, it builds that trust and it sort of excites them, and it also, I think, creates a more powerful impact as a consequence of that. So that's another way of looking at these two things kind of in combination. But I do think ultimately there's going to be levels of context or variations in context where where things are going to be operating on one level kind of up in front and on another level kind of increasingly passive on ubiquitous devices. Both will be useful. And like with games that we design, we can have sort of combinations of those things where we can notice something happening that's an aberrancy, for example, using a model that we have running under the hood, and then call attention to it to maybe orient and change the educational programming as a consequence of that.
I'll make a quick comment, Russ, that I think that we have to really, as we get into more powerful AI technologies and they start to have tentacles in all aspects of life, we have to really stay vigilant on, and wait towards transparency and disclosure and consent. I think we need to even have requirements on applications from companies that are using machine learning to maximize engagement, even implicitly through the ad paradigm we have right now. Disclosure, consent. We are using machine learning and your data feeds and the data feeds of other people to maximize the time you spend on this application. That should be like a Surgeon General's warning when you get into the application.
I think just if I may add one comment,
Yes.
What would be really helpful is so much is happening so fast in technology, in the embedding of technology, yet technologists, as Deborah had mentioned earlier, we're not really trained in any of this. And I think we really need to rethink curriculum, both on the engineering side and the medicine side, to bring this kind of awareness and rigor, not in a sort of like a half an hour FYI learning online course, but a much more rigorous teaching and evaluation of responsibility Like, we need more responsible leaders who understand and can weigh in and reason through these kinds of very hard decisions, which are very rooted in cultural values, as opposed to engineering principles, which tend to be more black and white. And how do you get comfort there? So I hope this is something, I know this is something I think would be really amazing. I mean, Cornell should do this, Deborah.
Actually, with that piece of advice, our time is wrapping up, so I'm going to end the conversation. I want to really thank the panelists. We were seeing amazing comments from the audience with the breadth and depth of the commentary. So we're very grateful. We're now going to take a short break. We're going to return at 11:05 to begin our next session. That's 11:05 Pacific, which is 15 minutes from now. Thank you very much, everybody, and see you soon.
Thanks, everyone.
Nice seeing everybody.
Welcome back. At this point, let's turn our attention to the world of art. We've already seen AI generating a painting or creating a song. There's a question of how good they are. But now we're noticing more interesting relationships between art and AI. New questions arise around the nature of creativity and the audience's relationship with the piece, let alone all the crypto art purchases we are now seeing in the news. To start our discussion on AI's role in art, please welcome Ken Goldberg. Ken is a professor of industrial engineering and operations research at the University of California, Berkeley. He's an award-winning roboticist, filmmaker, and artist. And his art installations have been shown at the Whitney Biennial and the Berkeley Art Museum, among others. I actually met Ken in my first week of graduate school at Carnegie Mellon, as he was asked to hold his PhD defense during our orientation so that we new kids could see what finishing a great PhD was like. Even then, he was this cool guy combining robotics and art. And I still remember being amazed by this robot arm that he had programmed to make unique paintings. Ken continues to create groundbreaking combinations of art and robotics today. Ken, welcome, and please begin your presentation.
Thank you, James. It's a pleasure, and I remember that day very well. So I'm really delighted to be here and to speak to you and the HAI audience about art. And I'm going to try and take it in a slightly different direction. But before I go, I want to share a joke about artificial intelligence. I'm going to try this out on you guys. So the joke is that a startup has made a major breakthrough in artificial intelligence, and they decide that to announce it, they're going to do a test during the Super Bowl, and they have a worldwide competition to figure out what question should they ask it. So after months of suggestions and voting and everything else, everyone agrees the question is going to be, is there a God? So at the next Super Bowl, everybody's watching, and they type in the question, and the AI system puts out a progress bar, bink, 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 insufficient computing. So everybody, so there's a big disappointment, but the CEO goes around and talks to all the other tech companies, the big players, Google, Amazon, Facebook, even Apple agrees. They get Baidu and Alibaba. Everyone basically agrees to share their data with the company. In fact, share their computing, and also all the computing of all the laptops and desktops and phones. So next year they go back halftime, type in the question, bink, 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 insufficient data. So now the CEO, she's undaunted. She goes to the United Nations. And she says, we need everyone to get on board. So she convinces China and the US and the Russians. Vladimir Putin is on board. Everybody's on board. They agree to share all of their data without restrictions, all the government data, all the personal data, all the private financial data, everything with the system. So it will have the best opportunity, all the networking and the computing in the world. And so they go back to the Super Bowl and they type in the question, bink, 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 thank you. Wait, what did it mean? Thank you. Well, that's not the answer. Type it in again. They must have misunderstood. They type in the question, is there a God? It says, now there is. Okay, that's my joke. Let's move on. I want to thank everybody who I've had the pleasure to work with over the years, and acknowledge the hugely changed world we've been living in the past year. And we've talked about this in the last session about healthcare. It is really affecting everything. It's also creating a real re-examination of many social issues. And there's been a lot of, I think, valuable reassessment and rethinking about Black Lives Matter and also most recently about anti-Asian violence at least in this country. And I'm going to come back to that. I want to say that there is a huge division, and we have to acknowledge, not only in the US, but worldwide, between different groups, and it's persisting. And I think this is very interesting in the context of what we're here to talk about today, and in terms of AI. That I want to go back in history, though, to put some of this in context and talk about how artists and thinkers have wrestled with AI over the centuries. And let's go back all the way to Ovid's Metamorphosis and the story of Pygmalion, which was a sculptor who builds a statue, creates a statue that he then falls in love with. And the statue, it comes to life in his mind. It's a fascinating story. It's really the template, the archetype for a series of stories after that. Goes up through the Golem of Prague, again, creating a creature that in some way runs amok and leads to the downfall of the creator. Now, we also see this fascination with automatons that goes up through the Middle Ages and into the Renaissance. Da Vinci has built and builds a number of mechanical creatures, a mechanical horse. Descartes writes very persuasively about automata. And Volkansan makes the mechanical duck, the mechanical boys. And then we get to von Kempelen, who is a great trickster. He builds the mechanical Turk. And everyone knows the story. It's fascinating. There's a machine, it's brought out, and everybody inspects it, and then it proceeds to play astoundingly well at the game of chess. And it's not until years later that it's discovered the secret was that there were a small person, a very petite person hiding inside the machinery who was driving the chessboard. And that person was a trained chess player. And in fact, there's a wonderful history about this, that the chess community knew about this because they used the world expert chess players who had a whole network of going and coming in the back doors to make this thing work. Now, this is right around the same time as E.T.A. Hoffman writes the wonderful story, The Sandman. And it also features an android, an automaton at its center. And in this case, it's a female automaton who's quite beautiful. And a boy falls in love with the creature. And the evil doctor there's a very deep psychological interaction between him and this doctor who is trying to lure the boy. And you have to read it for yourself. It's very complex. But that's in let's see, 1818, Shelley's Frankenstein, of course, comes out. And this is related to galvanism and the interest of electricity at the time. And we all know that story very well. But interestingly, then in a century later, we have the flu pandemic of 1918, 1919. And the reason I call this out is because it's right at the tail end of that pandemic that a very significant event occurs. One is that a book on exoticism comes out, Victor Segalin, 1918, which is later developed and expanded very eloquently by Edward Said in 1978 in Orientalism. But the other big event that happens at the tail end of the 1918 pandemic is Freud publishes his book, the Das Unheimliche, the Uncanny. And this is very important. It's a very dense essay. It's known as Freud's only aesthetic study of aesthetics and art. And he really studies this in the context of Hoffman's book and also Gothic literature, but more importantly, psychology more generally. He talks about this emotion for which we don't have a word in English. Uncanny really doesn't actually capture it. It's something that makes your hair stand on end when something is that you're familiar with suddenly feels strange. And that dynamic in which he elaborates in many different ways. You have that sensation of being watched. There's many other forms in which it takes, but Freud is the first to write about this as a concept, and it becomes increasingly interesting for artists and writers over the following century. Now, also note this timing, because that's 1919, right after the pandemic. A year later, Karl Čapek coins the term robot in a play in Czechoslovakia that he launches called Rossum's Universal Robots. So this is interesting just to think about this climate, and you have the Uncanny coming out and you have robot right at the tail end of that last pandemic. Then this continues. There's a lot of interest in the idea of robot, and Uncanny, and Fritz Lang's Metropolis comes out in 1927. Asimov's Three Laws are published in the iRobot series in the 50s. Nam June Paik is the well-known Korean artist who comes to the US and builds a series of robotic sculptures. And then in 1970, Masahiro Mori does something very interesting. He's a designer, a roboticist based in Tokyo, and he is working on prosthetic hands. And he makes the observation that if the hands are too realistic, they will actually cause people to be alienated. People will be turned off by these hands. So you have to make them not too realistic. And he basically comes up with a theory about this that he calls the uncanny valley. And it looks like this. If you imagine the horizontal axis of just a general plot, it's not really meant to be quantitative, but a plot of something being not human on one end and very human on the other. And then he plots that, he says that the likability or the agreeableness of the robot is on the vertical axis. And so he basically plots this chart. So as the robot becomes more human-like, it becomes more likable. But then it gets to a critical point in which there's a sudden drop, the valley. And that if you continue to make the robot more human-like, it suddenly becomes intensely uncomfortable and unlikable. And that's the uncanny valley that Mori talks about. Again, if you continue to make it more human, you come back up and you get into real humans, and those are quite likable. So this is what he's talking about. This and Ishiguro is a roboticist, and I consider him an artist, also in Japan, and he's building these humanoids, and they're very much in the spirit of tweaking our perception about our comfort level between something that's intensely lifelike. And I don't know about you, but I find these a little disturbing. So I want to say that there's this idea of the uncanny. I can really talk for quite a long time about it, but and hopefully we'll have a chance to talk more in the panel, because I think it's a very interesting theme to think about in the context of AI and art. And I also want to make a distinction between the representational uncanny, that is where you're looking at someone that might something that looks human but isn't, and what I call the experiential uncanny. And that is where there's experiences that may also feel lifelike but are not. And I think that is a generalization of the idea of the uncanny. And I'll give you two examples from my own work, and to close with. And one is the what I call what we developed back 25 years ago now. It was we called it the Telegarden, and this is the early days of the internet. The internet had come out in 1993, 94, and my students and I were extremely excited about it. We wanted to get involved and contribute, and we had a robot in our lab. And so we thought, well, what about connecting the robot to the internet? And that way anyone in the world could have access to it. So we negotiated to get an industrial robot arm, and we set it up. And what would it do? Well, we decided that it would tend a garden. And this is really where the artistic side of it came in, because to my mind, the garden was the last thing people would want to do over the internet. I thought, if all the things that the benefits of a garden is to go out and, get your hands dirty, and to be with nature. But I wanted to see, it was an experiment. So we built this thing, we put it online, and we didn't know if anybody was going to operate it or not, but it was surprising to us. The system was set up, so again, with a very simple interface using Mosaic. Some of you may remember that ancient browser, and it allowed you to visit the garden, move the camera around. The camera's at the end effector, and then you could also water the garden, and if you registered, you were then given a seed, and you could choose anywhere in the garden to plant it. Well, so as I mentioned, we didn't know whether it's going to be, what the response might be. And at first we got, a few dozen, then quickly hundreds, and then thousands. And if any of you are gardeners, you know that it's in about a 3-meter circular space, you can't really sustain more than a few hundred. So it quickly became vastly overgrown and became much more of a study in the tragedy of the commons. than we anticipated. Anyway, we kept this thing going for a while. We ended up writing a book that's still available, and it's we invited 6 engineers, 6 artists, and 6 philosophers to write chapters for the book about the issues of the garden itself and what we called telepistemology. Now, this is a term that never caught on, but the idea was, what is the status of knowledge at a distance? That was an issue that arose for us. And in other words, how would you know that there is a real garden? And here, let me explain that a little more. Is that it is possible that we could have created this as a virtual reality system, which in other words, a fictional system made with computer graphics, instead of a real system, which we would call distal reality, where there's a real garden, but you're distant from it and you're mediated through the internet. And this distinction is subtle. And in other words, how do you know? How can you make that distinction between something that's fictional but realistic and something that's real but distant? And that was a central question of telepistemology. And I believe that since we put out the Telegarden 25 years ago, the question has become even more interesting. In some sense, virtual reality has become much more sophisticated. As we know, computer graphics is almost indistinguishable from reality, and there's deep fakes and many other troubling versions of that. And then reality has also been called into question. I mean, need I say more? I mean, I think we're in an era of questioning what is real, what is truth. And so in these contexts, this dynamic becomes even more complicated. So now this comes to our new project, and I've always wanted to revisit the Telegarden, but I didn't want to create the same thing again. So in the last few years, I've been very interested in artificial intelligence, and as a roboticist, I've been very, very closely following the advances in deep learning. And this really is a major breakthrough. It was largely, initiated by Fei-Fei Li and the work on ImageNet, which led to the major breakthroughs from Jeff Hinton and others in demonstrating the power of deep learning and its widespread adoption today. And we use it in my lab. My students and I use it regularly. We work with colleagues at Berkeley AI Research Lab. I'll put in that plug since we're here at Stanford today. But the idea of deep learning is very profound and provocative. And there's been a lot of excitement around it. I think the same kind of uncanniness has returned in the context of talk about superintelligence and the singularity. I mean, the idea that we are now on the verge of surpassing human capabilities. And I wanted to, again, push back on that and question it and ask, in this case, could a robot, an AI system, use deep learning to acquire the ability to tend a garden? And so, in other words, and the Telegarden was really exploring telepresence and human interaction, social interactions over the internet. But this is what we call the Alpha Garden is about artificial intelligence and our relationship to nature. And so the system that we're building, and it's an ongoing project, has a mechanical robot. And here's the shot of one version of it in a greenhouse at Berkeley. And so it's capable with this gantry of moving around in the garden space. And then there's overhead cameras that observe the garden and then determine when to water and prune. But it's a polyculture garden. So it has not only one type of plant, but multiple plants working in close proximity. So it's very difficult. And I would have to say, I'm sort of betting that it may not be possible. The robot has struggled with this challenge. And I'll just tell you one last story, which is that when we put the system up, it was we were surprised by the emergence of COVID-19 last spring, and we were forced to abandon the greenhouse. We weren't allowed to go back in, and then we watched helplessly from a distance over the cameras as the garden essentially went into its death throes, and it died. And I feel as though we watched this, and it was almost, to my mind, it reminded me of Guernica. This incredible struggle of the garden to send out flowers and send out essentially a plea for help in its last phases. All right, so the last thing I'll say is that all of this reminds me to some degree, the turmoil and the stress today reminds me of the fears about immigrants over the years. There's been, 100 years ago, there was again a fear of this idea of the yellow peril immigrants being from China. And Oliver Morton has this wonderful quote that robots are immigrants, not from a distant land, but from the future. So I leave you with that. Thank you very much.
Thank you, Ken, for that fascinating presentation, looking at your work with experiences, the uncanny valley, and now Ken and AI tend to garden. I really like it. At this point, I'd like to invite our students to begin their lightning presentations.
Hi, I'm Jack Atherton. This is Reality by Example, a tool for supporting amateur creativity through the use of interactive machine learning. So, Reality by Example is a tool and meta environment in virtual reality where people can construct a world by placing small examples of how they would like the world to look and act. Here the user is changing an example that the type of land here should be more bouldery. Then they place a new example that the color of the land over here should be more green. The tool interpolates between all their examples to show them something that it thinks approximates what they want, and they iterate by placing more examples. You can also leave temporal examples, like teaching a bird to fly by flapping your arms. After I've recorded one example for this bird, then it starts to move through the world using that data as a way of understanding how it should act.
For many of us, our voice is our most expressive communication tool. Our voice encodes who we are, where we are, and how we're doing. These contextual factors, some momentary and some long-held, influence the way we sound. My PhD work aims to define how this context space manifests within the voice. I incorporate psychoacoustics, sociomusicology, linguistics, and signal processing into my research. My research includes identifying pronunciation bias, learning context without labeled data, reconstructing how the voice radiates into acoustic spaces, and parameterizing the space between speech and musical sound. In concert, these projects aim to model a contextual paradigm that spans the diversity of vocalizations. Through designing AI to leverage how an artist or a communicator embeds their context into their personal sound, we can create voice-based technologies that lean into a user's individuality.
Hello, my name is Miguel Novello. I'm a new media artist, a filmmaker, and I'm an MFA student at Stanford. My recent work has investigated an evolution and decay in language, simulations of identity, and media translations. Understanding our mediated selves is how I think I can achieve an open and free communication needed for my work. Bodiless Migration 20 in Hyperspace Time is a video piece composed of 3 panels and meant to be experienced on the internet. It's a direct response to my engagement in our current reality, and for that I made an avatar that allows me to engage in a modular free-form world. In this piece, I'm using computer animation software, machine learning animations, undersea footage, zoom screen capture, drawings, and chroma key compositions. The use of AI comes within the creation of an image of my body without its physical properties. For that, I combine a series of data sets, such as my body motion, my weight, scale, and memories of my interaction with technology, such as images of my internet consumption, my data usage, my browsing history, and the time I spent on screens. I compose a new blue world full of simulation in order to come back, perhaps with a newer physical and conceptual body, to envision myself in new forms of empathies, to reimagine borderless stories, and ultimately feel as free as I feel in the digital space, but in the physical world. Thank you so much for your time.
Hi, I'm Panos, and this is the presentation for Artemis, Affective Language for Art. In Artemis, we introduce a dataset that contains affective responses of thousands of humans with respect to how they feel when they observe a famous work of art, and crucially, a written explanation regarding why. The collected explanations are very rich in abstract, metaphorical, and imaginative content. Furthermore, with Artemis, we embrace open-ended explanations and the subjectivity that comes along with different individuals. Tapping on our rich dataset, we design neural speakers that, similar to humans, can create explanations to support different emotions, such as these examples on unseen paintings that explain positive and negative emotions. Interestingly, our neural speakers can guess the likely emotion for a painting or be asked to express different emotions for the same painting. For more details, including the data and code, please visit our webpage.
You really saw some excellent ideas there in those talks by our students. Next on our agenda is my colleague, HAI Associate Director Michelle Elam, who is a professor of humanities in the Stanford Department of English. Michelle's work examines the intersection of race, technology, and the arts, and how the arts can function as a way through which to frame social questions about equity in emergent technologies. Michelle, please begin when you're ready.
Thank you so much, James. Thank you so much. I'm so pleased to be here. You know, a lot of my work in the humanities and social sciences, as you suggested, has really examined how racial perception, this kind of what are you question, impacts outcomes for health and wealth and social justice. So I bring that to the study of these intersections of race, technology, and the arts. And I confess that I began with a very personal wariness about FRT, facial recognition technology, and issues around bias and privacy and rights to one's own image. Because in part, a university photographer years ago sold my photograph without my knowledge and certainly without compensation to Getty Images, which in turn monetizes it. I'm usually represented as a member of the currently hot market category of ethnically ambiguous, part of this new pale, palatably diverse American demographic who I was told by one exec can better push product. Slide, please. Next slide. So this is an example of it. This is actually from the Nat Geo Changing Face of America. So this, all to say, is this personal mishap with an image bank led me to this research interest that I have in racial recognition processes. It was sort of around the same time that people started critiquing racial bias in FRT. The students also pointed me to this disturbing trend in popular apps that putatively diagnose race and ethnicity, however poorly, as you can see from my student here, next slide, who is, he tells me, of unbroken Chinese descent. So we have next slide, please. So, and go ahead and play that. Let me see if we have that. Yes. You can see his pained expression of what he ends up turning about. But the question of ethnicity, I mean, of accuracy isn't really the issue for me. I mean, what's problematic about this is it's obviously a throwback to the 19th century pseudoscience of phrenology and racial taxonomies, which were inescapably tied to social hierarchies. Remember that the 1896 Supreme Court Plessy versus Ferguson case upholding the constitutionality of racial segregation laws for public facilities, you probably know it as the separate but equal doctrine, depended on being able to determine just those kinds of racial percentages based on kind of blood quantum of people. So all of this galvanized my exploration of the broader relationship between representation and technology, and the arts arrive at precisely that intersection. So I titled this talk Artful Intelligence, to suggest the ways that AI and the arts can be mutually beneficial, maybe even mutually constitutive. And I'm totally all about dissolving the techie fuzzy divide, what E.P. Snow calls the two cultures. But let's be honest, recently, some of my own colleagues, I would just say on the humanities side have gone pretty quickly to a kind of existential nausea when I talk about arts and artificial intelligence. So I think that was partly prompted by obviously OpenAI's GPT-3 next gen language modeling system, using these neural networks that are trained on some 1.5 trillion words to create poetry, music, play scripts, and more that can seem convincingly, in some cases, indistinguishable from human production. And that has induced in many that uncanny valley that we were just hearing about, this sort of queasiness that comes when a technological creation too closely approximates reality as we know it, when the simulacra and the sui generis real appear to lose distinction. So I get it, I have felt it, but I think I have a cure, or maybe I just have a Dramamine drip for this particular kind of vertigo. Next slide, please. So the way to get there for me is I ask myself this question. So what can arts do for AI? Or to flip the script, what can AI do for the arts? And I'm going to suggest some responses to those questions as context for that tonic that I'm proposing here for this kind of particular anxiety that happens when art and AI meet. So first, I just want to say a word about the arts in this context. We know that the arts are crucial incubators for how publics perceive tech. And moreover, there's so much research that documents how cultural storytelling helps sort of shape the civic imagination that can in turn animate political engagement. Next slide, please. It's worth taking seriously, I would suggest, the comment made by Instagram's Adam Mosseri that his recent, well, it's not recent anymore, policy eliminating public likes because of his concern, as he put it, about the unintended consequences of Instagram as an approval arbiter. Anticipating China's social credit system actually was partly informed, he says, by an episode of the Netflix series Black Mirror. Of course, which I recommend everybody should see, but of course there's not always this tight causal connection between arts and action. But the arts value goes well beyond any instrumentalism, any ability just to sway opinion or behavior, as I'll suggest, I hope here. You know, for those, by the way, who are harboring a lingering assumption that the arts are somehow an indulgence or ornamental to the human experience, you know, you've also got the field of neuroaesthetics that's providing evidence-based research documenting how arts engagement improves brain development and cognition, including executive function. Next slide, please. The next couple slides, actually, these are just, there's so much data already demonstrating that the arts are all the more crucial during crises like war or protests or the pandemic we're living through now, just for mental and social well-being. But for me, perhaps most profoundly, the arts offer different epistemologies, different ways of knowing and experiencing the world. They're enacting world models and frameworks that are alternative to what at times can seem really dominating or totalizing technological visions of a very few. Next slide. So I'm thinking of Amelia Winger-Bearskin, for instance, who's a Mozilla Fellow and currently a Stanford Denning visiting artist and technologist and filmmaker, amazing person. Seneca Cayuga Tribe, who's also developing these ethical frameworks for software development and kind of co-creating systems of care and community and accountability, what she calls sort of code utilizing indigenous ways of knowing and being. She calls them wampum codes. And those involve alternative designs that are informed by cosmologies. They have different origin myths. They have decentralizing storytelling and other practices that are meant, as she puts it, to leverage bleeding edge technology to reshape the world for better. And it's helpful because it means offering, at a minimum, more narratives than these sort of Western fairy tales and biblical plots and apocalyptic Jeremiads that more often and often unconsciously inform the imaginations of technologists and often script their production and their design. So then we have, next slide, please. Joy, I think we need next, might be behind one. Joy Buolamwini, who most of you, I'm sure, know, multimedia, spoken word, artist, coder, founder of the Algorithmic Justice League. Next slide, please. Stephanie Dinkins, in conversation with Bina 48, who's an intelligent computer developed with neuroarchitecture. I think they're talking about robot civil rights here. Next slide. There's a recent exhibition of, oops, I think we skipped one, but, oh, maybe not. Oh, there's another exhibition called Recoding Cryptech. And this is was an image by Peter Eckert's work. It's informed by disability culture, and it tries to reimagine with technology the taken for granted norm of the so-called universal subject, which, as we know, is historically tacitly assumed to be white, male, able-bodied, neurotypical by scientists and philosophers alike. And then you have the next brilliant Rashad Newsom. Let me make sure I have that right, which you'll actually see. And since Rashad's has being, it's an AI griot, storyteller with a decolonizing agenda. You'll hear more all about it in a moment. And there's just so many more artists like this. Saya Wolfork, Miguel Novello, who you just heard, who gave a micro talk. They're also really, for me, models of what AI can bring, art can bring to AI. And I'm not just talking about multiplicity that can sometimes pass for diversity, which in practice can sometimes smack of a sort of noblesse oblige, as if it was a generous offering of a seat at the table that's already been set. You know, the artists, technologists, and most of them are of color that I'm thinking of, aim to upend the table altogether. And one of the ways they do it is, for instance, that fiction is not frictionless, as I've said. It doesn't aspire to a seamless user experience. And the arts tend to value the thoughtful pause. It's not usually about move fast and break things. And most people in the tech industry already totally understand that. So because of this different orientation, the arts lenses on the world offer these very distinctive insights into commentary on both tech and society, and especially in concert with AI, can make visible at really unprecedented scale, as with some of Trevor Paglen's work, some of the most profound social challenges of inequity and bias and surveillance. I'm not saying that art is somehow the conscience of tech, because they actually hold each other to ethical account. And that brings me to this second question. You know, what is it that AI can do for art? Because personally, I actually think it does a lot more than just augment creativity. It's really forcing the arts world into its own kind of reckoning. You know, AI generated art or augmented art or assisted art is provoking questions of the most foundational aesthetic norms and valuation. So what do we identify as art? You know, what counts as good art? How do you evaluate and economically value art with an AI provenance? Just who or what can make art? Who gets to decide? You know, who are these arbiters of the art world? And then might we just need some new ones? Next slide. And part of that is, you see, you know, I'm sure most of you have seen the hand wringing and gnashing of teeth in the world of professional art criticism over the sale of Christie's auction house of the AI generated portrait of the artist of Edward Bellamy. But that genie is so out of the bottle, and it's living the good life. We already have like explorations in AI assisted poetry, generated film scripts, AI informed musicals, AI advised symphonies, AI curated art histories, augmented music, including Stanford's own Gu Wang. And there's actually a lot of organizations that are working to ensure equitable pay for artists given these new mediums, since that future work impacts arts, of course, as well. And I do think that these debates are pushing art to actually become more expansive and less inclusive, if you will. Particularly, I want to mention one particular thing, that it can help challenge the fetishizing of individual genius. Next slide, please. So this is a tricky one, because somebody might say, for instance, you know, well, what's problematic about that? You know, and it tends to enshrine the great man theory, that there's a few exceptionally gifted, providentially tapped men who make history, make art, make the world go round. You know, Taylor Branch's Pulitzer Prize winning award biography of Martin Luther King put the lie to that a while ago, but it's still held tightly to by many nonetheless. And this cherished idealization of the singular genius, this sui generis iconoclast that's especially valorized in tech culture, could only then take us as like sort of lesser art, anything that's collaborative or communal art. Next slide. But I want to say there is a growing appreciation, I think it's important, of crowdsourced poems like this one. This is Natasha Trethewey, was a poet laureate of the US, and also a participatory art. You see that sort of emerging there. That's shifting that paradigm a little bit. But generally, there's still great pains to protect the specialness of those few, since you can't have, by definition, too many acknowledged geniuses, or they just might be mistaken for the rest of us. And it's actually this obsession with genius, or at least that model of a singular genius, a view so commonly held in the US, that I think contributes to the queasiness I spoke of at the outset when encountering AI fiction or poetry, because they seem to diminish the human exceptionalism that geniuses are thought to represent. This kind of achievement that is meant to set humanity above and apart from the rest of the earth. In fact, AI poetry in particular touches such a nerve, not just because it taps into these broader legitimate anxieties about deep fakes and forgeries and the like. I think the anxiety goes a lot deeper because of all the art forms, historically, poetry has indexed humanity. It's long been considered, one of the highest, most complex forms of individual expression and cultural achievement. And of course, it's precisely for this very reason that poetry was used as a measure of a person or a race's humanity, or in the case of African Americans and really anyone deemed non-white, of their lesser than human status. Next slide, please. Hence, you've got Thomas Jefferson's infamous argument about the innate inferiority of Black people as the basis for denying them emancipation. As you see here, he couldn't imagine a Black person could write narrative, let alone poetry. Whites were so disbelieving that a person of African descent could possibly produce poetry that in the 1700s, Wheatley, he was the first African-American to publish a book of poetry, had to have her master and a whole gaggle of white officials testify as proof it was her, and thus that she was human. And I mention this racial history because I do think it gives us an opportunity, and I hope it's not too heretical, to unmake poetry as the special mark of Enlightenment progress or the measure of being human. I think you'll agree it takes the pressure off of both poetry and us as readers and writers of it. And then we can get to a place where when we're faced with a GPT-3, a poem like this next one, next slide, generated by a prompt by the 1978 poem by the renowned African-American poet Maya Angelou, that some of us don't feel it as such a scary threat and an apostasy of what we've been taught is proof of our humanity. Yes, as a scholar of African-American literature, when I read this poem, I am so annoyed by too much to even name here, the weird vernaculisms, the NLP failure to catch the poem signifying on Black literary tropes. I mean, don't even get me started. But understanding that a GPT-3 poem isn't, or at least it shouldn't be, a sign and symbol of my or some technology's humanity actually calms me. And frankly, finally, what settles my stomach, and I hope some of yours, is that GPT-3 generates form, but not meaning. I mean, everybody agrees that. So literary meaning is not autotelic anyway. It doesn't simply, its meaning doesn't inhere in the words alone or even in the words next to each other on a page. Last slide. So if you think, for instance, of meaning as distributed and interpretation as an event, for instance, when you go to a play, when we could attend theater, the meanings of a performance emerge not just through the play script we understand, but through the director, the actors, the set designers, the audiences. It's a negotiation with the complex historical and cultural context. That's kind of a simple way of remembering how meanings are just not embedded in a word or a paragraph, and that in a true way, we are co-participants in an art's meaning significance. And we're going to continue to be when we engage with a work of art, however created. It's true, we're not communing with the mind of a poet when we read the GPT-3 creations, if that's what you were after, but authorial intent or an author's biography wasn't sufficient or even recommended really to understand, let alone appreciate a work of creative writing. So I'm totally thrilled to see the kinds of challenges that AI poses to the art world and arts making. And I want to be sure we embrace the reckonings and reimaginings that art requires of really anyone before developing or implementing or working with sophisticated technologies. You know, there's so many wonderful institutions, in addition to Stanford, who are working at those intersections, Carnegie Mellon, LISC, Johns Hopkins, MIT, so many in the UK too. And I see as part of the future for artful intelligence as actually involving education. Last slide, as integration that is distinguished from a colonizing assimilation of arts thinking and practice into so-called virtuous text products and experiences that are then brought into the undergraduate curriculum, that how we nourish the mindset of young people from the very outset of their education, rather than wait till they've achieved a PhD or are industry influencers, before they're tracked as creatives or coders, before they're told they can't be artists and technologists to be scholars and activists, because really children, untutored children, are already wonderful models for artful intelligence. I think educational institutions and pedagogies need to catch up to that. Thank you.
Thank you so much, Michelle, for that powerful talk. I love hearing you having you as part of the leadership of HAI to get this important perspective on AI and what it means in the arts, and also what the arts can mean for us as technologists who are building some of these technologies. Next, we have HAI visiting artist Rashad Newsom. Rashad's work blends collage, sculpture, film, photography, music, computer programming, software engineering, community organizing, and performance. His work celebrates Black contributions to the art canon and creates inclusive forms of culture and media. Rashad, please take it away.
Hello, thanks for having me. So I just want to make sure that my slides are ready to go, or do I have to? Okay. All right. Okay. I feel that the core narrative of the human condition, birth, growth, emotion, aspiration, conflict, and mortality are all susceptible to corruption within Bell Hooks' theory of the capitalist, imperialist, white supremacist patriarchy. I believe we must examine how these operating systems of domination function intangibly to define our reality before we can get to the business of making a human-centered AI. The results of this interrogation should then act as the moral compass for this work. We can attempt to understand the meaning of being human from situations that seek to keep certain beings outside of the accepted realm of humanity. Since it has been said frequently enough that slavery denies humanity to slaves, it is crucial to find out what it is that is being denied and how the conceptual interpretation of the slave works. As scholar Ruha Benjamin argues in Race After Technology, discussions of robots have been historically a way of talking about dehumanization and not about racialization, even though the that word always fucks me up, etymological root of the word robot is check, coming from the compulsory service. Historically, Black people have performed that unpaid forced labor. When we came to America, we were not acknowledged as human beings, but things or tools, neither occupying the classic subject nor object position. We function as particular types of objects seen as limited in thought and feeling. Historically, there was often doubt about Black interiority, a convenient ideology making the mechanization of slave labor natural, even inevitable. As a result, we occupied a peculiar non-binary space of being, which has disturbing analogies to the queer space inhabited by robots. Slaves and robots have in common that they are meant to be excluded from the concept and the company of humans and are intended to obey orders. Robots from films and television shows like Blade Runner, The Terminator, Ex Machina, Prometheus, and Westworld provide a way to think about the interactions between technology, intersectionality, and dehumanization. Could this be a starting point to call upon the imagination as a way to reconstruct and re-envision the idea of being? Can we garner strength and inspiration from these concepts? Using a combination of animation, game engines, scripted responses, generative grammars, and basic machine learning models, I produced a unique and provocative chatbot called Being in 2019. This version of Being can be seen as Being 1.0 and is an expansion of the research that informed my previous assemblage and sculpture work that explores the art historical erasure of African Americans, as well as what we understand as abstraction and technology in the West today. Being 1.0 was a sort of interactive installation where when viewers entered the exhibition, they would walk up to the microphone in front of the screen and say hello, which would then trigger the script. Being would then act as a tour guide of the exhibition, but periodically Being would break protocol and say things like, look, boo-boo, I just can't. Or look, I don't have time for this. I need to express myself. And I was doing that with this bot as a way to sort of think about conversations that were happening in my other work around the importance and complexities of agency. And within this particular project, thinking about agency around robots, our agents. And so what would it look like to write a script for agency for a robot? And for me, what that looked like was them breaking protocol. Also giving them the ability to be creative and express themselves. Often in sci-fi films, there is this narrative trope where if a robot is able to create, they will create more of themselves and kill human beings, which I personally believe is rooted in a deep narcissism that stems from white supremacist ideals. So within the exhibition, being is not only allowed to express themselves, but also to take part in the role of a tour guide when they want and leave that when they want. During my 2020/2021 artist residency at HAI, I've been focusing on the concept, scholarship, and creation of a counter-hegemonic algorithm. Since October 2020, I have been compiling a large data corpus of related texts such as Bell Hooks, Paulo Freire, Frantz Fanon, James Baldwin, Michel Foucault, Judith Butler, and a slew of others. This material is used to create a unique search algorithm that uses non-Western index methods and highlights alternative histories and archives, such as abolitionist texts, queer texts, and the like. Using this algorithm, I want to sort of highlight what I feel artificial intelligence is not doing at the moment. Also, I'm looking at this model as a griot, and in West African tradition, a griot is a healer, a performance artist, an archive. And I've been thinking a lot about the whole idea of an archive. And because of relentless marginalization of the Black queer community, so many people in that community have died, particularly when you think about the history of the ballroom community, which is a community I've been a part of for a long time. And so I've been working with leaders in that community and using mocap to motion track the movement data of practitioners of Vogue Femme from old way, new way to Vogue Femme and all its subsets, and sort of having beings, avatars sort of act as an archive for that dance. And then I will write a script using the counter-hegemonic algorithm for being to propose what I'm calling decolonization workshops. And these workshops will be comprised of, at one moment we're dancing, at another moment we're sitting down, engaging in group EMDR therapy, and also critical pedagogy. And for me, this is sort of a reimagining of non-Eurocentric archive and education models. In addition to that model, I created an offshoot that I guess can be seen as being 1.5. This particular model is really going to be more of an app that exists on the phone, and as well as a mobile, computer-based app. And this app is created specifically for African Americans. And it really was inspired by the recent rash of killings last year. I was feeling a lot of anxiety, depression, and rage, quite frankly, around what was going on, as was so many people in my community. And I wanted to do something, but at the moment we were all in lockdown. And so I thought, I had this machine learning model, how could I use this model to be of service? And so since then, I've been developing another version of this bot that will sort of act as a virtual therapist, sort of building on some of the ideas around the early virtual therapist, Eliza. And so Being will offer to their users EMDR therapy. They will act as a mindful meditation leader. They will also, using social media, connect their different users so that they can also engage in healing work outside of the work that they do with them. They will also give the users daily affirmations, and as a way to make sure that this tool gets to the communities that need it. I'm working with Hyundai to create a sort of being mobile where we're going to quite literally pull up to hoods across the nation and make people aware of this technology, as well as do a sort of a wheat pace campaign in all of the cities that we're going to hit, and do a series of New Orleans style parades that galvanize the community and make them aware of this technology. Thank you.
Excellent. Thank you, Rashad, for sharing these thought-provoking works, and especially ideas on what AI is not doing right now. Our final speakers in our art session are focused on the relationship between music and AI. Hilary Hahn is a 3-time Grammy Award-winning violinist and co-founder of DeepMusic.ai. Carol Riley is her co-founder and the CEO of Deep Music. Carol, Hillary, welcome, and please begin your talk.
The last 2 years and talking about it together in interviews, but this is actually our first speaking engagement together. So we're excited and honored to introduce the work that we've been facilitating. We co-founded this organization together because while we were talking, we realized that there was a need for a designated community to connect the AI and arts fields in a space where we could share ideas and without judgment, we could have feedback for whatever we exchanged and the projects that could be created. So today we'll be presenting the who, what, why, and how behind deepmusic.ai and sharing the first phase of our project, which was to commission and premiere AI-assisted pieces from 3 prestigious, highly original composers using world-class AI tools. We'll then share what caught our attention during this process and conclude with a video of Hillary's world premiere of one of these works. So first, we're going to just introduce ourselves more in detail.
Hi, I'm Hillary Hahn. I'm representing the East Coast today. I'm over in Boston. As a violin soloist, I've been performing professionally for nearly 30 years, and I tour 5 continents on a regular basis. I've made 20 feature albums and received 3 Grammys. My latest record, Paris, is currently at #1 on the classical Billboard charts, and I've premiered about 50 works of new music that were written for me. I'm super inspired by artists' creative processes, and I love connecting people through the shared humanity of the arts. Carol and I met in Baltimore through friends more than a decade ago while Carol was in grad school at Johns Hopkins. I've always appreciated her empathic perspective, her broad knowledge base, and her curiosity. In fact, deepmusic.ai grew out of an engrossing 3-hour conversation about the benefits and challenges of linking artists with AI. We've since delved much deeper into the connections between the fields. It's galvanizing to merge seemingly disparate landscapes. Through deepmusic.ai, we hope to encourage greater cross-pollination between AI and creativity, bringing more people together to influence the future of these fields.
Yep, and hi, I'm Carol Riley. I'm an AI entrepreneur and roboticist based in Silicon Valley, right down the street. And it's been amazing to have the opportunity to work with Hillary, someone whose work I've long respected, not just for her technical proficiency performing, but also who brings so much thoughtful reflection to her craft and who really knows herself as an artist. It's been really fun just to work with one of your friends and have the chance to connect creatively. A little bit about myself. Like Ken, I'm also at the intersection of humans and machines, researching how tech can enhance our lives. I built air-sea and space robots. I was previously working on surgical systems at Intuitive Surgical Space Satellites at Lockheed Martin, and I founded a self-driving car startup that actually spun out of the Stanford AI lab here. We were acquired by Apple in 2019. I view AI really as a tool that can augment us to become superhuman. So whether it's going places we typically can't, like outer space or in the depths of the oceans, or scaling down motions with superhuman precision, or scaling up boulders to pick up boulders, I think our mission is really to be human-centric. So, the mission of deepmusic.ai is to connect top professional artists and scientists to help shape the AI tools of tomorrow. And over the past few years, I've been interested in AI's impact on creativity and art. Music is one of the earliest applications of AI. They both have deep roots in math and have been so intertwined since the beginning. So we wanted to start there. And I see AI as a bridge between the arts and the science fields. What Hillary and I are trying to do is figure out ways to unleash a way for creatives to become super creative and augment that. It's still the early days, but we've been introducing new technologies to artists to see what they would like to create.
We kicked things off by commissioning 3 world-renowned human composers to create individual pieces with their choice of AI music generation software. We premiered the 3 resulting works at our launch in December, followed by a deep diving panel conversation with the composers. I premiered a solo violin piece by my colleague David Lang, a Pulitzer Prize-winning composer, pillar of the contemporary music community, and current artist in residence at Princeton. We worked with Michael Abels on a solo piano work. Michael wrote the soundtrack to Jordan Peele's Get Out and Us, among other popular soundtracks and concert pieces. The phenomenal pianist Dominic Cayley premiered Michael's composition for us. And we commissioned Dana Leong, a genre-bending, double Grammy-winning, multi-instrumental composer-performer, WEF, YGL, a multi-hyphenate if I've ever met one. He decided on a big-scale orchestral piece. For his premiere, he performed most of the instruments himself due to social gathering restrictions. These composers are all groundbreaking leaders in their areas of expertise. We were fortunate to work with them on this project. Because of lockdown, their schedules had changed and they had pockets of availability. Otherwise, we probably would have had to wait 3 years for their input.
It's great. The software platforms that they had chosen to generate and influence their pieces were OpenAI's MuseNet and Ava, and we were fortunate enough to be able to work with some of the scientists at those teams. So, the next question of why is this important at this moment in time? AI has been moving at unprecedented speeds, disrupting industry after industry, as shown here today at this conference. It's one of the most powerful tools that we're going to encounter. And creativity is often thought to be uniquely human because it's what we say that we excel at as a species and where AI is said to fall short. But we're really starting to see that challenged with things like GANs-generated artwork, headlines written by bots, and then this music generated by AI systems. And this AI creativity revolution that's happening also seems to be missing the voice of the current generation of artists themselves. So we wanted to really find a way to empower today's artists, to give them a seat at the table now, as these early tools are going to be developed, and help shape them before it becomes too late.
Artists now have a rare window to join the conversation with developers. The possibility of directly shaping the futures of our fields, exchanging thoughts and knowledge with diverse voices, I find that potential very motivating and very urgent.
So we've mentioned the who, what, and why. Now for the how. As Hillary mentioned, for this first phase, we commissioned the 3 pieces from the composers. And it was important to us to show a diversity, a variety of music across genres, instruments, and to give each human composer a chance to reflect their own voice in the AI program that they chose. So we wanted to test each element's collaborative limits. We wanted to make the process as transparent as possible. So you'll see in the videos and in the sheet music, it's all clearly delineated which notes were composed by the human and which ones were by the AI program, and if the notes were altered in any way. This is one example of the start of the sheet music where you'll see the AI raw output as one of the lines there. On our website, we also had the composers share artistic statements about their processing experience, which you can read at your own leisure. And then we hosted a live composers panel and have started one-on-one in-depth interviews with each composer.
There were some surprises in the process. For me, my experience premiering David Lang's piece in our launch wasn't that different from my prior premieres. I learned the music and played it. It wasn't so straightforward for the composers though. They were essentially learning a new instrument of creativity, one without an established linear tradition. I was surprised at how much work was required by human composers in order to collaborate with the raw AI output. And I was very impressed by how they worked the challenges into the concepts of the pieces, inventing new solutions to bring their ideas to life. The composers' experiences sometimes read like a nerdy telenovela, but I was glad to see that the successes and challenges could be clearly identified, not because we're looking to foster criticism, but because frank feedback is essential to progress. Art is always progressing, so is AI rapidly. Art is the ultimate expression of humanity, so it tests AI in the best ways.
Yeah, it's definitely true. What I also saw and found most interesting was really the design choices on both the composers and the AI teams. For instance, the composers had such different approaches in how they wanted to use AI clips, and most had gone in with an idea of what they wanted to do. And also I was surprised by the clips that they actually selected. The composers found some of the clips that I would consider as failure cases the most interesting. And on the AI side, there were many times that the AI software output was just simply unplayable by a single human or a single instrument. And there was actually none of the software had parameters to be able to limit that. And it turned out to be a conscious decision from the scientists who wrote the software to not consider human limitations or define the number of people required to play the piece, because they actually didn't intend their software to be performed by humans. So they really optimized for listenability, and clips would frequently fall back on popular motifs or certain keys. So that was just interesting to see those design choices on both sides. And beyond performance and composition, I think Hillary and I realized just the depth of open questions still left to be decided regarding AI's impact on many different fields beyond just the work itself. It became about the authorship and legal rights, ethics, business models all changing. And these philosophical issues are something that we're going to be delving more into and talking about the importance of. So just to highlight what is coming up next for deepmusic.ai, we've got 4 different things. The first is just to close the loop and offer the professional artist feedback back to the AI companies. We want to make sure we incorporate and affect both fields and change how the tools are being built. We're actively building an artist community to be ready to connect them with the AI teams who want to collaborate and hear from the artists directly. Hillary and I had started an open source database, kind of just tracking and documenting all the teams that exist that are making AI generated software in a variety of different creative fields, even past music generation. And it's open source, so we wanted to make sure that people understood what differentiates between the different AI software to figure out which one best suits their needs, and they could contribute to it. There's currently about 20 companies that make music generation today, 3 which have been acquired in the last 2 years, and there's about 10 research groups out there. And lastly, just a quick plug, deepmusic.ai is sponsoring and helping organize the 2nd annual AI song competition, along with members from Google, Magenta, and ByteDance, which is the parent company of TikTok. So this is open to anyone who wants to create a pop song using AI. And deadline to register your team is next week, and the winners will be announced in June. You'll have time in between to make the piece. Okay, so.
I love a big idea. And we have a lot of big ideas. Maybe it's an arts thing, but I like to think that imagining an ideal future can get us close to it. There's room for AI music to coexist with human composers and performers, whether as a selection of tools or as its own genre. And this isn't only about music, but music is an illuminating framework for us at deepmusic.ai as we begin our explorations. As all of us participate in the development of our future lived experiences, we can aim to positively and gracefully merge technology with humanity.
Great, thanks, Hillary. And just to conclude, we wanted to share Hillary's premiere performance of David Lane's Out of Body. Hillary and I were actually both involved in the artistic process behind the piece, which we can talk about during the panel. David's style is really clearly identifiable through the choices that he made in the collaboration, particularly in how he selected and guided the AI output. And the result is a composition worthy of any concert stage. So it's really a pleasure presenting to you today. Here's Out of Body by David Lane, performed by Hillary Hahn at the launch of deepmusic.ai. Enjoy. You'll note that the AI was human written and AI written is clearly delineated by the colors there. I'm sorry, did you, were you guys able to see the video?
I didn't see it myself.
I think it's out there for our audience.
Yeah,
Okay.
I think they saw
Okay,
it.
great. Sorry.
Great. So, so we can continue playing it as well. I'm not sure if we're over time, or do you want me to jump back in the video?
Yes, Carol, please continue playing.
All right. Apologies there.
Thank you for that performance, Hillary, and thank you both for that wonderful talk. Now I'd like to welcome back all our panelists for a more in-depth conversation. So if you can all turn your videos back on. Russ, why don't you lead us off with a question from the audience?
Yeah. So actually, this is my question. I guess it's the prerogative of a co-host. I'm asking for all of the artists, really, what is the duty to inform an audience that the creator was AI or AI augmented? And what is the tradition in terms of provenance? I could imagine an argument where, of course, I want to know who wrote this versus, that's not so important. Why don't you develop your response and then we'll talk about it later. So I'd love all of your thoughts on this issue of the duty to inform about the provenance of a piece of art. Michelle, I'll ask you to start because you're my friend.
Well, no, that's a really big issue, actually. The last time I presented on Arts and AI, that was the first question that people asked is not about the duty to inform, but the anxiety about it, that you could be duped, that you could be betrayed by not. And then that was indexed to how are you going to evaluate something? So it was actually more of an emotional as well as an economic response as well. And I'm not even sure where the duty lies, especially because once something's out there in the wild, it's actually hard. It's untethered and sometimes from the artist itself, themselves. So I think that's a really challenging question. I'm not an artist myself, so I'm really curious about the amazing artists that are gathered here, how they understand this question. I think Carol raised one of the important things also about future of work too, which is behind the question is how are you going to recompense artists? If it's a hybrid augmented piece, if it's if that work gets distributed without their permission or it's reproduced. So I think those are other kinds of questions about how do you not just value the art, but also value the artist in this new work environment too.
Carol and Hillary, how important was it that you tell people that set of compositions was AI augmented, or was that featured prominently in the public relations material, or could it have been dropped?
Oh,
cannot
absolutely.
be dropped.
Yeah, I think that was one of the most important things for us, was because so much, like credit kind of get like so much hype is built around AI. We really wanted to evaluate where's the state of the art in AI today. What can it do? What are the limitations? And we wanted to work with professional artists who could very clearly see that and also knew their artistic process, and how AI might impact them and where it might supplement them. So it was very important to us for the audience to understand what was AI written, what was not, what was altered, why was it altered. So all of that we wanted to make as clear as possible. Michelle, in regards to your question about, how do you value artists? I think right now it's completely open. And different AI software have different approaches. So we were careful to take a look at different licensing, at how each company valued artists, because it does vary across the board. Some, if you uploaded sheet music, they now owned it. Others are open source. So the two companies we worked with, the artists, it was important for us to have the composers own the copyright, and that artists like Hillary could play the piece, and it was, it was her piece to perform, and it was under a contract that they currently were used to. That was how we started. But we started to see, as we were talking with lawyers, just the different possibilities and concerns that artists have. And I will have Hillary expand on anything else.
Yeah, I mean, as a performer, I've also done some composition and recording, so I'm familiar with the world of IP, and it's really important to be transparent. The composers were also concerned about how their artistic expression would be perceived if it was altered by AI, and also they wanted to be responsible towards their colleagues, and set good precedents, and have the right kinds of conversations, and they were very, very thoughtful about it. And of course, we deferred to their needs and their comfort level. And if you see in the video, there's like human and AI. David really clearly, composer really clearly delineated his process, separating his notes from the AI generated notes, and alternating them, but with intent. And so part of the piece, as it refers to how he creates, is actually in the intent of how he interacted. And if you don't know any of that, if it's not available and you don't know about him or what the piece is about, you lose a lot of the artistic statement, and the piece would not exist if it were not for David. And so just as we credit David, we also credit the AI, we credit the software and the platforms used. But one other interesting thing we found is that the word collaboration was problematic for composers, because it wasn't an equal collaboration. It was working with, and also the AI offered something really valuable, but it couldn't speak up for its needs. And so it's kind of interesting to navigate the wording around this kind of project.
I have one from the audience. Ken, your experiment with telerobotic gardening, the telegarden, was really fascinating. In your opinion, was this more an experiment in telerobotics, or more of an experiment in art, or maybe it's both? What did the philosophers who worked with you on the resulting book have to say about the matter? And what is more generally the role of philosophy in art and AI? And then I would add, similarly, can you say something about the Alpha Garden? Did the AI for the Alpha Garden have a goal? Was it beauty? Was it total growth? What would you tell it to do before it did its death spiral there during COVID?
Great. Okay, thank you. First, I would like to acknowledge the really excellent commentaries here today. I have to say, I've been doing a lot of thinking about Michelle's comment about the AI challenging the fetishizing of the individual genius. This idea is actually, I think, very, very interesting, and it's certainly, I hope we'll get a chance to talk a little bit about NFTs in this context. I was also really quite struck by Rashid's point about the origins of the word robot, and he's quite correct. And I think that this idea about reconstructing being
from the element of robotics and rethinking what that means in the context of this, as you put it, the so eloquently, the supremacist white capitalist ideology. And so there's so much to unpack here. I wish we had 3 or 4 days to go into this. And so to the question that you just asked about, the audience member just asked about the garden, it was both. I mean, it was I would say an engineering proof of concept to build an interface, but in many ways, really more of an artwork. I mean, really being open-ended in the sense that the panelists are talking about. In other words, that I wasn't sure where it was going, and I think the best works often are that way. You start out with one intention, and somehow the work leads you to another one. In that case, it became more philosophical about what is the nature of reality. And Hubert Dreyfus, for example, was very reflective on this point. He was the one who pushed it to think of it in terms of epistemology and what direction that we would, how we could think about this more broadly than just the garden, but actually about the internet itself, that it was raising these deeper questions as we lived more of our experience online, that it would make us more uncertain about the status of reality. And that somewhat has come true. To your last question, James, about the Alpha Garden, it is definitely an artwork in the sense that, again, I'm not sure where it's going. And to your point about the reward function, we do actually have a numerical reward function. We want to optimize a measure of diversity that's related to entropy in the garden. So because it's polyculture, it's all about these plants in close proximity, which is very complex and not well modeled by existing agricultural models. So that's why to us, it's an interesting scientific question as well.
Rashad, you mentioned feelings about anxiety, depression, rage in response to the injustices affecting your community. And if I understand it, being 1.5 was partially motivated to create a response to that. Did you get any feedback about how it worked? What were the reactions that you elicited with it?
Yeah, and so I have not launched it yet. Right now, I'm working on it as part of my residency. And so I'm really focused on consulting with therapists who specifically focus on EMDR therapy and sort of figuring out how we can write a script for being to perform that task, but also revisiting the avatar and remodeling the face, particularly so that it can appear to be doing really deep listening, and also adding to the movement library so it can do things like move in and really make the user feel seen and heard. And so, the stakes are pretty high with a piece like that because I don't want to further traumatize the community that I'm serving. And so I'm doing a lot of research over the course of this residency before we release it for trials.
I really appreciate that because as I was hearing your description of it, it was very clear that this could be a very powerful intervention. And then with power comes responsibility. So a very interesting set of issues, I'm sure.
Mm-hmm. So I was going to ask Michelle, as an educator, you mentioned changes in pedagogy necessary for this more human-centered development of AI. With respect to the arts, what kind of computer science, or conversely art, what kind of curricular changes might you propose that can help us work creatively, at this critical intersection of AI and art?
Yeah, thank you. That's actually, Rashad's inspired me a little bit, actually, because we've been talking a lot about alternative pedagogies within educational institutions to knit together STEM fields and arts, and not just art historians, but also arts practitioners. So what would that look like in a classroom where you usually have a kind of sage on a stage, still traditionally often, and the sort of banking model of education. But what happens if you are trying to move, academic institutions are such medieval structures that as soon as a student gets tracked into a particular major, it's very, even if it's supposed to be interdisciplinary, and I'm sure all of us can remember all of this, it can be very hard to reach across those domains, especially if you're an undergraduate. And then within the classroom, so this, Rashad and I have been talking a little bit about it, and I'm also working with Camille Utterback, who's in art and art history. What would it look like to have not lectures, not case studies, but studio engagements with project and design as well? And so you actually, you've got arts makers in the same spaces with people from CS and engineering, students, that is, trying to think actually about assignments, and then actually have that realized in a classroom. I realized once we went down the road that it really upended the traditional ways of teaching. And I know at Stanford, we have the Rob Reich and others have a new embedded curriculum. And I think that's also been incredibly helpful, so that classes like this, I bring race studies and humanities into the mix too, but often classes like that are set aside over in African-American studies or race studies or whatever. And the same thing with arts as well. So having, for instance, an embedded ethics class where it's not, it's sort of built in to the education, not just people hoping are self-selected who happen to be interested in these issues. And I think that's one of the ways it has to be really integrated into an institution. And I just want to shout out to Carol and Hillary, because I saw your larger piece then too. Your thoughtfulness about the process and making it explicit and extant and awareness, I think is fantastic. And I like the meta dimension of it, and I like that it was sharing to it. And I feel like that is a nice model and exemplar for people who are trying to do this work going forward. And to speak to James's question, thinking about that then when I get into the classroom and they have models of people who are ethically, virtuously, as they say, engaged in systems that are going to support both artists as well as technologists is wonderful. So, well, thank you for your work too.
I would like to add something to that too. Yeah, I think we have to also think about equitable ways in which we bring outsiders into that conversation, because what I am finding as a practitioner myself is that, we are sort of on the margins engaging in this like deep research and work, often unfunded. And then we're sort of brought into, these big institutions with, this panel is a poignant illustration of, how much that space is a white, cis, hetero space, a male space, right? And so you have these folks doing this research that these folks have often willfully ignored. And then you sort of like, well, come in and like help us make better work, but they're getting paid, exceptionally, where these other people are being brought in and their sort of ideas are being extracted. And then they're sort of like, okay, now you can go back to the margins. And so I think that what that's doing is continuing this extractive, relationship to Black cultural production, Black thought. And so I just think we need to kind of reimagine a way to do that that gives both parties optimal well-being.
Rashad, you've talked also about the whether or not to make your work open access in that larger context of theft of Black cultural production. I think that's really important.
Yeah.
There's actually an audience question exactly on this issue. So I just want to recognize it and continue this part of the discussion because I think it's incredibly important. Hillary mentioned, the audience member says, Hillary mentioned the surprising load of human involvement, and art can be already cost prohibitive. And AI, of course, can be very compute intensive and costly. How do we make sure that the cost barriers to integrating an art and AI don't make it an elite, a privileged activity, and that it's accessible and kind of just in the greater sense of just? And I think Rashad's comments just were directly on that. One concern could be that even the people who get interested in art and who enter it become not a representative group. So I'd be interested in from each of your perspectives on that risk.
Yeah, I think also I feel like also there's this conversation where like people talk about AI as though it's art. And for me, AI is the product of computer an interdisciplinary practice of computer engineering, computer science, research. And so that's sort of the product of it. And that can take many different forms. And sometimes that's art and sometimes that's not. But I think for artists that do want to work in that medium, it is quite expensive because it involves so many resources. And I think one way if we're talking about supporting folks who want to do that, is to really look at folks who are not typically seen in those spaces and make those resources, make those funds available to them. And I think this is a great start. I'm really excited to be here and particularly to be with Michelle and be working so closely with someone who really is so aligned with my thought process. But yeah, I think just more of this is what is a nice start. Yeah.
Mm-hmm. Follow up to that, Rashad. Oh, go ahead, Carol. Let's hear it.
Oh, sure. I just wanted to jump in to just add a few things. I think it's a very, very valid point, and I love the question from the audience. We did realize that there was a huge time commitment from the composer, and just the amount of the steep learning curve across all fronts. Even me as a computer science major, it was very challenging to figure out both the music world and the music software that could help me like crop a MIDI file, and then having to learn the AI side too. It was a steep learning curve, and I think that was one of the surprises that we did learn about. And what we would love to do moving forward to facilitate that, Hillary and I have been talking about, like, there's just this need for just even tutorials and putting it on a platform like YouTube where it's accessible to everyone. So you could just be at your home in your bedroom making music. And I do think that that's what we want to encourage, is just people who are passive consumers of content can jump in and become creators and play with these tools. So that's why we really wanted to highlight this database where you didn't have like a cost barrier to download software, where you can highlight the open source ones, and we could have tutorials to kind of walk people through it from start to finish, so they can generate a whole piece without getting lost with the steep learning curve and not having a community to ask questions.
Hillary, you wanted to follow up there?
Yeah, I wanted to just point out that I'm like that's something that Carol and I have discussed a lot, and I think it does bring access to the technology to people who haven't had all of the hours of training and the help from an AI scientist to navigate the technology. The technology itself is privileged, and so there's also a question there of access to technology, access to like methods of artistic expression. And so it's a very, very deep question and a very, very deep equitable question in society. I wanted to just point out something a little bit like off, I guess a little divergent, but I just want to point out that I am of the opinion as an artist looking at AI being created that people who are coding are artists. Like, coding is artistic, in my opinion. And I think people creating AI are artists. And so we're like separating art and AI in a sense with our words here, but there are many more overlaps than differences between people who are creating and like creating the tools, creating the structures, and the people who are using the tools and the structures to create things. And I would love to hear people's thoughts on that. It's just an impression I have, but I'm just constantly impressed by people who create these really complicated things.
Can I also add, I think to Rashad, I'm really glad you brought that up. I think you're absolutely right to challenge us and to challenge the status quo across the board. And I think that you're provoking the very question, which is that this can't just be some form of window dressing. I think what you're getting at is that AI's potential is to be very disruptive. And I think that's art's potential, actually, is that that's what I see them as having in common. That art does the best art force you to to re-examine assumptions. And that is a very imperative today. I think that the term you use, narcissistic, perspective is so right on the mark. And I really something that I'm thinking a lot about, and I've been thinking about it in terms of our process at Berkeley, in terms of hiring and admissions. We've been really thinking it through, and making efforts. Again, there's a huge amount to do. And I also want to mention that I'm working on an exhibit for the Catherine Clark Gallery from summer of 2022. And I'd like to follow up with you, Rashad, because I think that your work is exemplary. And I'd also like to know about new artists, young artists that you know of, that could bring together and really showcase. Because I think that's exactly essential at this stage, is to bring in more voices and really change the status quo.
Mm-hmm. Yeah, I would love to help with that. And yeah, with Hillary, to answer your question, yeah, I guess I feel a bit different from you in that I don't think that AI is just inherently art. I think that, the same way that, like you can use the medium of painting and make a sign that has no artistic value whatsoever, or you can make, so I think that, sort of AI is the result of, a interdisciplinary practice, but what that result is within that sort of container of AI can be a lot of different things. It can be a tool, it can be art, it can be a lot of different things. And so I think the practitioner has to sort of decide that. And then also, they have to put that out in the world and defend it as such. So yeah, I think it's a little more, it's a little, and I think there's people who go into that practice with no intention of making art at all. And so to say that they're making art is sort of, a little presumptuous maybe. Yeah.
I wanted to ask a question kind of about these collaborations between artists and AI and where the creativity is coming from. So for example, Rashad, you mentioned so interesting films about AI and robotics, Terminator, Deus Ex Machina, Blade Runner, et cetera. Many of these films were ahead of the advances of AI that they portrayed. The real classic example being 2001: A Space Odyssey, 20 or 30 years in advance, being way too far ahead on its predictions of AI, but way behind on its predictions for, let's say, computer graphics. So I think to some extent, it just, growing up in that culture as a computer scientist, that these films continually inspire the young scientists and engineers that are working in these areas to be more creative. I'm curious, are there examples of films or other art forms where you really feel like they got into a consultation with AI technologists to help push the artist's creativity well past, our current technical capacity and think about this future? And maybe how have you done this in some of your work? We obviously see one pairing here today with Hillary and Carol working together across that. I'm kind of curious of other experiences.
I don't know if it's directed to Rashad, but I just wanted to say something really quickly because I'm, in this art and AI class, I'm teaching some films. I was looking at Steven Spielberg's Just AI, which was the measure of AI machine is if it can love and be loved. And I think it's interesting when you go back to when you're talking about 2001 Odyssey. When I looked at it again, I was kind of horrified because one of the things, I don't feel like it was ahead of its time. It figures that the first time that, someone has a tool, they slaughter somebody else, and there's certain embedded notions about human advancement and achievement that get carried forward. Because as you said, and Kevin Scott and others have pointed out that there are these certain moments that then inform technologists and artists sort of going forward. But I think the thing I really liked about so many artists' work, including Rashad's, but also Amelia Winger-Bearskin, who I was mentioning, is she's offering other models and other cosmologies and not just assuming the usual Western scripts. Often they're biblical plots or some notion of evolution that has never been challenged, but keeps animating some of the product design and priorities that show up as well. So I think it's really important to question some of those earlier cultural works that continue to kind of, they have assumptions about not just humans, but more specifically, people of color, gendered folks. And I think that and the gendering that goes on in them. And I think that's worth challenging too, because they're so deep and unconscious that I don't think people even pay attention to them necessarily. And I think the artists, especially if they're coming from different backgrounds and worldviews, actually can put some pressure on that.
Thanks, Michelle. I think that's a great comment to kind of end our time. We're at the end here. So thank you all for your insights into this developing space. We're going to take a quick break and then return for the day's final session focused on education. So we'll see everyone back here in 15 minutes at 1 p.m. Thank you, all of our panelists.
Thank you. Fantastic. 1 p.m. Pacific, make the adjustment locally. Thank you. Thank you so much. Hope you all had a great 15-minute break. In today's final session, we're going to examine AI's potential in education. How can AI address the shortage of teachers in the world or motivate students and increase their performance? Today's speakers will address some of this potential. To start the conversation, please allow me to introduce Dan Schwartz, the Dean of Stanford's Graduate School of Education and Faculty Director for Stanford's Transforming Learning Accelerator. Dan's research focuses on the intersection of cognitive science, computer science, and education, and how technology can facilitate learning. Dan, you can put on your slides and take it away.
Thank you, Ross. Thank you, everybody, for being here. It's my pleasure to kick us off. So the title here is a little spicier than what the talk's going to be. My point is really pretty simple, that new technologies often start by imitating old technologies. So early movies look like stage plays. MOOCs put classroom-style lectures online at scale. And right now, a lot of AI in education is naturally automating what currently exists. And what currently exists is largely based on intuition and historical accident. And so I'm concerned that AI may make us more efficient at what's basically not very effective instruction. Instead, I'd like to propose a human-centered approach that you start with the nature of learners. So the last 30 years has seen strong science on many forms of learning, and AI can augment better ways of teaching. And I think it can be a Trojan horse, a major force for changing how we go about teaching children, adults, and so forth. But to do that, it really needs to consult the science of learning. So I'm taking a slightly different approach today. I'm not actually going to talk about AI. I'm going to talk about learning, but hopefully it can give you a sense of the need for new possibilities. and what some of those possibilities are. So what I'm going to talk about is contrasting cases. So this is something that you'll probably understand. If you want someone to be able to notice what makes a certain wine taste the unique, special, that you taste it in the company of other wines. And so this is the basic idea of contrasting cases. And these are important because it's hard to tell what a thing is just by itself. So let me give a quick example. I'm going to show a picture on the right, and you're going to tell me what the thing on the left is. Well, you're not going to tell me. You're going to think it really loud, so maybe I can hear it. Okay. So given this, you probably say it's a circle. So let me give a different one. Now you might say it's a biggish circle. Now you'll notice it's an empty circle. And then I do it again, and you'll sort of notice, oh, it's got a black line. And so these contrasts are helping you notice what are the key features that you're supposed to pay attention to. I'll give you one more. It's on the left side of the screen. So this can go on forever, that any single instance has many, many different things, and contrasts help you figure them out. Turns out this is a very important aspect of how we learn, and it's something that's missing in almost all instruction. So take the case of learning polygons. It's probably been a while that since you've seen polygons, but here's what we would normally do. We would give students examples of polygons, right? And these are all positive examples. Here, I can give positive examples, which are still on the left, and then I can give examples of things that are not polygons. And we usually don't do that when we teach. We don't give negative examples. We tend to only give positive examples because we want people to be able to follow them. But if you haven't seen the negative ones, it's hard to know what's important about the positive ones. So we did a quick study on this where we asked people what are the properties of polygon. And in case you've forgotten, like all of us, the three key properties are it's a closed figure, it has straight lines, and the lines do not cross. And so what we did is we just asked the participants to list key properties of polygons before and after looking at the sheets. They either got to see the sheet with the positive examples or the sheet with positive and negative examples. So at pre-test, before they looked at the sheets, our poor participants didn't really remember or know much about polygons. After they looked at the sheets, they did better. And what you need to notice is the ones who saw examples that were not polygons did twice as well as the people who saw the examples with polygons. So this is the power of contrasting cases, right? And it's simple, it's intuitive, it's not intuitive because it's not an instruction, but it is intuitive because you knew it in the case of wine. So I want to give you a more sustained example of what curriculum could look like if we followed the science of learning. And the example actually comes from a course I taught. It was a psychology course. And what I discovered was the students were doing very well on the tests I was giving. You know, they're all getting A's. So I'm feeling pretty good, you know, because my lectures must be special if they're all getting A's on my tests. But I had this realization that the goal was actually should be for them to analyze and predict human behavior, right? That's what psychology is. So I changed the instruction to align with this learning goal. And what I did is I had students analyze simplified data sets from classic studies. So these data sets are contrasting cases. And they had to graph the interesting patterns in the data. So I'm going to walk you through this in a little bit of detail, just so you get a sense of how it really works. And I'm going to mention two groups of people. Students are the people in my class that I did the study on. Participants are the faux data that the students analyzed. So they would get data from, my students would get data from participants, and then they would look at it and see what patterns they could find. And so here's an example of one of the worksheets. It says, graph the important patterns you see in the data. And then it would give some background information. The data come from an experiment in which research participants tried to remember a list of words. Participants listened to 1 word per second. They did not see the list, they only listened to it. Afterwards, the participants wrote down as many words as they could remember. Here are the list of words that the participants heard in the order. And then below, this is the data that my students received about the participants' memory. So your task over the next 15 to 20 seconds is to see what patterns you notice in the participant data. So it's kind of fun to look for patterns. We're good at it. Here, the one key thing is people remembered the last word in the list first at a very high rate. And then this one's a harder one to find, that they tended to remember the first word at a very high rate as well. So students would do this, they would graph it, and they would get a series of these. So they would get the next experiment, looked identical with this change that in this study, the participants counted down from 99 by sevens. So they would hear all the words and then they would go 99, 92, 85, and so forth. The students in class would see the data now when you change the experiment and they would, right? And here's what people remember when you've made this small change. So you can look at this and see what you notice. So to cut it short, now they're remembering the first words of the list at the front, and they're not remembering the word bag anymore. So this makes a nice contrast. Before they didn't count down, and in this study they did count down. We have a contrasting case that helps students notice the important differences. After the students would do these activities, I would give a lecture that described the experiments, the relevant patterns, and the theories that explain them, right? So for example, I would say primacy. This is when people remember the first things they hear and they tend to remember them first. And recency, people remember the last things they hear first, but they forget if they're asked to try and remember after there's been a delay. And then I'd give an explanation. These are explained by the finite capacity of the working memory buffer and the odds a memory will be transferred to long-term memory and so forth. So I'm not trying to explain this all to you. I'm just trying to give you a sense for how it went. So I decided to conduct some studies, and there was an analyzed treatment. College students analyzed the data for homework, the way I described, and they made graphs of the important patterns. The summarized treatment was more typical of what we have students do. They read a chapter that summarized the results and the experiments and explained the theories. And they did this for homework, and their job was to write a 2-page summary of the chapter. So this is a very typical model of instruction. I give you a reading, I have you write a summary. They both took about the same amount of time. It's about an hour, right? Whether I had them analyze the data and look for patterns or had them read the chapter and summarize it. So I made 3 conditions in this experiment. In one, there were the students who summarized the chapter and wrote it, and then they heard a lecture. In the other, there were students who analyzed the data, and then they heard the same lecture because they were sitting in exactly the same class when I gave the lecture. And then finally, there were students who analyzed the data, and then they analyzed it again. So I said, please look for more patterns, see if you can find other ones. So all told, there were 3 conditions: summarize plus lecture, analyze plus lecture, and analyze plus analyze. So we continue. These studies are complicated. A couple days later, they got a memory test. It was a very standard kind of measure. I said, people tend to remember the first thing they hear better than other things. True, false. When people do not understand, they tend to remember verbatim. True or false? I haven't talked to you about verbatim versus just recall. But that was part of their exercise, right? So they got a bunch of these questions. And so here are how they did on that. So you can see the summarize plus lecture and the analyze plus lecture did pretty well. The analyze plus analyze group didn't do very well at all. right? Because because it's a true false test, 50% would be what you would get if you were just guessing, right? So it looks from this like the lecture is the key thing. So a week later, the students took a second test. They had to predict the outcomes of a novel experiment. Right. So I just presented them with an experiment they had never seen before. And this was their prediction test. Their job was to understand what the experiment was and then predict the results. So they would see participants read the following passage. And here's an example of the passage. I'll let you read this for a few moments. And in one condition, the participants saw a title called washing clothes. So imagine it says washing clothes. And now I want you to take a few moments to reread the passage and it'll make a lot more sense. All right, so now you understand why red problems are the worst. The other half of the participants just saw the title passage 3. 5 minutes later, the participants wrote down what they read. So remember, you're a student in my class, you're hearing this description. Your job is to predict what the participants remembered in each condition. And so the question is, how well did the students do at that? They could make a total of 8 correct predictions based on what they had been taught. So participants will remember the first sentence better than others. Passage 3 condition will remember verbatim, while washing clothes condition will remember gist. And these are examples of things that participants said that were correct predictions. So your job is to predict how the students did. What is the percent of correct predictions by treatment? So what percentage of the 8 on average did the summarize and lecture students make? Predictions did they make? So I want you to think about this for a little bit. Maybe 60, 60, 40, 20, 20, 20. So let me show you the results because they're kind of surprising. And most people make the wrong predictions. So it turns out by the very standard model of having students write a summary and then hear a lecture, they really didn't learn how to use their knowledge. They looked good by a verbal memory test, but when they had to try and use it, they were very poor. The analyze plus lecture did really well, right? This is a hard task. Nobody's going to get 100%. And analyze didn't look very good. So let me explain these quickly. Summarize lecture condition, what happened? Well, the students knew by the verbal recognition test where they had to say true, false, because the test matches the form of the lecture, which is true for most of our tests. They look very much like what we just told people. And that's fine, except that's not a form that you can use your knowledge to predict, right? Verbal statements don't solve the problem. And this is the problem of inert knowledge. Students knew the propositions and the facts, but they didn't use it. And this is the classic transfer problem. And one way to think of this is they have unconditionalized knowledge, right? They never learn to recognize the instances that should trigger their memory for what is relevant to that instance. A great example of this is a study of a clinical psychologist. They had just finished their degrees and they could tell everybody about all the theories, but they couldn't diagnose any patients because they'd never learned to see the cues that help them see the patients, to see the symptoms that tell you which theory is applicable. So you have to learn to see the cues in the environment. This is very hard. How can you come to see what you cannot see? You don't know where to look for it. You don't even know if you see it. This is where contrasting cases are very helpful. And that's exactly what the summary condition did not get. Next, we can look at the analyze condition. They were bad at the memory test. They never converted what they observed into general verbal propositions. So they never came up with sentences in their head like people tend to remember the first things they hear better than other things. And they were bad at making predictions, which makes a lot of sense because they'd only seen these phenomena in the context of word lists. So how could they know that they also apply to passages? That's why you need theory. Finally, the analyze plus lecture condition. They did well on the memory test. There was no magic here. It was a good lecture, and they were eager to learn the answers in the lecture since they had just engaged in the problem. They also did well on the prediction task. And the reason is the analysis led to the precise knowledge of the key phenomenon, and the lecturers generalized the precision with the why. So let me give an analogy. So the analysis task used experiments and data. So the experiments are contrasting cases by design. One study without a delay, one with a delay. Contrast produced differentiated knowledge, and that's the key to being able to apply it. So here's the analogy. Imagine I give you this pair of scissors and I ask you to describe it. What's important about it? Right, and you'll say things like, well, it's got finger holes and it's got a cutting blade. But let's say I put it in the context of a set of contrasts and I ask you to notice what's important about it, right? And you might notice it looks quite different than B, for example. And you look at all these different features like A is very good for cutting cloth because the flat end allows you to put it on the table. So once you've had a chance to see these features, the explanations are going to indicate why they're important. So for D, the thick blades, the big finger holes, and a fulcrum near the tip are all important to apply a strong force to toenails. So these are for toenail cutters. Once you've done this differentiated knowledge and you get an explanation, it really puts you in position to handle new situations. So if I showed you this new pair of scissors, you're much better able to think about what it must be used for, right? It has big handles, so you have to apply a lot of force. But I wonder why it has a sharp tip. And so this is what the analyze plus lecture condition did for the students. So it turns out summarize plus lecture, our standard method of instruction that we've inherited over the last hundreds of years, isn't very good for the kinds of outcomes we want. Namely, students can use their knowledge in new situations. So you may be looking at this and thinking, you missed a condition, Dan. And so that condition might be, well, what if you gave them the lecture first and then gave them the contrasting cases? Would that work? Because I really like having students learn lectures first, right? I want them to know before I tell them. So let me give an example that answers that question. So this on the left, you have a very highly designed set of contrasting cases. And let me give you the cover story. There are 3 companies that ship clowns to events, and they always pack their clowns by the same amount. And so people need to know the crowdedness index for a company because crowded clowns are grumpy clowns. And the key here is this is a cover for density, and the contrasting cases are very important because a lot of 8th graders will say happy clowns is a 2 because they'll just focus on people, the number of clowns, but then they'll look down here and they'll say, oh, wait a minute, this is also 2, but they're different. And these contrasts get them into the game. Ultimately, what you want them to understand is it's a ratio. It's the number of clowns per compartment, and each little square in the bus is a compartment. So the bottom is 2 clowns per compartment. Bargain basement is 3 clowns per compartment. Happy clowns is 1 clown per compartment. Okay, so this contrasting cases sheet to help students discover density and ratio. The ratio is very important.
1 minute.
So we ran a study with 2 conditions, a tell and practice condition, which looked like almost all instruction in math and science. We told them about density, we told them about ratios, we had them do some problems, and then we gave them this sheet and said, please come up with the index. The other condition, we didn't tell them anything. We just gave them the sheet and said, come up with a crowdedness index. So in one case, we told them first, and then they got the contrasting cases. In the other case, we gave them the contrasting cases and said, see what you can figure out. 24 hours later, we asked them to redraw the sheet. If you look at this top one, this is a redrawing. This student never saw the ratio that's fundamental to density. So they've got 7 clowns in 2 compartments and 1 clown in 2 compartments, right? So this student never saw ratio or density. Interestingly, this student did correctly compute the density because they had been told first. Here's a student whose redrawing reveals the structure of density, right? It's 3 clowns per compartment. So we looked at these redrawing measures. And what you see, the percent of students who redrew the proportionate ratios in the invent condition was over 50%. So that's good because they had to get all 3 right. In the tell and practice, it was about 10%. So even though we had told them everything they need to know and we gave them the sheet, they never saw it. The reason is because when you tell them, they think they know everything they need to know and they stop noticing the contrasts and the important features. This turns out to have significant implications for their abilities to learn. So what I'm showing you here is they later on had a problem around the spring constant, which is also a ratio. And I split the data into students who performed low versus high on their science achievement tests. And what you can see is if you're in the tell and practice condition, right, and that learned about the clowns by being told, your chances of solving the transfer problem around the trampoline are close to 0. If you're in the invent condition, right, you do much better. The important thing to notice here that I really want to draw and bring back to the question of AI, the low students in the invent condition did as well as the high students in the tell and practice. This is really important because what we're currently doing in AI and education is if a student doesn't get it, we tell them exactly the same thing, only slower and louder. Instead of trying to say, wait, maybe there's a better way to teach them so they'll learn it better. So now that we know about the power of contrasting cases, where can AI help? Well, right now there's a group at Stanford that's trying to automatically generate very effective contrasting cases. In this example, it's around character recognition for people who don't know how to read, but there are also examples of trying to figure out good contrasts for learning equations and other complex constructs. So in summary, a lot of the approaches that we have to instruction right now look good by the kinds of tests we give. The science of learning indicates that many of our current approaches to instruction are suboptimal for the outcomes we care about. For example, summarizing a chapter and then hearing a lecture, or being told the formula and then practicing. They both didn't work as well. The science of learning offers alternative approaches. And so I think AI in education should look to the science and not just our prior habits that we've inherited for how to teach. Now, I know everybody says, well, I did okay in that school system. You don't know how much better you could have done had you been taught correctly. So I think there's a lot of fresh possibilities for AI in education if you start human-centered with the nature of learning. So I hate to do this, but I wrote a book with my colleagues that lists 26 different things that we know from the science of learning. And it was written specifically for people who are going to create new technologies for learning so that they can get some fresh ideas instead of trying to continue and just make the past more efficient at achieving something we don't want. So thank you very much. I will end there. And it was my pleasure.
Thank you very much, Dan. Just to remind everyone, we have the Slido facility for asking questions. We will group them all and ask them at the end in the panel. So for now, we're going to move to our 1-minute lightning talks from Stanford students who are working in this area of educational technologies and AI.
In our research, we introduced StoryCoder, an app leveraging natural language processing to introduce computing concepts to children through storytelling games. Traditional computing education presents literacy challenges for our youngest learners. By leveraging the power of artificial intelligence, we've created a socially interactive voice agent that introduces children to 4 key computing concepts through storytelling games. StoryCoder consists of 6 voice-based user flows. By way of example, in the loops flow, we introduce the idea that a loop is something that happens over and over again. In this game, children can choose a music clip to play over and over in the background during each part of their story. Through an evaluation of our system with 22 children, we've demonstrated that we can use AI to integrate a conversational voice interface with creative activities to effectively introduce computing concepts to children in a manner that is accessible, approachable, and engaging.
Inspired by the figure drawing practice of creating multiple poses in rapid succession, Quick Pose is a version control system for artistic programming which enables artists to work across multiple concurrent ideas in a single artistic work. Built for the language processing, Quick Pose visualizes a project version history as a directed graph, allowing users to navigate across versions and create new branches with a single click. In contrast to existing version control solutions, Quick Pose foregrounds version control as an active part of the creative process, allowing artists to manage many branches and diverging ideas within a single project. To create a branch, users can double-click on any node to create a copy, or alternatively, as soon as users attempt to edit a previous branch, a copy will be created, automatically maintaining a linear edit history and making copies when appropriate. We hope Quick Pose will inspire version control tools for artistic programming, which recognize and center the divergent, exploratory, and unpredictable nature of the artistic process.
In our research, we introduced the Smart Primer, a smart tutor embedded in narratives with chatbot guidance. Traditional computer-based tutors consist of learning activities with limited interactivity, which tend to be unengaging. Leveraging advances in reinforcement learning and natural language processing, and drawing inspiration from Neil Stephens's novel, The Diamond Age, we built the Smart Primer learning system. It leverages compelling and personalized narratives, real-world activities, and adaptive feedback through a tutoring chatbot. We ran a study with 72 grade 3 to 5 children that showed that narrative-based learning with a wizard-of-Oz chatbot promoted student learning and engagement. Given these positive results, we replaced a voice chatbot with an automated reinforcement learning-based chatbot and tested it with 339 children. The IR chatbot promoted stronger engagement and learning than the control, especially for children with little prior knowledge. Today, students need novel, engaging, and effective methods to cultivate their passion for learning. Our research demonstrates the great educational potential of conversational AI tutoring systems.
I'd like to thank these and all of our students today for sharing this little taste of their work. And as I mentioned earlier, there are some resources and links on the conference webpage if you want to learn more. And I'm sure the students would love to get your questions and feedback. Very exciting. Next up, I'd like to welcome Chris Peach. Chris is an assistant professor of computer science and by courtesy of education here at Stanford. He uses machine learning to understand human learning, and he recently received an HAI grant called the Hoffman-Yee Grant for his research into AI tutors. Chris, if you'd like to share your screen and take it away.
Okay, what a pleasure to be here. Thanks so much, Russ, for introducing me. As mentioned, my name's Chris. I'm here to talk about how can we have AI superpower our wonderful teachers. This is work that's done by a whole bunch of people, and I'm just going to be celebrating it with you here today. So as mentioned, my name is Chris, and just a couple quick things about me. I do a whole bunch of research in computational education. That's my main focus of my job, but I also love teaching. At Stanford, I teach intro computer science, and I also teach probability for computer scientists. And you can imagine these are the sorts of things that a ton of people in the world would love to learn how to do. So I spend a lot of time thinking, how could I get the wonderful education that I can provide here at Stanford into the hands of as many people as possible? And today I invite you guys to think about the same problem with me. My question for you is, what can you do to scale up access to high quality education? It's one of the sticky, huge social problems that we face collectively. And what can we do to improve upon this great challenge? So quickly, what we're going to do today, I'd like to give you a bit of a vision for what cool AI could look like in the future. I want to talk about what AI can do to help teachers while grading, and then maybe how can AI help teachers become better versions of themselves. And at the very end, I'm going to give you guys a way to get involved. So gather around wherever you are in the world, and let's tell you a little bit of a story. This story starts about 1 year ago today. So a year ago today, as you guys know, a lot of the world started locking down because of COVID-19. And when this happened, I was about to teach Stanford's Intro Computer Science class. And I thought to myself, with my co-teacher, Mehran Sahami, what can we do to make, to give to the world at this time when there's a lot of people who are hurting? So we thought about this, and we thought, well, we teach this class, what can we do to give the wonderful education that we think we can give our students to more and more people? So we wondered, what could we do? And of course, people have mentioned MOOCs before, so we thought, maybe we can just put our class online, right? If we want to scale high quality education, can't you just take a Stanford class and put it online? Or we've built some cool AI stuff. Can we just make an AI tutor? And both of these things felt wrong. It felt like we really hadn't tapped into what made Stanford education so beautiful and wonderful. And actually, I'd like to tell you in my little story today, what is the secret sauce to Stanford's introduction to computer science, or intro to coding? You might already know this, but the secret sauce to Stanford's intro to computer science is we build a huge amount of community by inviting a huge amount of our learners to come back and play the role of teachers. In fact, if you took the intro to CS class with me at Stanford, you would have one teacher for every 10 students, and all those teachers are recent graduates of the class. At Stanford, we've tapped into this incredible insight in learning. And the incredible insight in learning that I would like to share with you today is that the magnitude of the number of people in the world who would like to teach is roughly proportional to the magnitude of people who want to learn. Think about it yourself. When was the last time you learned something really exciting? Didn't you have this desire, like, could I pass on this knowledge to others? And it makes sense. When you teach, it's joyful. When you teach, you learn, you become you get to engage with sharing knowledge with other people in the world. So if teaching is such a fun thing that can make us so much better at our discipline, and a lot of people want to do it, what would it take to bring together the huge number of people who would like to be sharing knowledge and the huge number of people who would like to be learning? So in the time of coronavirus last year, we decided, let's try it. Let's do a massive experiment in education. Let's get thousands of people around the world to teach and get tens of thousands of people around the world to learn and put them all together in small groups. And it was a wonderful community service project. It worked so well. We had all these students who were learning and staying in the class and acquiring the ability to program, and these teachers were having a fantastic time as well. My thesis for you then is we don't need AI to replace teachers. What we really need is we need AI to make humans who want to teach more capable and who expand who is able to hold that role of teachers. So we can do this, but what we need is we need AI that doesn't replace teachers, but assist teachers. And today I'm going to talk about 2 quick points there. How can we have AI do the worst part of a teacher's job, which is giving the hard feedback on students' open-ended project? Well, it's the most time consuming. And the other one is, how can we make teachers become better versions of themselves? And if we can do these 2 things really well, then we can create an ecosystem where more people can be teachers and we can have more human-centered, scaled, more equitable education. At least that's my theory. So first of all, can we do some grading? The answer is surprisingly maybe not, right? So for a while, I was trying to figure out how could I make the grading job easier? When I say grading, I actually mean feedback because you want to help people while they're learning. So a student does some work, maybe they do some math, maybe they write a short answer, maybe they do some coding, maybe they do a lot of coding. No matter what you're doing, you want a teacher to be able to say like, hey, I saw what you did. Here's it seems like you made this small mistake and here's how you can be better. Core part of education. Teachers are awesome at it. It takes them a ton of time, and AI is not. We had the best deep learning algorithms try and solve this problem, and it really quickly fell apart. Basically, I don't want to get into the details, but grading is a very hard mathematical problem, and for lots of deep reasons. One way of looking at this is we tried to grade code.org problems. Code.org were like 10-line code problems. So students would write 10 lines of code, and we would try and recreate human-level feedback on this code. We got the smartest people in the world working on the coolest deep learning algorithms. We got all the neural networks, and we couldn't do it even close to as well as humans. But we had this first insight, which is, what if we had our teachers, instead of just label stuff like they're pawns to the artificial intelligence neural network, what if we had the teachers teach the AI how to grade? And we worked in this new world of artificial intelligence, probabilistic programming languages, and we're able to come up with an algorithm that worked incredibly well. For the first time, we made some pretty good progress. We invented a whole bunch of AI along the way. It was a good time. We could say, hey, we've helped with grading. But you know what we couldn't do? We couldn't grade my midterm, and I really wanted to grade my midterm for my 106A class. Grading a midterm, giving feedback on midterm, it's hard. Student sees a problem, they write their answer, and a TA has to be able to say how the student is doing on a whole bunch of complicated categories. A little bit of suspense, because I want to show you some brand new results. Approach this with a really cool angle using, working with collaborators, Chelsea Finn and Mike Wood, and Chelsea Finn being the PI. We did this really cool project. Chelsea Finn works on meta learning. Basically, can AI become smart enough that if you give it a brand new task and do okay on those tasks, Well, I was talking to Chelsea. I was like, I've got brand new tasks all the time. So I can have AI that can look at some of my past exams and learn how to grade them. But I always have a new exam. Can we have AI that looks at those past exams and learn how to grade the new one? And the long story is short. Well, not if you just use the standard AI approaches. So we didn't use the standard AI approaches. We tried doing this really cool prototypical network. And if you don't know prototypical networks, maybe it's a cool thing to check out. It's on the current bleeding edge of artificial intelligence. We did try a whole bunch of things. We tried prototypical networks. We tried all these cool different tricks in AI. One of the secret sauces to doing good AI is to try a bunch of things. But at this point, we're getting really, really, really close to, can you grade my midterm, as well as the Stanford TAs who grade my midterm. So stay tuned, because this is one of the great challenges in supporting teachers. One of the places we're going to use this is Code in Place is coming back. It's a year since the pandemic started, and we wanted to do this big community service for the world again. So Code in Place is going to come back. We're going to have another 10,000 students, and this time we're going to be able to give feedback. Our 1,000 teachers don't have the time to give feedback. They have to focus on instruction, making great contrasting cases, but the AI is going to be doing the deep feedback work for them. The other thing I want to talk to you about, the last cool use of AI to superpower teachers in my little 10-minute talk, is how can we make teacher training better? It's a super difficult problem to become a better teacher. So I love teaching, and I'm always trying to become a better version of myself. But how can I? I teach my class, and then maybe some students said that was nice, but I don't really get deep feedback on teaching. So we're trying to build AI that can do this for you, AI that can augment the teacher training process. Whole bunch of cool things we're doing, and I'll give you a taste. One, we're making some AI-based teacher puzzles. So imagine you had an AI tutor, but instead of teaching you math, it was teaching you how to understand and teach others. Super meta. It's been a good time. And then, of course, when we do something like Code in Place, we have thousands of teachers teaching content, and we are learning how to look at their teaching and be like, we just watched you teach for 50 minutes. We can talk about how you respond to student questions. We can talk about how much you were speaking. We can talk about the language you use. We can even talk about small things like affect. And the AI can do automatically what would be impossible for me to do for my 1,000 teachers, which is give them feedback on their teaching. It's not a silver bullet, but this is a first step in a pretty cool problem. How can we have AI that can actually augment teachers becoming better versions of themselves?
1 minute.
So my question for you at the beginning of today was, what can you do to scale up access to high quality education? I just told you about 2 ways that we could help on one particular problem, which is how can we have AI to augment teachers? There's so many cool projects. There's so much to do in this wonderfully large and important space where there's new data and new problems. But there is one concrete thing you can do if you're interested. Code in Place is starting again. Come teach with us, and you can be part of this wonderful conversation. So we're inviting people from all around the world to come learn how to become teachers. If you know how to code, come learn how to become a teacher, and in the process, you'll be contributing to this big present of community service we do for the world. What a pleasure. Thank you guys so much for your time and attention. I guess I'll be here to answer some more questions after the other wonderful talks.
Thank you so much, Chris. Incredibly exciting. Let's now turn to Amy Ogan. She's a professor of learning science at Carnegie Mellon University. Amy studies, designs, and builds educational technologies and has conducted field research on the deployment of this kind of technologies across 4 continents. Welcome, Amy. You can turn on your slides and take it away.
All right.
We do see the slides.
Great. Thank you so much. What a pleasure to be here today in such wonderful company. Very excited to talk to everyone about these amazing ideas about how we are all working together to improve education for all of our learners around the world. And my talk today is going to be about pushing the boundaries of learning technologies, given that we are really in the midst of an education breakthrough globally. And maybe you've seen the statistics that look around the world at the reduction in out-of-school children. So more and more children are able to access schooling around the world, both primary education as well as secondary education. And this has been a major win to even get children into that system and enable them those educational opportunities. course, we're also in a learning crisis at the moment. Of course, you're all familiar with the fact that COVID-19 has forced billions of students to stay at home. And this has been a real serious issue for many learners around the world. But it's not the case that COVID is the only problem we have. So even before the pandemic, there were millions of school-aged children who were not able to learn basic primary level skills despite actually being in school. And this problem does not go away when we look at middle income countries or even high income countries, where 30% of students will learn only basic primary skills despite going through the entire schooling system. So there's been a lot of talk of technological determinism solutions, like just providing one-on-one computing devices and the potential that that has to increase educational opportunities. But we know that these have not sufficiently addressed the learning crisis, despite almost decades and billions of dollars being spent on just providing devices to learners. So a question is, does that mean we should give up and technology is not the solution? Well, there are some really encouraging results that show very positive outcomes from technology use, particularly when it's been enhanced with adaptive or AI-based assistance. So this is from a low and middle income country context, where this large meta-analysis of studies found that adaptive technology-assisted learning interventions had a greater impact than all kinds of other interventions, such as decreasing class size, providing school supplies, eliminating school fees, and others. So what we can learn from this is that learning technologies can actually support better educational equity with AI if we design them to. And the goal here is to meet each context where it's at. And so as Russ mentioned, I do that by investigating a wide variety of educational contexts around the world. Here you see a number of the places where I've been doing my work. And what I've seen is that there are opportunities for AI, both in the end where there may be lower infrastructure available for AI to be situated and in place, but also fantastic opportunities in that higher infrastructure area as well. And so today I'm just going to share two of these projects with you to look at what we might do in a different set of cases, and in particular emphasizing in my work thinking about equity in learning opportunities within a context, which can be done across contexts around the world. So that first technology project that I'll describe here is called Allo Alphabet, and it's a phone-based literacy intervention that we've been deploying in Côte d'Ivoire. And what we're doing here is co-designing this technology with Ivorian linguists and sociologists. We're working with the Ministry of Education. We're actually even working with a local ed tech company in order to make this a sustainable intervention that can continue after the research concludes, and also with local community leaders to understand what's actually needed and how can we support children in this context. And what you see here is the deployment of a technology in which the AI itself is actually invisible. So this is a context in which the infrastructure may be low, so not all households have running water or electricity. However, the vast majority of households do have access to a basic phone. So they may not have the internet, but they can make calls and they can send and receive texts. And so that's the basis here of our literacy intervention that uses interactive voice response in order to deliver lessons and games and other activities to the students while they're at home and while they're learning in an out-of-school context. And as you can see here from this picture, in which one of their family members is supporting the learning, as I mentioned, the AI is really invisible. So it's happening on the phone that the girl in the front left is holding. But what it's really doing is supporting this collective intermediation in which there's mutual support from a wide variety of community members. But what the AI is doing is bootstrapping that knowledge sharing. So it's interjecting actually a lot of the wonderful things that Dan was talking about in his talk. contrasting cases, all sorts of inventive play activities around literacy that are being delivered by this phone, but then spreading out into the community where other adults or other learners in the environment are able to help structure that context of learning. They're able to provide explicit support, sometimes for the literacy, but sometimes just for how to use that mobile phone or how to modeling how to listen and respond while they're using the technology. And what we've found from this is that we're seeing a significant improvement in phonemic awareness and even larger improvement in letter reading from this technology. And one of the things that we've found is that students who report that they have consistent access to a parent at home are actually making even greater improvements. And this is demonstrating for us the value of incorporating the community and the rest of the learners' peers and support sources into the product, the AI product itself. Another interesting thing that we see here is the fact that this technology ends up being used when learners are not able to access schooling. So in this graph, you can see that the use of the technology was lowest during school holidays, when parents told us that the children should have a break and they shouldn't be working on their lessons. And then went higher when the period of normal schooling began again. However, in the middle of our study, there was a teacher strike for 2 months. And what you see here is that parents were using this in the home in order to provide their students with those opportunities, even when they may not have had them at school. From here, we're moving on to something that Chris was discussing, which is teacher professional development and supporting the teacher communities with AI. And at the same time, not neglecting some of the root causes of some of these educational opportunity gaps. We're here pairing this with a cash transfer intervention that enables children who are in such extreme poverty that they cannot make it to school to actually be involved in the schooling process. All right, so that was one study. Very quickly, I'll tell you about a project in this higher infrastructure space called Class Insight. Again, tying into what Chris was mentioning, but here we call it professional informatics for teachers, because even in a higher infrastructure space, there's still a need for designing for equity across learners. And so what you see here is a system of sensors that we're able to put into the classroom to collect a lot of really fantastic data about what's going on in the classroom environment without requiring everyone to be on a computer in order to collect that data. And so you can see here the privacy preserving features. We're collecting what's going on from the teacher's point of view, but also from the student's point of view in order to support teachers in making something visible that is typically invisible to them. And that is features of the classroom, like how often they're speaking, where they're moving in the classroom, how are their gaze patterns addressing the students in the back of the class, or those who may not have had an opportunity to have their voice heard during this classroom experience. So again, focus on educational opportunity and equity by changing the behaviors of the teachers and letting them have an active part in that process. So a large part of what we're doing here in this project is also around goal setting and providing teachers with agency to look at making changes that they desire to make. A cool new direction we're going here is to look at actually letting teachers experience this classroom in VR. So they could sit in the back of the classroom and really feel what it feels like to be participating, maybe from the point of view of a student who doesn't get that much attention. And so I'll just wrap up by saying that AI has enormous potential across all spaces of infrastructure and support. But one of the things that we focus on here is making sure that the context-sensitive design incorporates the physical infrastructure of the environment. So we need an understanding of what's already in place and maybe or maybe not adding more. The human infrastructure, so making sure that We know that tech will never solve all of the problems. We're not replacing teachers, as Chris said. And so having that human in the loop and making sure we incorporate the human infrastructure is critical. And finally, knowing that equity will not be achieved organically, but it must be worked for. So things like 0 rating of educational interventions is a policy level decision that can actually help that AI reach the right set of people. And of course, there are thousands of people who have contributed to all of this work, and here's a small set of them.
Thank you so much, Amy. Very inspiring, and congratulations on the work. I'd like to invite our next speaker to join. And I'd also like to confess that I do not know how to pronounce your last name, Candace. So instead of faking it, I'm just going to ask you, how do I pronounce your last name?
Till, as though
Till.
it had no H in it.
Great. We had our staff desperately trying to figure it out, and we've actually found talks on YouTube where you've been introduced about 7 different ways. I'm sure you know that. So I'm extremely happy and now competent to introduce Candace Till, the Director of Learning Science at Amazon. Candace's team works to scale and innovate workplace learning at Amazon. And before joining the world of big tech, she was a professor of education here at Stanford. Candace, welcome again. Please share your screen and take it away.
Okay.
We can see the slides.
Excellent. So I'm going to be talking specifically about the context of workplace learning. And I will say that the challenges and the opportunities in education are similar as the things that Dan, Chris, and Amy have raised. AI can be a Trojan horse to bring learning science rather than intuition and historical accident into the design of environments. Lots of people in the business context also want to teach, but don't know how to teach or share their expertise. And AI can help them become better teachers and help with tasks that are difficult, like giving effective feedback and also improving their teaching process. There's huge variability in context, including access to tools and infrastructure, and the solutions have to fit that context, as Amy shared with us. And as we've all talked about, equity, AI can totally support equity in education, but learner voice and equity should be central to the design, and it has to be intentional in the design. Human learners in the workplace and in the world are extremely diverse. And they're not just diverse in dimensions of demographic diversity, but also in terms of their background knowledge, their skills, their goals, and the meanings that they make out of the learning experiences we present to them. So all of those challenges and opportunities, I would say, are pretty much the same between the education context in which I used to be all the time and the workplace context in which I am now. But there are also differences in the workplace context and additional opportunities from those differences. One of them, and I'll speak now to my current context, which is Amazon, is the rate of growth. Amazon hires about 350 people per day. And there are about 1.3 million people currently. And the learning experiences the infrastructure for learning design that I'm trying to design for Amazon have to support that diversity of learners. There's also an incredible rate of innovation and change. Old jobs go away, new jobs come in, and it's much better and much easier to reskill current employees than lose them. There's also an Amazon incredible internal talent movement. It's like a bunch of little startup cultures everywhere. So there's a lot of fluidity in people's roles and their jobs, and they are always looking for finding new projects that are a match for their current skill, but also have an opportunity for their growth and development. So all of these additional factors add additional opportunities and challenges to using AI effectively in learning environments. As my former colleague here at Stanford, Emma Brunskill, pointed out when I was talking about the context, she said, well, what you're working in is both a labor market and a university, because Amazon can essentially estimate the knowledge and skills that are going to be needed or are needed. And then they also have the capacity to support people to build those knowledge and skills. And then finally, to help people match their aspirations and their knowledge and skills with roles and jobs that need to be done. So there's a much tighter feedback loop between what skills need to be built and how to support people to build those skills. So let's talk a little bit about the technology that we're using to support these opportunities. As we've talked about, there's lots of powers of technology, and mostly in industry, people think about these three aspects of the technology: access and convenience. As was the case everywhere with COVID, everyone was working from home, but they still need to continue to learn and develop their capabilities. So with a computer, they can access that anytime, any place. There's also the capacity that you can do in technology, which is difficult to do in place-based classrooms, which is the simulation capability. You can use AR, VR, and other technologies to give people authentic experiences to learn from. And finally, the power of connection, that we're not, as Amy was pointing out, it's not just that the learners can be connected to the technology or connected to learning assets, but they can be connected to people, connected to other assets, connected throughout the world. And these three big powers are really where people are focusing, I would say currently, in workplace learning, using the technology to provide access, doing some interesting simulation stuff, although I would say not enough, and then using it to connect people. But as we know from this conference, this isn't the biggest power of this technology. The biggest power of this technology is what this conference is focused on. That when you're designing these learning experiences, you don't just use the technology to push them out. You use the technology to push it to an interface. Because in the interface, we can observe the learner interacting. And if you design the interface appropriately, you can observe the learner's interactions and make meaning out of them, model them to make estimates about the learner's state and other things, and then give good insights and feedback to the different human actors in the system. Now, this idea of instrumenting the learner experience and modeling those data, and then using those data, those inferences to give feedback, actionable feedback to the different human actors in the system, is not a new idea. This was the project that I started at Carnegie Mellon in 2002. This was the core of the idea there also. Use what we know about human learning to design the environments, and then use the power of collecting the data and making inferences to give feedback to augment the human actors in the system. The AI and the advances in AI have just made this model much more functional. So I'll talk a little bit, I was going to talk a little bit about the sciences, but Dan did a great job on that. So I'm not going to spend a lot of time talking about that. The sciences involved in human learning are the neurosciences, cognitive science, which Dan went deeper into, and then also the social and psychological sciences. And one of the things that Dan didn't mention so much, he was mentioning how the sciences should be informing the learning environment. But the other thing this technology offers is the opportunity for things to go in the other direction. That these technologies allow us to essentially introduce constant experimentation into the learning experience. And the online environment has kind of the best of both worlds of traditional educational research. You can have an authentic learning environment where people are actually trying to learn, but you also can have as much control as you can have in the lab in terms of controlling the conditions. And the advantage of doing this kind of experimentation in a workplace like Amazon is when I was doing this kind of experimentation, when I was still at Stanford in MOOCs, I could collect a lot of data about the individual learners' interactions. And so I could make inferences about what was going on just from the period of time that I could collect their interactions. In a workplace, I have access not only to their actual interactions, but I also have access to all the other data about them as learners that a workplace has, and also about the context in which the learning is occurring. And in order to really build a robust science of learning, we need to really start to understand features about the learner, features about the thing being learned, and features about the context in which the learning is occurring, and how those different features interact in order to make good instructional differentiation decisions. So for example, we can we can both do really good research in this context because we have lots of learners that have a high degree of variability that we can know a lot about, working in a lot of different contexts, learning different things. So it's great from a research perspective. And then from a practice perspective, we also can look at sort of the standard learning development process and look at where in this process can we augment human practice most effectively using the technology and using AI. And so if you think about these sort of four, this is an oversimplification, but basically when you're developing a piece of learning technology to support learners to build knowledge and capability, you have to think about what's the skill model, what's the learning model, and then what are the activities you're going to design, and in what order do you give those activities? Like, do you give them contrasting cases first and then lecture next, or lecture first and practice next? So that, and then the learners actually engage with whatever those decisions are that you made, and they generate these traces, which we can then model to give insight back to the humans who make different decisions then about the design and the sequencing of the activities. Now, so we can insert AI into any of those different processes. One experiment that we did recently was having a PhD student from Stanford come up and do an internship with me at Amazon, where we did an experiment where we replaced the instructor idea of selecting and sequencing activities with a reinforcement learning agent. And we were able to quickly do this experiment in that we just sent an email out to employees at Amazon saying, do you want to take a class in linear algebra? And within a very short period of time, we had thousands of learners that we could then randomly assign to condition, either the instructor sequenced condition, the RL agent condition, or the open navigation condition. And so very quickly can do this kind of experimentation and see what we can learn from that. In fact, we did learn that the RL agent did do the best in terms of improving learning outcome and minimizing the number of activities that learners had to engage in order to achieve that outcome. But that didn't mean that we made the decision there to suddenly just do all teaching, all sequencing and selection of activity by an RL agent. But because there are other considerations like balancing learners' sense of autonomy and agency in managing their own learning against the efficiency of the decision-making that the reinforcement learning agent could make. So, but we can use this learning to say for some parts of a learning experience, under certain conditions, using an RL agent to select and sequence activities might be a better intervention than either the open navigation or an instructor sequenced learning experience. So back to this, the key here is to look at this as a whole system, both what the machines can do and the algorithms can do and what the humans can do. And to really think about, for all of the practices and decisions that each of the human actors have to make in the system in order to optimize learning, how can we, what parts of those decisions can we have the machine and the algorithms actually support? So I will take questions. Oh, and I do want to say, because I know as we're collecting all of these data about learners, that the other risk in a workplace setting is that learners are both employees and learners. So we create a safe space for learners to let them know that the data that we're collecting, the inferences that we're making are there to give them insight to support their learning, but not to make other decisions about them as employees.
Thank you so much for sharing your work, Candace, and especially for that last point, which I'm sure could be on people's minds. With that, I'd like to welcome back all the presenters and my co-host, James. this has been really, really interesting, especially for somebody like me who is paid to do teaching. It's kind of fascinating to hear. I'd like to welcome everybody back. Thank you for your talks. And James, I'd love to throw it to you for the first question.
These are really great, and everyone knows I have a lot of research interests in these areas. So I have questions for everyone, and questions that are coming in are great. So I have one for Amy that came in from our audience. They said, in the context of the Global South, are there insights from your Côte d'Ivoire IVR study that are applicable to learning at the post-secondary level in other resource-constrained contexts? That was one part of the question. And then the other part was, are there some idea from CMU's other AI studies that you think might also be applicable to digital learning at that level?
Absolutely. Great question. Actually, the local ed tech company that we're working with there is working on developing a related version of this IVR technology for adult literacy. Côte d'Ivoire in particular has a very low percentage of adult literacy, and they see this as a tool that can actually transfer even more easily to that context. So particularly given that parents and adults are typically the ones who are the owners of the phones in those sorts of contexts where it might be particularly valuable, or there may only be one per family. Adult learning is something that is going to continue to be critical, as they may not have had those opportunities when they were children themselves. So there are differences, of course, between adult literacy and child literacy learning, but some of those same principles can absolutely apply. And I think that the physical infrastructure and human infrastructure lessons that we've learned will span across those areas.
Another audience question for Chris, but I'd be interested in everybody's thoughts here, is the you use teacher grading to train and evaluate some machine grading algorithms, but of course, teacher grading might be biased and may miss meaningful things about the student, the interaction, the outcome. And of course, the risk would be the worry that AI would then replicate these limitations. So where are we in thinking about this for your work? And then I'd be interested in everybody else's thoughts about bias based on faulty training data.
Yeah, so it's a good question. And so just to say it back, if we can't be intelligent and thoughtful about bias from the beginning, we will recreate all the biases that existed before when we're doing grading. So there's a few things that have come up in this space. One of the projects that people have worked on is, can you try and teach the algorithm more than the human knows? So can you teach the algorithm, can you tell it in its optimization from first principle, your job is to learn one of these definitions of fairness for being making your decisions. So when you're making your decisions, you need to know what fairness is, and you need to know how to do it better. So that's one approach that has been rather fruitful. And the student who did that has actually gone on to have a whole career in ethics and artificial intelligence. And then another approach has been to try and get more information that allows AI to make better decisions. So for example, teachers only look at the final product. But now that we have AI that can understand work, we have the AI actually look at the whole process of how students arrived at that final product. And just by getting access to more high fidelity information, then you can make more useful feedback for students. I suppose both those approaches seem rather interesting to me. And then, you know, of course, always looking at it. I think whenever you deploy any of this, like we're going to use it in Code in Place, and we have a whole team that is there to make sure that the benefits of this technology are going to hit all the learners in this class from around the world. So always be vigilant, and two good ideas, maybe.
I'm interested in the thoughts of others. These similar issues came up in the health section earlier this morning in terms of, especially as once you introduce these interventions, your training data, so to speak, will change and it'll be AI influenced. Has anybody thought about or worried about that?
So this is showing up in the non-AI world as well, right? Where there's always a concern that the SAT is not measuring what we actually care about, and it is unfair to those who have had much less opportunity. So this is a problem that's endemic to any sort of measurement enterprise.
I love that answer because it's exactly the same answer that we got in the health, where we said, look, there are so many other things that are creating injustice in the distribution of healthcare that although this may be one in the context, it might not be the biggest impact that we see. Thanks.
And yet, the one thing to be cautious about here is the scale. So something like an SAT is intended to be large scale, but AI has the potential to spread even further and to every learner. And so actually, James, we just heard a very interesting talk from your group from Denai Metaxa about algorithmic audits and making sure that we're doing regular evaluations, hygiene of our AI algorithms. And so one of the things that relies on is also, again, making sure that we get ever more representative data in order to feed into those audits and making sure we're not reproducing bias, which Russ might speak to your point of if we're continuing that loop, now we have access to the new data as learners are using systems and changing. And so we can make sure that we're ever improving.
Can I also just add one more thought? So I was really inspired, Amy and Candice, by your talks, because both of you spoke to AI that can help people who might not traditionally get access to what you'd imagine AI's powers being applied to. So I think there's a deep ethical issue in where we apply our AI. You can imagine one of the big problems we might run into is that we build AI that makes the rich get richer. So I don't know, I was really excited, Amy, to see about all the work that you can do to make maybe the people who, or maybe to use AI to make the gap in technology smaller, not wider.
Yeah, and also one of the things AI does really well is it reveals patterns. So we can, instead of just training a model and then implementing it, we could train a model and then look at what pattern does that model expose about how the system works, and then intervene on the implementation of that model to have it essentially mitigate the pattern that the standard process generates. Like you can introduce different weights or biases into the algorithm to mitigate the biases and weights that are in the data.
Yeah, I must say the training of all these models often exposes biases that are much more deeply embedded and not obvious. This has happened in healthcare, it's happened in, I'm sure, in education.
Absolutely.
Yeah, I think some of these questions about bias and policy also kind of leads into one question we got from a listener, and I'm going to give this to Dan since he's the dean. How should faculty and policymakers in resource-constrained countries and schools approach curriculum design in ways that, for example, they could incorporate things like your idea of contrasting cases, but with a focus on digital learning at the university level?
Would you ask that one more time in just a short sentence?
How do people in resource-constrained countries approach new curriculum design, like how to get things like contrasting cases as well as some of the AI technologies into their digital learning at the university level?
Yeah.
Like how do you do it if they don't have a lot of money for it?
Right. So you saw, so this is complicated. There's a project going on right now that's making virtual field trips. And the goal is to make these field trips have shared adventures, the kinds of things that happen. And someone said to me, if you succeed, the consequence is the poor kids are going to take virtual field trips and the rich kids are going to take real field trips. Right. So it's not obvious to me that the rich get more technology is necessarily the final state of this. So the kinds of things I'm talking about are pretty refined as you make the AI. The kinds of things that you're worried about at scale are just big chunky questions of access. Can you get them to the table, right? And so these are big problems, and they're sort of made complicated because ed tech is a very tough place to make money, or it has been, right? And so if you're a teacher, you go to the app store and you just choose a technology and you expect it to be free. Well, if it's free, then there's nobody pouring money in to make it better, right? And ensure that it has quality control. So this is kind of an ongoing problem, you know, and I don't know that AI is the solution to this, but in general, if you try and do these things without a financial incentive, you run into lots of trouble. But if you put in a financial incentive, it's going to make it tough for the poor countries to be able to get it. But in any event, you know, the simplest solution is cell phones have opened the gateway for a lot of special stuff that you could do at low cost, and AI is just a great way to deliver it.
I also, just to add onto that, think that the COVID pandemic has really opened up the landscape here, where many universities in low and middle income countries also had to serve an enormous amount of learners, oftentimes online. And so Dan spoke about the financial models. Right now, the MasterCard Foundation, for instance, is working with a large number of really excellent African universities to make sure that their transition to online materials is leading to very high quality experiences that are reaching even more learners than they would have expected to previously, those in refugee camps, those who are displaced. And so I think this has actually, in some cases, really opened up everyone's eyes and funding models also for this to happen in many more places around the globe.
Yeah, and the only concern about that is as we open it up and make it more available to people around the globe, to make sure that the science gets inserted, as opposed to people thinking, oh, I know how to teach, I'll just make a MOOC and make that available to everybody.
So it's interesting, you know, I read a report that Uruguay did not, the learning rate of the students didn't flatline. Like in the US, during the spring and summer, reading scores just flatline. And now they're rebounding. Uruguay, that didn't happen. And the best thinking on that is they had already invested in digital technologies for learning, that they were committed to this before COVID. So they were in a position to take advantage of it. So if groups now become prospective and try and plan, you know, I think there could be a lot of good things that would happen.
I guess a fear I have is that COVID, the rush to online for COVID, then people think their prior knowledge now is online is not as good as in person. And so what we need to do to get education back again is get everybody back in person doing what we did before COVID. It's like, let's get back to normal, instead of what I think a lot of us were hoping is that this creates an opportunity to change the way we're doing teaching and learning.
It's very interesting because in the healthcare discussion, patients love not going to the doctor unless they absolutely have to. And doctors actually don't mind talking to patients over Zoom as long as they don't need to have the patient in front of them. And so it's a little bit of a different dynamic in healthcare. And I think I take your point that it would be nice if there was a little bit of that going on here. Partly it's who holds the decision reins. In the case of children, what the children want might not be the thing that drives the day.
Or even in the case of higher education students or workplace learners that are adults, it also what they want or what they might think is the best way to learn may not actually be what supports their learning the best. Like, I think if you took any of Dan's studies and you surveyed the learners before the study and asked them, which do you think is going to be most effective, everyone would guess wrong.
Maybe I'd jump here and say, I think on some level, though, learning's such a deep social activity, right? Like, we're talking about something that's core to just who we are as human beings, passing on. I have a new daughter, and I feel like one of my main jobs is to teach her, right? And just this process of teaching her, it's one of the things that makes me human. And I think one of the things that seems to have happened in the online learning world is it somehow became less social. I don't think there's a future of education where we remove that social. And sometimes I've seen education AI projects that's tried to make a future of education that is somehow not social, right? You're just going to go online and learn from your AI tutor. I think if we don't figure out that social human part, people won't want to do it. It doesn't matter where in the world you are.
So kind of related to this discussion, this has been a really, I don't want to cut this off because what we were just saying is really, really fascinating. But Candace, one of the questions came from the audience about any lessons that you learned or surprises moving from an explicitly educational environment at Stanford with undergraduates and graduate students to an organization like Amazon where learning was important, but it wasn't the explicit 1 goal. Any surprises or differences, or are they remarkably similar?
They are remarkably similar. I guess the thing that I was surprised about was part of why I thought Amazon would be a great place to make this transition was because of that core capability at Amazon, which is you take core business processes and you instrument them to collect evidence to give insights to the human actors in the system so they can make dynamic real-time decisions that continuously optimize the system to innovate for customers. That's kind of like the lifeblood of Amazon. So I sort of expected when I came there so I came in and said, okay, we're going to try and accelerate learning. What's the data we have now about how effective all of these strategies are that you're using to support learning? How effective are they now? So that I can see what our baseline is. And everyone looked at me like I had 5 heads. And I think that is because people have a special place in their brains when they think about teaching and learning that's separate from everything else in their life. Everyone thinks, I know how, I've been a teacher, I've been a learner, I know how it works. So this idea that you might need to collect evidence about what works and doesn't work, and that things might work differently in different contexts for different people was kind of is still an idea that I think is challenging for a lot of people, and a lot of people in education too. What's been workable is to give that analogy, to say it's a core business. Developing the knowledge and capability of the employees is a core business process. And so we should instrument it and understand what works for whom, under what conditions, when, learning what kinds of things, so that we can give those insights to the different human actors in that system to make that process more and more and more effective. And ground it in the science of what is already known about human learning. Start from there. Don't start from how I've always taught or how I've always learned. But don't just start from intuition or history.
You touched upon this in your talk, but how difficult is it to really have the trust of the employees that these instrumentations of their learning performance won't bleed into the instrumentation of their job performance?
Yeah, so right now the learning environments that we're building are in a specific location, and we tell the learner right up front what will and will not happen with their data when they engage with that. And the basic message is that this environment, what's required of you is to build the knowledge and capability. It's not required of you to take this course. There's not a mandatory course that you have to take the course. So you're not just trying to complete taking the course. Your goal is to build the knowledge and capability you need to build. And lucky for you, these courses are designed to support you to do that. And we're going to be collecting these data and making inferences about your current state relative to your desired state, so that we can tell you how you're doing and also make suggestions about places that you could go, things you could do that would help move you to your desired state faster. Those data and those inferences are just for you.
Mm-hmm.
That is wonderful that Amazon is able to promise that, because this is one of the biggest challenges that we've seen in the work where we're looking at professional informatics, is absolutely the concern that this will be evaluative and oftentimes distrust of the system in which the employee finds themselves, in my case, teachers.
Right. Yes.
Chris, I don't know if you've seen this as well, but maybe your teachers, the participants are more informal, whereas mine are getting paid and that is their job.
I think there's a question about a little more of the detail on that, Chris. So one of our folks in the audience said that, what kind of feedback do you give on code? I think they had a misperception that you might just say, oh, it works or not. And so I think saying, for example, because I think this is really what's been innovative, is what kind of feedback could you give? But then the follow-up to that I think was really more important from this questioner was, how might you achieve comparable insights into teaching humanities or other less structured domains?
So, okay, I love the question. I'll just jump into the first one. The sorts of feedback we're looking for are hopefully deep ones that could help you grow. So we don't want to say your program doesn't work. A lot of programs that don't work, unit tests can tell you it doesn't work. That's not what's surprising, and that's not what's hard. What's hard is to find out, like, what is the concept you're missing? So the sorts of feedback we're looking at are, you have an off by one error, and here's what an off by one error means. That's the sort of feedback that we want our AI to give. And for the humanities, we think of ourselves as on a spectrum of complexity of tasks. And code is somewhere in the middle, right? It's certainly easier than poem, giving feedback to somebody writing a poem, and certainly harder than giving feedback to somebody just writing a simple math equation. Though interestingly, the statistical properties of code follow the statistical properties of natural language pretty closely. It's just like, you can think of it as easy English. Giving feedback on English is brutally difficult. Code is like an easy version of English. It's like, has a lot of properties of language. It's just a smaller you can think of it as a smaller set of tokens from which you're generating your language. And we're making progress towards that. But I would feel very skeptical if somebody said, I have an AI algorithm giving feedback on an essay, just basically because I'm deeply and painfully aware of how poorly AI can really to its core understand language and English. So an important goal and project, but something that we need to work towards and be cautious about how good our results are at the moment.
James, I have a question for you, since you asked the question. It's not obvious to me what is the quality of the humanities that's going to make it difficult. Is it, oh, there's no true answer, whereas programming there is? Or is it that the way humanities are taught, there's less interactivity, so there's less data to be able to make decisions? Do you have a sense of, you may have heard this question before.
Yeah, so I mean, I would say it's not just the humanities. I would say in lots of domains where the task doesn't have such formal structure. I mean, programming is almost underlying it like math. So there is this structure that you're able to take advantage of to be able to see what's wrong and get that insight. And a lot of other problems maybe don't have such a structure to take advantage of for the machine learning and for deducing these. And so the question is, how might you find some structure that would be useful in that way? I think is one of the things, but I think it's an open question for Chris, and I want to keep pushing him on it because I think that's the wave of the future, is how we get to places like that.
So I can give you an unsatisfying answer that's in the right direction, which is, we tried to have some AI grade in a context where students could make any program they wanted. So the idea was, be creative in your program. It's not do what we say, but just do something that celebrates what you've learned. And obviously this was really hard for AI, but then, whenever you take a problem, you dig deeper into it, there's something interesting to be done. So now we have our AI playing with every single student's work, and to try and figure out, while I'm playing with it, can I figure out which ones are somehow sparking my artificial intelligence joy? It's not getting towards deep answers in humanities, but maybe it's a step in the right direction.
I believe that AI intelligence joy needs to be tweeted immediately by somebody. So please do that, someone. So I love this question from the audience, because we're getting to the end of the day. Are we in jeopardy of AI really replacing? This is about augmentation, this conference. Is the replacement of teachers a present danger and present worry that you as professionals are worrying about? Or is it just something that people talk about, but you don't see it anywhere near? Because people in the question, they were referring to governments that might be tempted to cut their education budgets, et cetera, et cetera. So how much of a danger is this? And what kind of attention should we be paying to it?
So there are crazy people all over the place who are going to propose all sorts of stuff. There's a school that I kind of like what they're trying to do. And what they've decided is, for 3 hours a day, the kids only learn sort of very rudimentary basic skills on the computer, the kinds of things that are repetitive and so forth. And then for the other 4 hours, they just do enrichment projects, and the teachers take charge of that. And so they've sort of decided, well, the AI is going to be good at this thing that we really don't need humans for, but this other stuff we really need the humans for. And so we're going to put them there. So that's an interesting sort of hybrid solution. But it's just maybe you get an AI robot that can handle a classroom of, first graders. I'd be really impressed.
I do think this is a really important question, though. So I showed a graph in my talk that showed that our learners were using our system equally during a teacher strike as they were during a normal schooling period, compared to the holiday where the parents thought they should have off. And for the parents, this was critical. Their children had no opportunity to be in school to learn for 2 months of the school year. And that's an enormous lost opportunity. For the teachers, this could be viewed in a much more negative light that, the teachers' needs were not being met. Their demands for higher pay or for a better status were being supplanted by parents' ability to find alternatives. And so I don't think there is an easy answer to this, even though I think it is not the case that my system or any system is replacing teachers and in any near future situation. However, it is not one that can be dismissed easily when these systems are so complex.
Amy, out of curiosity, did the teachers and parents have that conversation in the context of your study?
Well, so this is a very, a context where you have to understand all the rest of the context. So in this location and in several others that are like it, parents also often spend what little extra money they have to engage tutors or other learning supports after school when they believe that maybe the children aren't getting everything they need in the school day. But then also that starts a market for teachers themselves to be paid as tutors after school to supplement what was happening in the school day. And so that in this case, the teachers did not actually mind, and they told the parents, we'll work with your children with the technology, and we'll do it outside of school. So this particular instance didn't cause any conflicts. But as you can see, it's a larger system that's broken. And so introducing the technology has interesting ripple effects on how that works.
Can I throw in a hot take? I don't know if we have time for this, but AI replacing labor has been something that's been on all of our minds, right? Can you imagine a future in 200 years when there's a lot less work for us humans to be doing because AI is really good at it? The one thing that we're going to need is human teachers, I think. In 100 years, we're going to need to be inspiring each other and teaching each other what it means to be human. I think it's actually the one thing that's going to need more humans as we get into a world where AI can do more laborious tasks. It's the thing that scales with number of people the best. So I can imagine a future where, we're going to need maybe 1 in every 10 person is engaging in teaching in some way. I put all my money on that one. I don't put any money on.
Chris, I'd like to challenge you just a little bit.
Okay,
that
please.
I'm not sure teaching is the only thing that can't be replaced. I think
Yeah,
parents are
sorry.
still pretty important. But
Thank you.
But I like your point a lot.
Well, and it also questions whether teaching will be a paid profession or whether it itself will transition. So there are lots of models being proposed such that anyone can teach, as you know, and they may just need to be supported by some technology. And so I think that it's interesting that you bring up the labor question, because certainly teaching is fundamental to the human experience, but whether or not that continues as within the labor force as a paid profession, I think is a different question entirely.
I think this this replacement question is one of the important themes of HAI and how we're focused on how do we augment rather than replace. But this is going to happen in many areas, and it's really important. So, one of the people out there, for Candace especially, said, how will AI for education be prepared in time to address worker displacement and help retrain the workforce when all that displacement is in itself maybe due to AI? So do folks want to comment?
Yeah, exactly. So when I was at Stanford and Carnegie Mellon before it, and the Chronicle of Higher Education would write about my work, they'd always put a big picture and say, and the headline would be something like, "She's trying to replace us with computers." And that would be the lead. And what I used to say when people would lobby that at me is, well, frankly, any faculty member who can be replaced by a computer should be. I stopped saying that in faculty context because it didn't get the response I was looking for. What I was trying to say was, if you're truly being a faculty member or a teacher, the things that you can do are so much more robust and important in the relationship aspect and the supporting the learners aspect than any computer system that we can currently build. That if that's all you're doing, then you're not actually being what I would think of as a faculty member or a teacher. The other side of that is, at least when I was a faculty member, not so much at Stanford, but I worked a lot with community college faculty and faculty at other institutions not as privileged as Stanford. And I looked at the task that faculty members were being given to do, which was educate hundreds or thousands of learners with huge variability in their background knowledge, in their skills, in their goals. And the classes are getting bigger and bigger and bigger and bigger, and the time is getting shorter and shorter and shorter, and the amount of information, the number of skills that people have to learn is getting bigger and bigger and bigger, and it's not a doable task. And it's not fair to be asking teachers and faculty to address that new context without giving them better tools. And that's what I think about this AI augmented teaching to be, is giving teachers better tools so they can do their profession better in this very changed context where the demands on their expertise are much greater than they were in the past. So do I think that these computers will replace teachers? No, but I think they will allow many, 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 many more people to have access to a high quality education, and allow many, many, many more teachers to be able to focus on the stuff that they really love to do and can do best.
How about the workforce beyond the teachers, though? How about the delivery drivers, the warehouse workers at Amazon and other fields? I mean, is that where the action should be to help those people?
Oh, absolutely. And at Amazon, that is a lot of where the action is. As I said, I'm building systems that are supporting all Amazon employees. That isn't just the most advanced machine learning scientist at Amazon, but also people who are in the fulfillment center, not because they chose that as their career, but because that is a good job that they could get. But that's not necessarily what they want to spend the rest of their life doing. So can we provide opportunities both to support them to reskill or upskill to get roles outside of Amazon, but also have really clear pathways within Amazon. So if you're starting, and so if I can have a good bead on what your current knowledge and capabilities are, and I also know for all of the different roles at Amazon what knowledge and capabilities are required, then when you're thinking I might want to do something different, or when your role is being eliminated because of automation, then you can query, what are some options for me? And the system can help suggest things that might be close to what you seem to be able to do now, that require some additional skill building and capability development, and then recommend assets or opportunities that will help you build those skills, and then help support you and tracking against how am I doing about building those skills, but also support you to make changing your decision. If you start that path and you think, oh, this isn't what I really want to do, this kind of sucks. What are now, but I now have new skills. What are some new opportunities that are available to me? So that's what I mean about using the AI to support the different human actors to make good decisions about their own learning. And that includes learners making good decisions about, what is my current skill set? What's my desired skill set, and what might be some things that I could do to help me move from my current skill set to my desired skill set. But really focusing on human autonomy in that decision making, supported by the AI.
So Russ,
Yes.
I know you're a futurist. I don't know if you can look backwards as well, but do you think when the book showed up, people were asking, will this displace teachers?
So I bet you, I don't know, but I bet there were people who were threatened by the introduction of the printing press and who said, this is not good. And who's going to retrain me?
Or that the TV was going to.
Maybe the monks, right? The monks are the ones who were the big, the monks took the big hit. Actually, okay, so that actually leads me into my question for Dan. Thank you, Dan, which is a little bit on the economics. You said during your talk that people often expect educational technologies to be free. And, you know, we have to consider the public education system in the United States, which is not known as an incredibly well endowed, or I don't think of it that way. But so is this going to be deployable in large, and this is a question for all of you, are these technologies going to be realistically available to public institutions versus mostly available to well-funded private institutions?
Why?
I wanted to end with an easy one.
Yeah. I'm sure there are people who are going to try and make lots of money and corner the market. At the same time, if you're a teacher and you have a computer and a projector, you use YouTube. Everybody uses YouTube, and it doesn't cost the teacher anything, right? And so that's a different model, that the tools themselves are so usable that they'll try and find other ways to finance them, but get them in everybody's hands.
I have a question that's come off from a few people, which said they noticed that AR and VR haven't come up in any of this conversation. And they want to know, what are the best places for those technologies in the future of education? I know Dan's doing some of those things right now, so maybe you could say a little bit.
Yeah, well, I think we're just figuring it out. But you know, a lot of good learning is experiential, right? And so you want to, which is hard to do in classrooms, right? It's hard to have sort of experiential things. And so AR and VR are going to be very good for that. Right now, people look at VR largely around training, things that have a large perceptual component or a social component. But I think you can begin to open it up. AR is really interesting. You know, I don't know where that's going to go. The idea that I can walk around and suddenly see a prize hidden behind a rock that has a question for me to memorize a vocabulary word or something. But yeah, I think it's the experiential quality. And so there's another thing that came is just computer simulations, this ability to engage with a simulated MRI machine, right, as a way to learn about neuroimaging. This is fundamentally new. You know, you couldn't do that 20 years ago. The computer wasn't capable. Where will AI slip into that? It's interesting because they produce a spectacular amount of data. But because they're experiential, the degrees of freedom for what people can do in there is very broad. So I think it's a next space to move, is the technology. You know, now it's in the hands of everybody. With I just played one of those games, and it was like I took the mask off, and I was like the commercial where I went, whoa, you know. And so there must be ways to use this really effectively for learning things, maybe not algebra, maybe not programming, but maybe other things that really depend on experiential component.
So I mentioned it very briefly, in one of the directions we are going with teacher support is actually enabling teachers to, you know, sit in the back of their room and feel what it's like to have that experience of being the you know, student who never gets called on or who doesn't participate. And I think that Dan's right, that's the real value here is perspective taking experiences. And that's where VR is going to solve a real need, where in many other cases, you know, it's not something we need in order to have the best quality learning of that topic.
Yeah, that's a really great one, because I think we saw a talk in our HCI seminar a couple of weeks ago from one of your junior colleagues who really showed some great stuff on that from his PhD dissertation. So it was really nice to see.
Yeah.
I mean, it's also a great opportunity for doing contrasting cases, because since you can manipulate the reality, then you could introduce the significant differences that you want people to notice, but not have it be so obvious. It's like looking at the pictures of scissors. It would definitely support people to get better at noticing the deep structure differences in the context that you're trying to get them to understand.
Learning to recognize poison oak. I prefer to do that in VR.
Yeah.
Yeah, or your surgeon's first surgery.
Yeah. Yeah.
There has to be a first, and you don't really want to be the first.
But it is, James, it really is an interesting problem or opportunity. Here's this thing that just didn't exist before. How are you going to use it? So I'm collaborating with a cardiologist who's made it so that you're dealing in virtual reality, immersive with a heart, and you can go inside the heart. Like there was this old movie, Voyage, I forget.
Oh,
You go
yeah.
inside and you can sort of see, oh, there's a perforation, and that's the way the blood flows. And it's unbelievable. And we're busy saying, well, this has to be good for something, but we can't figure it out.
Actually, with that, also a tweetable moment, I think we should bring the panel to a close. It's been a fantastic discussion. I want to thank you all for your contributions and your talks and the really fascinating discussion that's gone on. I think we'll move to the closing out with James and me. So I will thank our panelists and excuse our panelists. And James, it's been quite a day, and I don't know if you feel like summarizing it or not. I did see themes, but I think that probably our audience and our colleagues listening in heard the same themes. But would you like to say anything as we end up today?
Yeah, I thought there were some things, both common themes as well as interesting surprises that came out. So one that I thought was quite interesting was this thought about how AI systems are going to need to deal with training data. Eventually, that's going to come from AI systems that are deployed in the field, and how a lot of the AI designers are maybe not yet aware of some of the issues that's going to raise, in addition to the usual problems of just trying to deploy real systems. So I thought that was an important learning that we had some really good comments of, especially from the health panel. And another thing that I think we heard both in the art and the health and here in the education is that for AI to successfully augment people's lives and their work or play, that the practitioners of these fields have to be part of the conversation. So we need to do real, what I would call human-centered design or human-centered AI design, and involve these folks in the design from the start if we're going to truly be able to get to augmentation. And we saw that very clearly in the music domain there, where we had Carol working with Grammy-winning violinists as well as these other experts in that field to try to come up with their ideas. So I thought those were really important things that came up multiple times that I thought were really interesting.
Yes, and I thought that I was also very happy to see the importance of diversity, fairness, and justice, which almost go without saying, but where in many parts of our society we have not delivered. And so to have those be an integral part of all three of these discussions is not the answer, but it's definitely a good start and in the right direction. Your closing thoughts and comments.
I think there were some of those bigger themes that were underlying a lot of these that I think we as a field need to really watch out for. So things like privacy of the data came up in a lot of places. The agency, if we're talking about this being augmentation, is there agency with the human? Though we even saw some cases that Eric Horvitz talked about in medicine where maybe sometimes the agency is on the machine. And so trying to figure out, when is it human in the loop versus machine in the loop, and what does that mean? I thought these are really interesting questions that, again, we don't really know the right answers to, and so they're really great research questions for the junior researchers out there, the graduate students, the undergrads who are jumping in these fields. These are great questions for folks to start thinking about PhD dissertation-like work, and there's going to be a lot of good work because I think we have a lot of great questions. So I want to wrap with that. I think I want to say I sincerely hope that our audience enjoyed their time today, and we want to hear how we can improve. So those who registered will receive a survey in the next day or two asking you what you liked, what you don't like, how our next conference can be better and exceed your expectations. And I think it's going to be really good. We're going to be focused a lot on the policy and other impacts of AI and how we might rein it in, and they're going to really question some radical ideas on that, and I think it's going to be fun. Also, if you want to learn more about HAI and our work, you can rewatch this conference video, because I know some of you had to pop out and do your job or get lunch or whatever. But you can also attend our weekly seminars. They're online, so you can get there. You can see all this stuff on our website at hai.stanford.edu.
I also want to give a big thank you to our dedicated HAI team who made this conference possible. Deep Ganguly and John Robichaud, our directors of research and education, were watching the questions and feeding them to us. Our communications team, Stacy Pena and Shauna Lynch, were critical at all stages of planning. Thanks to Stanford Video and Gordon Gurley in particular, who produced the live stream. And a special thanks to the Queen of Media at HAI, Celia Clark, our events manager, who shepherded us beautifully and gently through this event from start to finish. Please mark your calendars for the fall conference, Governing AI, 4 Radical Proposals for a Better Society. That will take place November 9 and 10, 2021. Thank you, and see you next time.
Thank you.